Good morning, everyone, and welcome to the second day of this conference. Yesterday, we had a fantastic day, a long day, lots of interesting talks and exchanges. We also had a fantastic dinner for those of you who were there, with nice company, vegetarian food, live local music, and we learned and danced Estonian folk dance. Thanks to Hans again, who is not only able to organize a conference, but also to make a great party. I think it will be a night to remember, and the tail dance that we did was a true part of connecting climate change and health people that is in line with the spirit of this conference. I'm sure you talked to new people yesterday, but use the opportunity today as well. We have a very nice group of people here. I think we are bringing people from across so many parts of the world. Yesterday, Hans mentioned a number of countries, but I would like to go a bit more in detail because I think it's really nice. So we have people from Ireland and India. We have people from Japan and Cyprus. We have people from Sweden and Switzerland, from Burkina Faso and Botswana, South Korea and South Africa, and Ukraine and the US. Thank you so much, all of you, for coming here. The program today is again an intensive program with a lots of interesting talks. We will start this morning with the second keynote panel in a very short while. After the coffee break, we will have two parallel sessions that will take place here upstairs, as yesterday, with lunch in the middle. After that, at 3 o'clock, between 3 and 4, we will meet for coffee, not upstairs here, but next to the poster room downstairs. So there will be a second chance to view the posters for those of you who haven't done that. And I think now today, probably all of you know the way there. If not, ask one of your new friends. Then we will meet again here in the plenary for a final discussion called Resilience Redefined, Climate, Conflicts and Global Priorities. And then we close for the day. And for those of you who are staying tomorrow, we meet at 9:45 for one of the two trips. And if you have not signed up, I think Hans has said that there are still more places, so you can still join us. Just a few practical things before we start with the keynote panel. We have taken photos and the session in this room is streamed, so if you have any reservation to this, please talk to me during the day. If you have not sent your presentation for today or uploaded it in the system, please do so as soon as possible so the session will run smoothly. We have also, you might have seen that we put up some notes with the QR codes for a little survey about the conference. Please take a few minutes to help us to give feedback so we can organize the next conference with this, your inputs in mind. And remember the bell, you know what to do. And now I'm very honored to have here Professor Chris Eibay, who will lead the first keynote session for this morning. Welcome, Chris. The floor is yours.
Good morning, everybody. Thank you for coming up from breakfast. I'm sure many of you had a late evening. I heard it went till about midnight with lots of vigorous exercise. Sounded like it was a great time. We've got a great panel for you. I've got a small apology at the beginning. I put together my abstract and wrote my presentation before I realized that half of my presentation is on detection and attribution, and there's a whole session on that this morning. So if you'd like to hear more, please do the session, but I will start and go through and talk a little bit about detection and attribution. And this is all framed in the context of how do we know? When the first IPCC Intergovernmental Panel on Climate Change report was released all those years ago, there was a lot of pushback from what today we would call skeptics, asking, how did you know? And that was incredibly helpful for the research community. it pushed the research community to really start thinking about how do we know? And I'm going to talk about two aspects of that. The first is detection and attribution. And that question of how do you know went to the climatologists. This slide and the subsequent slide are from Ben Santer, the father of detection and attribution. And he started his work as a PhD student, a postdoc, trying to develop methods, building on what had been done before. And the bottom line is these are sophisticated statistical tools. And they get to the core question of, can we detect a change? And if we can detect a change, then how do we know that it was because of climate change? All of the headline findings from Working Group 1 and the IPCC, not all of them, but the very headline findings from the IPCC over the multiple assessment reports have come from detection and attribution studies. And there's now chapters on detection and attribution. And the final comment on this is health has been involved since 2007, when there was an IPCC expert workshop on detection and attribution that Shari Kovets and I attended. And so this shows you, if you could read it, it's easy enough to look at online, but apologies that those in the back can't see this. But it just shows these headline findings on how, from the first assessment report in about 1990, the statement was, we don't know. It'll take about 20 years or more before it'll be possible to determine if the climate is changing. And it'll take even longer to determine if it's human-induced change. And in fact, the rate of climate change has been so fast that this has happened a lot faster, and we get to the last assessment reports stating it's unequivocal. Detection attribution basically does what the name implies. I can skip that. This looks a lot better on my computer, and it looks a lot better in the paper. Not sure what language that's supposed to be in. The key point on this is that conducting detection and attribution studies is multidisciplinary. And you start by partnering with someone in meteorology or climatology, and you sit down and spend time to frame the question. The question has to be framed around what's understood about a particular extreme event, for example, and what kind of health data are available. And it's that joint decision-making. Are you going to look at the intensity of the event? Are you going to look at the return period for the event? How are you going to define when an event starts and ends? Information about the geographic scale that you're going to look at. All of those are joint decisions because the two communities have lots of work to do to determine whether or not there was a change that resulted in that particular event and the extent to which that change was because of climate change. That then needs to be paired, of course, with the health data to be able to make statements. I'm talking about this, and there's a session about this, because this is a powerful shift in our community. That the last meeting that you had, most of the discussion in climate and health was around associations. Associations between heat and health, associations between precipitation, diarrheal disease. But now, using detection and attribution, we can start stating how many people are dying because of climate change. This makes climate change a here and now problem for ministries of health. I'll use the heat dome that occurred in the Pacific Northwest a couple of years ago as a quick example. This was an extreme event. There was a rapid detection attribution study just after the event ended that concluded the event was virtually impossible without climate change. It took, as is typical in the United States, about a year to get access to the death certificates. In the end, there was more than 440 excess deaths. These are 440 people who died because of climate change. As you can hear, that's a different statement than people are dying in heat waves. This is people are dying because of climate change and what climate change is doing to the intensity of heat waves. It's also an opportunity when you look at these events for multidisciplinary interactions. The event was so extreme that during low tide, the estimate is more than 1 million mussels, clams, and oysters were literally cooked. This is food security for coastal tribes. This affects our industry, and it's an opportunity to look more broadly at the overall societal impacts of extreme events. I don't see Anna at the moment, but Anna Vicedo led just an outstanding study that matched data sets, the data sets from Antonio's group that he put together and from a detection attribution multi-model intercomparison program, looked at more than 700 locations, 43 countries, concluded that over the last several decades, overall about 37% of heat-related deaths are because of climate change. This hopefully is a little bit more legible. This was a study that was just published, Anna, Rupert Stewart-Smith, and others, looking at a case specifically in Zurich. I mentioned this because it was critical to inform a lawsuit from older women in Switzerland who said that the government was not doing enough to protect them. And they won that lawsuit, and it was based on detection and attribution analyses. I'll just say, in the interest of time, I'll skip most of this, but this also can be applied to other kinds of issues. Gradual changes in temperature, for example, are leading to increases in the geographic range, seasonality, intensity of transmission of a range of vector-borne diseases. And this is a powerful example last year from the Americas of dengue. And there was a detection and attribution study showing that in that region, 35–40% of dengue cases are because of climate change. So I encourage you to go to the session to learn more and think about taking up detection and attribution, because it will be very powerful for moving our agenda forward. The other part of how do we know is around scenarios. It's the other end of the projections that this community makes of what could happen in a changing climate. I assume all of you know about the representative concentration pathways. I hope you do. If not, I'm more than happy to answer questions a little bit later. Parallel to the representative concentration pathways are the shared socioeconomic pathways, and these are visions of socioeconomic development to the end of the century without including climate change. There's 5 of them because there's been a tendency for regression to the middle, and we wanted to make sure that we filled the scenario space. The SSPs and RCPs can be paired to develop full scenarios that can be used for analyses. This particular architecture came out a little over a decade ago, and there's tens of thousands of papers using it. Very few papers in health. I put this in to amuse those of you who do work in this area. This is a simplified diagram of the integrated assessment models that generate the RCPs, and so this is what people show about the different interactions in the IAMs. In fact, that's what an actual IAM looks like. They're incredibly complex models of world economies. A couple of points on these. One is that when the SSPs were put together, there was an assumption that they would be similar to the prior set of scenarios that were internally consistent visions of the future and were predicated on socioeconomic change, from which was derived the emission change. But in fact, it was discovered quite early in the process that there is a disconnect in the world between socioeconomic change and emissions. That is, we can have lots of people in the world, everybody uses green energy, so you don't have this close alignment between population and emissions. Same is true for GDP, which is part of what set us on this pathway. So the SSPs include a narrative and quantitative elements. Not sure why that was there twice. There were efforts to define what are challenges to adaptation, what were challenges to mitigation, and something completely went wrong with this because that's not what I said. But anyway, so there's been a lot of effort to try and further develop this. This is another figure you can't see from the back. It was an effort quite a few years ago to take a look at the SSPs and what they mean for health. And I'm absolutely delighted that Wellcome is funding IASA, the International Institute for Applied Systems Analysis, and the University of Washington to extend this work. And we just started over the summer to start further exploring what the SSPs mean for health so that we can create a toolkit that the modelers in the audience can use. All of the text on that disappeared, so we'll skip that one. It's kind of interesting because my presentation looks different, and just point out that as we think about the future, we do need to think about using scenarios. And there's lots of opportunities in the community to start producing more robust projections. Many of the projections right now rely almost exclusively on exposure-response relationships and temperature change, but population is changing. Demographics are shifting absolutely more rapidly than the population division's keeping up with. Urbanization, how we urbanize our cities is going to be critically important for health. There's a whole range of other factors that need to be taken into account to produce numbers that are more believable by policymakers so they'll be more willing to take decisions. Thank you very much for listening. And I will hold questions for me till the end because I'd like to get through all the presentations first. And I'm delighted to introduce Dr. Alex Inderantny. I can mispronounce anybody's last name in any language. It's one of my special skills. So I will practice that this morning. But Alex is from the commission, and he's going to talk with us about the climate and health agenda that they put together. And I've got my phone here.
Thank you so much. Thank you, Chris. It's Indrayanti. It's Indonesian, so I don't blame you for not knowing how to pronounce it. No worries. Thank you for having me here. It's a pleasure to be here. It's a pleasure especially to be here because I got on a very tiny plane yesterday to come here, and it was one of the most terrifying flights of my life. So I'm so glad and relieved to be here safely on the ground with you. So today I come from DG Research and Innovation, so I'm kind of in between the real heavy policymakers and the research community. And today I want to talk to you about European research on climate and health. I assume there will be a lot of European climate and health researchers in here, so I'm not sure how much I need to present to you, but just to give you an overview of what we have been funding and what is in the pipeline and where we're headed in these, let's call it, uncertain times. So first, I want to take a little bit of stock about what we've been doing. But before, I want to contextualize it a little bit. So I call climate change the health crisis that keeps on taking. Because it is. In 2023, extreme heat killed nearly 50,000 people in Europe, and almost around 300,000 people die prematurely every year in Europe due to air pollution exposure, which of course is exacerbated by climate change. Climate change has led to a clear increase in the incidence of infectious diseases. It has driven malnutrition around the world, with projections pointing to figures north of 90,000 annual deaths by 2030. And the worst is that even with proper adaptation measures in place to protect people, protect our communities, there may be additional risks that emerge in the future. So climate change and health is a massive issue, and it's a massive challenge to tackle. And it's part of a larger challenge, which is protecting people and people's health from environmental risk factors, and environmental degradation. And in the last 2 decades, the EU has actually funded quite a lot in this space, around 3 billion, almost 3 billion euros in environment and health research. But if you look at the proportion of that, or the share of that has been dedicated to climate change and health, the story is very different. So historically, this has been an underfunded area. In the 7th framework program, which ended in 2013, a total of 41 million euros had been spent on climate change and health research. And its successor, Horizon 2020, which ended in 2020, hence the name, dedicated 77 million. And if you don't have the greater context of what we've been doing in the last couple of years, then you would think that these are quite significant numbers. But if you look at the figures for Horizon Europe, the current program so far, because we're halfway through or a little bit over halfway, it was 146 million. So you can see that there has been a substantial increase, and again, the program is not done yet, so there will be more funding on the way. The program is expected to finish in 2027, but projects that are selected towards the end, they will keep running into the next decade. This is 2 pie charts just to give you an idea of what I was talking about. So climate change and health research is one of the kind of categories that we have in our portfolio, and you can see it in the lightest shade of blue. And you can see that now it is one of the better funded areas. It's the 3rd largest share of funding allocated under Horizon Europe. If you had looked at these figures 4 years ago, 5 years ago, it would have been a very different story. You would have seen a very tiny sliver dedicated to climate and health. So we've been funding quite a lot under this Horizon Europe program, and so these are some of the things that we have been funding. So the first that I wanted to highlight is the Climate and Health Cluster, which I'm sure a lot of you are familiar with. It's an ambitious undertaking funded with 60 million euros, 6 projects that are working to elucidate health impacts of climate change, looking at adaptation and mitigation issues, and also quantifying health co-benefits. There's been several speakers in the conference that are part of this cluster one way or another. I will mention notably Rachel Lowe from the keynote yesterday. And this cluster is a partner in the European Climate and Health Observatory, which, if you're not familiar with it, it's basically this forum or this kind of partnership that brings together different partners from the climate and health sphere, both academic and non-academic, to kind of pool resources and pool data and share evidence. We also have 3 projects that are working on mitigation issues in the health sector, developing sustainable technologies for certain medical fields like tomography or renal care, and also broader sustainability practices across healthcare facilities. We also have 4 projects that are under the EU Climate Adaptation Mission, working to develop solutions to mitigate health risks and boost climate and health resilience and adapt our health systems to climate change. The Planetary Health Clusters, 5 projects that are looking at the health impacts of climate change and environmental degradation and trying to boost adaptive capacity and mitigation using the planetary health lens, so this kind of holistic approach. And then just quickly, I wanted to highlight 2 more projects that are in clusters that are a little bit broader in scope, but that still have relevance to climate and health. The first one being workplace innovation. So we're talking about occupational health here, really important. This project, Intercambio, is working on developing interventions that promote health in work environments that are changing as a result of climate change. And the last one is a project working on expanding the evidence base on the links between air pollution, respiratory disease, and climate change using AI. So should you want to read more about any of these projects, please feel free to check out the links on the screen, on the slide. So we've been funding quite a lot, as you've seen. But if you think about the lifetime of projects and the journey of getting to a project being funded, it's actually quite a long time between the call being published, prepare the proposal, submit the proposal, become selected, the evaluations happen, then you're selected, then you're funded, then you kick off, and then you start your work. And then 5 years later or 4 years later, you deliver your final outputs. It's quite a long process. And climate change and health is a really urgent issue. So of course, funding all this research is critical, and we will do more of that. But in 2023, we had a reflection, a really long reflection. The conclusion was that we need to do something in parallel, and we need to mobilize our partners and mobilize stakeholders around us that we're in touch with to help us to drive action in parallel to increases in funding. So one of the things that we did is in 2024, we organized the EU Climate and Health Conference in Brussels. This was a very large conference, which some of you attended, I know. And it had a total of 500 people on site and almost 1,000 people connected online. So it was a massive undertaking. And it had ministerial representation, it had commissioner representation, it had, top academics, civil society, industry, a whole bunch of different kinds of stakeholders. And the main objective was to discuss the state of the art, but also to really identify and take a deep dive into the most important knowledge gaps and needs of the research community. And it was also for different organizations to link up, find each other, and identify emerging opportunities for collaboration. And the main takeaway, shocker, is that climate and health need to be tackled together. and that they need to be supported by a European research and innovation agenda, at least in Europe, that's our domain, that is bold, forward-looking, and inclusive, but also that has that global angle, because it's a truly global issue. And some of the challenges that we identified initially in this conference was the slow translation of science to policy, inequities in funding, access, and data representation, and of course the persistence of silos. But nevertheless, the conference culminated with an announcement of the publication of a new strategic research and innovation agenda on climate change and health, which is what we got to working on right after the conference. So when we were thinking about what kind of agenda we wanted to build, the first thing that we wanted to make sure was that the agenda had a broad and modern understanding of what research and innovation entails. We all know that research, it's critical, but it's really not enough. Whether you're talking about fundamental research or applied research, some kind of action needs to follow it in order for it to have an impact. As we heard yesterday in Antonio's intervention, if you're doing these things and no one can use them, then you're just showing off, right? So in our agenda, we really made sure that it acknowledged all stages of research and innovation, from the most fundamental, where we're dealing with the data and evidence and knowledge, to the implementation stage, where we start building strategies and developing interventions and informing policies, to the impact stage, where we want to be, what is our target. And the other thing that we wanted our agenda to have was a broad thematic scope. So you can see here the broad thematic scope of the document. And we also wanted, in parallel, to have to outline actions that need to happen in parallel to increases in funding. So we say critical area X, Y, Z need more funding, but then we also talk about the things that need to happen in addition to that. And so that's why we have an entire section titled From Research to Action, where we discuss how to make the research ecosystem fairer, more equitable, how to link it more to the policy sphere, how to support uptake of innovations and outputs, and of course, what are the next logical steps in terms of international cooperation. The agenda also tackles a series of cross-cutting themes, including inter- and transdisciplinarity, behavior, empowerment, and education to give research that extra reach that it needs, and paying attention also to climate-driven health inequalities, which is a super important issue for us, making sure that we address those. There's also 2 underpinning science chapters, one on issues around data and research infrastructures, and the other one on models and tools and technologies. And of course, then the meat of the agenda is the research area. So the agenda dives into the direct health effects of climate change, indirect health implications of climate change, health sector mitigation, climate and health adaptation, implementation science, etc. So that's the agenda. If you wish to read it, I have the link here on the screen, QR code and URL, both available. So now that I've given you this overview of what we've been doing, what we've been funding, where do we go next? So last year in June, as you know, well, I hope you know, there was a European Parliament election. Very important. I voted, and I hope that if you are an EU citizen, you also voted. And after this European election, the Commission, the newly formed Commission, revised its priorities for this new legislative term. And I kind of outlined them here on the screen. You can't really see which ones I highlighted, but anyway, I have some highlighted because those are the ones that climate and health fits into. So the first one is sustainable prosperity and competitiveness. Now, you know, I think we can all agree that climate and health research is one of the ways that kind of paves the path for health industries and health systems to become more sustainable, to become climate neutral, which of course naturally helps Europe become more competitive, lead by example, and create greener jobs. And it also ensures that our industries and our health systems can comply with environmental standards and that they can kind of operate within, you know, the planetary limits, and that they are ready to face future tightening of these standards. Climate and health research is also really important when carried out in the interest of equity, which it should always be, can also contribute to strengthening society and social fairness. So it's about keeping people healthy in the context of climate change, which of course is not easy. It also contributes to sustaining our quality of life by way of protecting our food systems, our water systems, our environment. Global partnerships is another important angle for climate and health, given the global dimension of the issue. It's something that really can bring countries to work together, and it's a stage where Europe sees itself as a leader. And of course, climate and health research has heavy implications for societal resilience and preparing the Union, our Union, the European Union, to face the future, which I would say is quite uncertain at the moment. But for now, the Commission has pushed full steam ahead with many measures contributing to these priorities, in particular boosting economic growth, which is, and one of them that is particularly relevant to climate change and health is the strategy for European life sciences, which was adopted in July of this year. And it is very much about competitiveness and creating jobs in the life sciences sector, but it seeks to position the EU as the most attractive region in the world for life sciences by 2030. And the idea behind it is to reach a place where Europe is growing its economy in a sustainable way and in a way that kind of secures its prosperity and economic independence and self-sufficiency. And I think that we can all agree, given recent developments in the world, that this is an imperative. We must break free from external actors that either may become unpredictable or have already become unpredictable, or that just blatantly go against the interests of the EU. Of course, critically, this shift needs to happen in a fair and equitable manner. We need to make sure that we're not leaving anyone behind. So we need to make sure that that's a crucial part of the work. But you may be wondering, okay, life sciences. Why are you talking about life sciences in a climate and health, research conference? If you go to the most basic definition of life sciences study life. And life takes place on many different scales, as we know. And one of those scales is the cell to organ to organism to ecosystem to planet scale. So naturally, climate and environment are going to come into play when we look at the planet as a whole, as a unit. So life sciences research has the potential to deliver knowledge and products in a range of different fields, including health, food, agriculture, materials, environment, etc. And the life sciences strategy really recognizes that. And it recognizes the need for a holistic approach to life sciences that acknowledges the interlinkages between the different kind of sectors. Because what affects environment affects health, affects food systems, and so on and so forth. And this holistic view is really well reflected in the strategy, and in particular in the strategy's flagships, which of course foresee a world where interdisciplinarity has to grow day by day. So these flagship initiatives are really crucial to the strategy and the success of the strategy. And two of them are fully dedicated to climate change and health. The first one is on the implementation of the research agenda that I talked to you about earlier, under which we will mobilize at least 170 million euros for research and innovation on climate and health under the Horizon Europe work programs. And in the months ahead, we're going to be working with member states and industry partners and other partners to invite them to contribute to the implementation of this agenda. And the second flagship I want to mention is a multilateral platform that we're working to establish with Wellcome Trust for different climate and health funders from around the world. And the aim is really to boost and streamline international cooperation in the field and make sure that funders are aligning themselves, that their programs complement one another, and that we're covering more ground with the limited resources that we have. The end goal is really to enable the development and the delivery of life-saving climate and health solutions more effectively and equitably around the world. And that leads me to the last part of my presentation, which is something else that's on the horizon, forgive the pun, is the new Horizon Europe, the successor to the current Horizon Europe program, which will kick off in 2028 and will go on until 2034. And I cannot tell you exactly what the final kind of program that will be adopted looks like, because it's under heavy negotiations with member states and the European Parliament. But what I can tell you for sure is that there is going to be a renewed emphasis on innovation and competitiveness. The Pillar 2 will be renamed Competitiveness and Society, and the competitiveness portion of that will have 4 policy windows, which will correspond to the same 4 policy windows of the new European Competitiveness Fund. And climate change and health will fall under the yellow one, the one that I highlighted in yellow, which is health, biotech, agriculture, and bioeconomy. Again, keeping in mind that these things are interconnected. And this is really going to be a great instrument for us to advance on decarbonizing health, securing our health value chains and making sure that we're protecting them from the effects of climate change, also keeping people healthy, keeping people productive, and also promoting and stimulating the development of technologies to tackle climate and health issues. And just to give you an idea of the figures, we are proposing a total of 19.7 billion for this policy window in the context of the broader 68.3 billion that have been allocated for competitiveness. But again, this is just a proposal. It's going to be, it is being negotiated, so the outcome might look a little bit different. But either way, I think we will end up with ample budget and a real mandate to continue funding research in climate change and health. So with that, I would like to finish my presentation. Thank you for your attention and invite you to check out some of our materials if you would like to learn more about our work. Thank you so much.
Thank you, that was great. And I can't do anybody's last name. Let's just hold the questions because we've got 4 really fascinating panelists. The next one, I'm delighted to introduce Gloria Maimela. Is that close? Right, I got one right? Who's going to talk with us a little bit about some of the issues on adaptation in Africa.
Thank you, Chris. I'm gonna try. Right, thank you so much, Chris. That was very close. Yeah, so my name is Gloria Maimela, and I'm going to state the obvious that I am African. I am from South Africa, from an organization called the Foundation for Professional Development. So I've been asked to talk about addressing adaptation challenges in Africa in the midst of rising climate and health risk and geopolitical shifts. I'd like to declare that I do not have any conflict. I do not have any conflict of interest to declare. So we know that the rising climate and health risks that Africa is continues to be at risk of climate change. This is data from the state of the climate in Africa, and it's showing that this is recent data, the 2024 data, that is showing that. Africa is among the warm, in 2024 was among the warmest on record in Africa, with, a mean temperature of 0.86 above 1991 to 2020. So the risk is escalating in Africa. It's not slowing down. And this is the data from the Lancet Countdown that actually shows that, if you look on the right side, that the health-threatening temperatures are increasing, and then these are health temperatures that are attributable to climate change. And you can see that Africa continues to be at risk. Africa has had close to 140 days of exposure of health-threatening temperatures. So the situation is not looking good. So there's a deepening crisis as we sit here in the African region, and I want to put South Sudan as a case in point, where you see many things happening at the same time. In South Sudan, in February this year, schools had to close because of it was too hot, extreme heat. So children stopped going to school because of that. If you look in the same country, in August this year, health facilities were submerged and people could not access health facilities in Africa. Droughts are fueling conflict in South Sudan. So this is just a single country, and you can imagine what else is also going on in the other countries that are affected also by air pollution. We know that mortality is going up as far as air pollution is concerned, and climate-sensitive infectious diseases are affecting the African region. It's not all doom and gloom. There's been some progress. You can see that, what we are seeing is that vulnerability and national adaptation plans that governments have taken that on, and the number is increasing. Many countries are now completing their national adaptation plans with health integrated into that. We've seen the WHO framework for public health adaptation to climate change that has been led by WHO. There are certain countries, like Kenya and Nigeria, that have integrated stronger data flows and have climate-informed protocols. The process of reimagining Kenya, and Nigeria health systems, which is fantastic. And we are seeing a lot of initiatives. For example, the African Development Bank on Climate Change Action Plan that is also investing in the African response. But ladies and gentlemen, there is a risk that these responses will be derailed going forward because of what's happening around the world. So there's a lot of geopolitical shifts that are reshaping Africa, Africa's climate and health response. And we know that, we talk about the VUCA world, that there's a lot of volatility in the world, there's a lot of uncertainty, there's a lot of complexity and ambiguity, and that is now influencing the progress that is being made in advancing the African climate adaptation response. We know about the politics of climate change. We recently had at the United Nations General Assembly, where countries are pointing fingers at each other. Developing countries are accusing the rich of broken promises. And of course, Donald Trump thinks that climate change is the greatest con. And this was just a month ago in September. And you can imagine the ramification of that. We are also seeing global shifts in official developmental assistance, and I'm from a country that has been affected by that. We know that USAID has now been fed to the wood chipper, and does not exist any longer, and foreign aid has been withdrawn. Again, in my country, foreign aid has been, for HIV and TB has been withdrawn, and our Minister of Health is scrambling to find funds to continue. And we're at least better. In some countries, these programs, the HIV, TB programs, have completely collapsed. And the problem with this, in the context of climate change adaptation, is that the projects now are delayed or cancelled because of this, because suddenly the countries are having to adapt. Thank you very much. The countries are having to adapt to manage whatever resources that they have to address climate change and health. There are smaller scale interventions that are insufficient. I'll tell you now that we have the Health National Adaptation Plan that is on hold because there's simply no funds, because now the money is being rechanneled to plug in the gaps that have been created by reduced funding. And there's an increased dependence on loans and private finance, which carry interest and which is also problematic in the African region. We know that right now that adaptation, at this point in time relies on basic essentials that are affordable, but they're not very sustainable. And we need to, Africa needs to scale up in terms of some of the interventions to address that. And we're glad that research is providing some of the answers, because this is not sustainable in the long run. We always talk about limited indigenous knowledge in the African region, and I've yet to hear about how we're planning on collecting data from indigenous resources, because these are, people, these are our grandfathers, grandmothers, and we're not seeing that transition. We're not seeing that capturing of data that can be used in the future to make sure that that indigenous knowledge is retained. And behavioral interventions, it's one thing to tell people that this is what but how do you make sure that change is sustainable, and behavioral interventions are needed to sustain some of the interventions. Yeah, thank you. So what is happening with adaptation financing in Africa? What is the reality check? The good news is that the funding has more than doubled in the past, I think, 5 years in Africa. So there are financial flows that are coming in. However, some of the challenges that it's still not enough. Africa, if you look at the global context, we received only 20% of the global adaptation flows. And according to the GCA, we need about between 53 to 70 billion a year between 2020 and 2035, and we've only, it's estimated that we'll only be able to achieve $195 billion by 2025. And we know that this figure, the need is 1.6 trillion, and that's an underestimate based on the NDCs. So where is the funding coming from? We know that most of the funding is still coming from multinational, multilateral development finance institutions, 60%, and African governments, unfortunately, are lagging behind because they're only contributing about 19% of some of the funding into adaptation. The private sector is also contributing very little into that, and specifically the private sector in the African region as well, and this is a challenge to the private sector to also get involved in supporting climate adaptation. So I just want to touch, on the loss and damage fund. This is data from the, Economic Commission of Africa that shows that, estimated needs are, up to $580 billion by 2030 that we need in developing countries, including Africa. And there have been pledges. I remember in Dubai, there were lots of pledges at COP28, about almost 750 million, but so far only less than 10% of that has been paid. So this is still a big problem. So some of the challenges around loss and damage is that we do not account for non-economic losses. So issues around displacement, loss of cultural identity are not included. So how do we know that Chris referred to? How do we know that this is, and we are some of the people that I sit with a lot of ministries, and they ask that same question. How do we know that this is because of climate change? And who needs to pay? There's temporal mismatch in that, so the challenges are ongoing, but if we're having a problem now and the funding is lagging and it's 10 years down the line, it becomes very difficult to account to the true costs of climate change and the cumulative losses. And, for example, in KwaZulu-Natal, we've had floods after floods after floods. So the losses are just cumulative, and we need to be able to account for that. The implementation, one of the things we will say in Africa is that we have the greatest policies, but there are challenges with implementation and also just getting the implementation cost. The data limitation and also the skills. We don't have enough infrastructure to account for, to do post-disaster needs assessment that can then inform what goes into L&D. And also the voluntariness of contribution. Countries can, they don't have to, they're not obligated, they can just pull out at any time. We were pleasantly we were happy that the meeting at the SES in Addis a couple of weeks ago, that Africa is looking to raise at least 50 billion a year for new climate solution initiative. But again, we want commitment because it's great that they're announcing this, but we want to see this happen. I want to quickly touch on national adaptation plans. And as I said before, that you can see that we have increased the number of countries in the African region who have submitted national adaptation plans. The problem with that is that most of the national adaptation plans are not bankable at the moment. You'll see, I don't know if you can see that figure at the top that shows that less than 15% of the projects, of the plans that have been submitted to GCF have been approved by GCF. And then the same thing goes to show the amount and what has been submitted. There's a huge gap in that plans are not of the quality that it should be and they're not bankable at the moment. So, there's an issue around pipeline readiness that, we need, most countries need technical capacity to develop these bankable projects and proposals. There is insufficient data that I spoke about. There's weak institutional, coordination across the ministries. Right now, climate change has its own division and everything else is somewhere else. And so there's still no coordination between the different sectors or the different units within ministries of health and other ministries. There's unclear legal or procurement frameworks, and there's also delays in preparing safeguards or meeting the funders' requirement for some of these projects. There are some initiatives that are taking place in the African region, just from GCF, from the Adaptation Fund, from Africa Adaptation Acceleration Program, to build that capacity to enhance pipeline readiness going forward. So we look forward to those initiatives to support the African countries. I want to touch on climate resilient health systems in that there are efforts. WHO obviously has this framework on climate resilient health systems, and we're very appreciative of some of the initiatives by the World Health Organization and the Pandemic Fund to strengthen early climate resilient health systems through early warning systems, disease surveillance, lab diagnostics, and healthcare workforce development. And there's a project that was announced in April 2025 where the WHO will be supporting up to 8 countries in the African region to strengthen some of these climate resilient health systems. One of the topics that is close to my heart is the workforce, that we're still seeing shortages in the workforce. We're still seeing, climate-related staff attrition. Yeah, if we talked about community healthcare workers yesterday, but if they're exposed to heat, there's a challenge that is also impacting on their health, and we're losing more staff. There's limited climate health training to reduce effective response capability, and there's also uneven distribution of trained staff. So this is just a slide from Lancet Countdown that shows that low HDI in African countries are in there, that there's still, climate education is still problematic, and this is an area that we need to rapidly scale going forward. Right. And then I just want to touch on climate and health research publications. And the good news is that it's going up, which is fantastic. This is a global number which shows that, climate and health research, we've had over 4,000 peer-reviewed scientific articles published on this topic. And, as I think Chris, a lot of it has been around associations, and now we need to move towards attribution. And we're still lagging behind in low HDI countries, of which Africa is one of them, and that we still need to ramp this up. There's been good news coming from the East Africa, and that's a best case study that we can learn from, and we're seeing that there's a lot of articles that are coming out of there that are climate and health related that will generate this data. And I'm nearly finished. Just to touch on technology, which is also extremely important in Africa. And there's some initiatives that are happening around leveraging AI for climate resilience in Africa. And this is important because for open data source creation, for capacity building, for collaboration, we're hoping that this will foster collaboration in Pan-African AI-based climate research. There has been great initiatives in terms of strengthening science and policy in Africa. I was lucky to be one of the peer reviewers for the Africa CDC Climate and Health Strategy, which has been launched. And also we are very happy to see that we now have the regional hub as far as the Lancet Countdown, because then we're hoping that this will help to generate the data that is needed from the African region. I am a member of the Chance Network, and one of the initiatives that we're doing is to advance this policy in the African region around climate and health policies. Ladies and gentlemen, I just want to finish with some recommendations that I've made, and I think I'm more of an activist than anything else, and I will be presenting in a conference in Nairobi for calls to action around some of the issues. And one of the first recommendation is that we need to elevate Africa's agency in the changing geopolitical financial order, and we're hoping that some of the conversations in COP30 will talk about a unified adaptation investment compact that can be that can support Africa. We need to, unlock scalable, predictable climate finance that has to be ring-fenced for climate adaptation by the ministries. We need to prioritize health systems as core adaptation, and we are asking, the African government specifically, and WHO and other regional economic communities to commit to fully finance climate resilience strategies by 2030. We want to harness innovation, AI, and data for climate health intelligence, and one of the initiatives is a Pan-African Climate and Health Data and AI platform that will collaborate the evidence forecasting and a rapid response. And lastly, we want to make sure that we integrate climate change and health into health curricula to enhance workforce flexibility and surge, and surge capacity. And we're asking for governments and health ministries to urgently invest in climate resilience of Africa's health workforce. With that, my second last slide is to just say that I'm hopping on a plane to Nairobi after this conference. We have a Pan-African climate and environment, climate change and health that's taking place, and we're having over 40 African countries that are convening to discuss some of these issues and to also talk about the call to action that we want to see as we progress the African climate and health response. I'd like to acknowledge my colleagues who have helped to contribute to this presentation, and thank you very much.
Hi, thank you. I'm Sharad Gutikonda from Urban Emissions, India. I'll go a bit more south and east, and I will be talking about India. I broke this presentation into 3 parts. I'll talk about air quality, health, and then management, primarily focusing on India, but a lot of lessons that we have here are very much applicable to other regions as well. A lot of work that we are I'm presenting today is from an umbrella program that we have called Apna City Program, Air Pollution Knowledge Assessments. As part of this, we basically collate a lot of information that we have on air quality and emissions for the cities, and we build stories around that, and we take it to the cities to make sure that they get embedded into some of the policy discussions that are happening in the cities. And all this information is open, and we have expanded this work into other regions as well. In India, we have a national program called NCAP, National Clean Air Program. As part of that, 131 cities were designated as non-attainment cities based on the PM10 and PM2.5 measurement trends. So as for those cities as well, so we have a lot of databases. Everything is open, so if you go to the website, you can see some of these databases that we have. And for other cities that are there, on the right-hand side, you'll find a lot of information from that as well. So India's air quality status, and I know some of the members here are actually working on India's air quality as well. I'll quickly go over some of the information that we have collated and we are working on directly. This is a summary of reanalyzed PM2.5 database from University of Washington, St. Louis, from Randall Martin's group. And we are basically looking at the trends from 1998 to 2024 and how generally the PM2.5 numbers have changed regionally across India and how that is being used for some of the policy work happening in India. A quick lesson from this is the air quality work, even though a lot of it is focused in cities, it's not limited to cities, it's spread across regions. And even though I'm showing only the India map, if I include the rest of South Asia, the redness and the brownness expands into those areas as well. And if you look at the bars that are there on the rightmost part, the green part is looking at only the Indian national standard 40 micrograms per meter cube. We're not looking at WHO guideline. So the areas which are complying with the Indian national standard, that itself has reduced. What it used to be only about 60% of the area that was complying in 1998, it reduced to about 30% now, to Indian national standard. WHO standard is 0% at the moment. The very hard numbers, the red, brown, and the orange numbers, we are going beyond our own air quality index standard, which is designated as severe. Those parts used to be 0% in 1998. Now we have 20% of the area now beyond Indian air quality index standard for severe. Looking at Delhi, Delhi is the most monitored, most talked about, and most studied city. If you look at the national rankings, even city rankings across the world, Delhi is in the top 10. I want to focus on, again, the right-hand part, where the number of monitors have really increased. We've consistently been looking at about 40 monitoring stations, continuous monitoring stations, reporting close to 75% to 80% of the time. And it's a good, mathematically, it's a good sample. If you look at that data primarily, what we are seeing is the numbers have, if anything, flattened out. There's no increase, there's no decrease, but they're flattened out. So if there is any intervention that's actually making a dent in the emissions, that is basically taken over by the other numbers in the consumption level, basically. There's an improvement in the residential sector by giving more LPG connections, but then there is also an increase in the total population using the non-conventional fuels that is basically taking out whatever benefits that we had. And this is only looking at Delhi only. And there are, again, because there's so many source apportionment work that's been done across 30 years, we try to document some of that. Even though the numbers have changed in terms of total emissions, total pollution, but if you look at the percentage contributions coming from different sectors, that really haven't changed. The story is still the same. In the 90s, we still had the same problem with the residential sector, transport sector, industries, and they're still contributing in terms of percentage at the same level. But a lot of discussion has now moved towards the extreme events. So we're not talking about the blue dots, not so much. I mean, they're still there in the news, but if you look at the news articles or the importance given to the extreme events, that's a lot more. So that really has to change. If we are talking about health, we actually want to make sure that the blue dots also go away, not just the extreme events that are contributing to the problem. And the sources themselves, these are the standard sources. All of them are actually at the highest level of consumption there is. This is a database from Cicero by Robbie Andrew, an excellent resource. He basically keeps track of all the fuel consumption numbers and plots them pretty much. I don't know if he does it every day or every week, but it's there. We actually keep use of those numbers. If you look at these, the consumption levels for coal, petrol, diesel, gas, all of them are at the highest levels there is. This is the national level, but if you look at the subnational level as well, you will see the same trends. Okay? So if we look at the regional signatures that we have, they track. I mean, you see those increases in the pollutants as well. So this here we're looking at comparison of 2019 and 2023 tropomi columnar numbers for NO2 and SO2. And we see a big change. From a regional perspective, it's a big flag to say that we have a lot of policies on paper, but fossil fuel consumption is going up, emissions are going up, and they are showing up in the regional signatures. So for NO2, across the regions, when we have an average 10% increase in the columnar NO2. So this is a direct link to your transport sector. When we do have a very large increase in the total number of vehicles that are there. In the cities, average close to like 1,000 vehicles registration every day, and the tier 2, tier 3 cities average about anywhere from 200 to 500 vehicles of registration every day, new vehicles registration. And that is showing up in the petrol consumption and diesel consumption, the gas consumption in the transport sector. Now, NO2 is a really good proxy to do that. For SO2, same thing. Our coal consumption has increased across the board in the industries, especially in the iron and steel, fertilizer, cement, and even the power consumption, power sector as well, power generation sector. And it is showing up regionally across. We have a 20 to 30% increase in the columnar SO2 numbers that has a direct link to coal, and it is showing up. Okay, and this is not to say that the efforts are not there. The recent news in the renewable energy is that we have a 50% installed renewable energy capacity in the country, but the electricity generated from coal is still the highest, about 75%. That number hasn't really come down, and that is showing up in the pollution numbers as well. So the next block on the health sector, we do have a lot of research that are coming out. The biggest resource we have for health-related work is from the State of Global Air from HEI, Health Effects Institute in Boston. This is one of the latest reports that they have. I think they have a new version coming out in a week's time. And globally, air quality is linked to 8.1 million premature mortality deaths. And South Asia is among the highest, about with 2.6 million. And this is more interesting. Where are the risks that are there? The air pollution now really ranks at number 1 among the risks that is contributing to the premature deaths. And two things that I want to highlight. Okay, so one is the number 7, diabetes, and then the number 12, neurological disorders. Those are the two categories which have a big jump. And then if you look at the epidemiological work that's coming out, there is a much stronger link that is being established for both for diabetes and for mental health, linking it to air pollution. And in general, if you don't look at air pollution, if you look at diabetes only, India is considered the world's capital of diabetes in terms of numbers and the percentage of population who have type 1, type 2 diabetes diagnosed. And those numbers are really increasing. And especially in the cities, these numbers are increasing even more. Okay? And those two categories, especially diabetes and neurological disorders, are, when we are seeing more and more of those cases reported in the cities. And the point I was making earlier, all of South Asia itself, not just in India, in other countries as well, air pollution is now ranked number 1, leading risk factor for premature mortality. And this is another study that's coming out of EPIC, University of Chicago group. This is the latest estimates that are published last month with life years lost is about 3.5 years for India. And this was about 5.2 years that came out a few years ago. But the improvement, I think, is mostly from the analysis methods itself. Looking at the health impact itself, the dominant pollutant continues to be PM2.5, especially in South Asia and in India itself. There are increasing number of studies that are coming out linking it to ozone as well, but PM2.5 continues to be a dominant factor. And this goes back to some of the pollutant apportionment that I mentioned earlier. There are increasing efforts to control PM2.5, either from managing dust or other efforts, but there is more contribution coming from the secondary side, which needs to be accounted for and also looked at, because the chemical nature of the PM2.5 is actually going to be a much bigger factor going forward, especially trying to understand health linkages. So on the management side, we do have a lot of efforts that are in place across India. Like I mentioned, renewable energy sector has really taken a big step forward. But we also have this National Clean Air Program that was announced, primarily looking at cities only, that really changed the focus of not doing work only in big cities, but also in tier 2 and tier 3 cities. It really increased the picture of an analysis that we could do, both from the monitoring perspective, but also from the modeling perspective as well. It really increased a lot of scope for work. And also moving away from the extreme events. I mean, there's still a lot of focus is on the extreme events, but now we're trying to, there's a more increased interest in non-extreme events as well, especially going into transport and the residential sector. And I want to focus a little bit more on the multi-pollutant management strategies. This is work that's actually coming out of GAINS, the YASA group. They basically, the GAINS program is one of the programs which, bringing in the multi-pollutant assessments framework, and they have been very instrumental in some of the management framework discussions with the government directly. And here are two graphs that I want to focus on. Again, it breaks up India into two parts, IGP, which is the northern India, the Indo-Gangetic Plain, and then the non-IGP part. And it immediately breaks up the sectoral focus as well. So you have a very high population density zone in the IGP, where your biggest bang for the buck is going to be in the non-industrial sector, especially in cooking and heating. So cooking is an everyday thing, but the heating part is really jumps up in the winter time, and that has a huge emphasis, not only from the energy side, but also from the health side as well. So your pollution levels really jump very high in the winter time, and also your linkages to health impacts as well jumps up very high. On the multi-pollutant side, this is a synthesis that came out of the air quality index assessments. So in India, the air quality index also puts out a small information on what is the dominant pollutant on that day responsible for the air quality index. And if you look at the statistics in 2019, majority of that focus has been on PM2.5 and PM10, but in 2023, the signatures are changing. I mean, we've seen more cities reporting ozone as their dominant pollution, especially in the summer months. Which basically points us to saying that no, we can't just focus on one pollutant. We actually need a multi-pollutant approach if you really want to have a clear understanding of both the pollution sources and where should be our management focus on. I'll skip these in terms of time interest. Anyway, so these are 5 points I want to focus on at the end. Basically, we need a change in the national standard itself, because a lot of focus is still on the national standard only, which is 40 micrograms per meter cube, which is 8 times more than the WHO guideline. I mean, if we start lowering that number, we'll start seeing more and more health impact stories that are coming out. Right now, the climate agenda is helping a little bit on the air quality side, but if we start looking at the sectors which are contributing to the main problem, we will see that there are sectors where if the focus is moved more towards air quality, we'll have a much faster benefit. Like for example, if we look at the SLCPs, like if we were focus on black carbon, the entire shift will be more towards residential sector, and we'll have more benefits from that. The modeling framework, it's very limited these days, very focused on a couple of groups. That really needs to expand. Okay, the institutionalizing the scientific analysis part is still limited to a few groups. I think that's where a lot of capacity building activities needs to take place across India, so that we have a much better understanding of these co-benefits framework. Thank you. When we have a lot of resources which are online, we can talk to me afterwards on some of these things. Yeah.
Can we get all the panelists up here? Yeah. Have a seat. We have about 20 minutes, and I'm going to start by asking the panelists if they have questions for each other. You've each got a microphone there, and one of my experiences with being a panelist is you always think, I really want to know something, and you don't get a chance to ask a question. So I wanted to see if any of you have questions for each other.
Well, perhaps I can start.
Please.
And I'd like to, ask Alex that now that you've seen the presentation from Africa and some of the needs, what role could the EU play in supporting some of the challenges that I've presented? Thank you.
Yeah, thank you for the question. I think we have a really important role to play in kind of, let's say, massaging the system so that we can get more funding available for Africa. Because what I understood, one of the main takeaways from your presentation is that funding has increased, but it's still nowhere near enough. And the funding that there is available, it's reliant on loans. It's not super reliable. So, well, from my perspective, coming from research and innovation policy, I think we can continue to encourage international cooperation and make sure that cooperation is done so in an equitable way. But certainly, I think advocating for increases in funding is going to be one of the ways that we can help. We also have the Gateway Europe program, which I'm not an expert on, but I know that that is one of the ways that we engage with countries in Africa and around the world. So honestly, it's also an issue about visibility, so keeping these issues visible and raising awareness in meetings like this where you have a global audience with a mix of people from Europe and people from Africa and other places. Is going to be also key. So I also commend you for that.
If I could add to that, there's lots of cooperation mechanisms you talked about, and air pollution is increasing dramatically in Africa, and there's a lot you could learn from India, and finding ways to transfer those lessons learned and best practices, all the work that's been done in India about household air pollution, which I don't need to tell you is a huge problem in Africa, and finding ways to help transfer those lessons, but in the appropriate cultural context.
Yeah, absolutely. And I think having looked at and this is the last thing I'll say, having looked at the reports that have come out from the EU agency, the EU Environment Agency, we've had a lot of progress on air pollution in Europe, but there's this kind of, well, not from our side. From our side, it's still very much important, but we have to be careful that we're not complacent and that we're not kind of, becoming static and stopping action against air pollution.
Just to expand on your point and the points that you made in your presentation as well, you focus more on how funding got cut recently in this geopolitical situation. But from an institutional perspective, what kind of resources are you looking for to increase the capacity building activities in the region? I mean, is that fully tied to funding only, or are there some foundational work that needs to be done in Africa that can be helped?
No, thank you for that question. Funding always, but also technical support, technical capacity, and you've seen that we've got the National Adaptation Plan, but not many of them are bankable, or not many of them are feasible. And this is the issue around attribution science, because we're battling to convince the ministries that this is because of climate change, and so these are some of the resources that we need in Africa to be able to adequately respond. So it's not just the finances, it's everything else that goes with the financing. Thank you.
Does anybody in the audience have a question? Nobody has a question?
And while they're still thinking, I think I'll go back to my own question. The reason why I'm saying that is even with, for example, in India, one of the things that I find really deeply lacking is where is the next generation? Okay, I mean, especially from the interpretation capacity wise, because you mentioned AI. AI is going to bring in a lot of data. It's going to be put in front of you, but do we have that next generation in place to interpret that data and then build stories the way you're telling, or are we going to rely mostly on machines to do that? So anyway, I mean, do we have the next generation? That's the question.
I think that's a problem for all of our countries. As you look at where the youth want to go, it's to become an influencer. It's not to become a scientist. Although technically we are influencers in our own way. Some days are better than others. Would somebody like to, we've got a tentative hand sort of in the middle.
Thank you. Shilpa Rao from the Norwegian Institute of Public Health. I have a question for Sharat, but anybody in the panel could take it up. You gave the example of Delhi, where you said that the emissions have plateaued off in the last few years. And you said that the increases that the development essentially contributes to the increase, more consumption contributes to the increase. And this goes back to the classic pollution or climate development debate. What do? You mentioned the number of cars that are being registered every day, and there is so far no silver bullet for any of these problems. So what is the solution? I mean, this picture will look the same in 20 years' time. You'll come back and say Delhi is still at the same level because there are more people and more consumption. So I've been seeing this figure in many, many conferences over the past 20 years. And it's, so my question is, what do we do with the development debate when people need to consume and this whole, kind of conflict that occurs because of that? Thank you.
Yeah. Thanks. The consumption is there, but we also have a lot of room to change. I think that's the point that I didn't highlight. Look, for example, you take the transport sector, the number of new registrations are going up, the usage is going up, but you don't have concrete solutions in place to cut that. Okay, so you can buy a car, but do we have options to not use it? For example, public transportation. When you go to London or Singapore or even Stockholm, you have all the options not to use your car. Your public transportation is really good. Your walking and cycling capacity, infrastructure capacity is really strong. So it actually gives you the incentive not to use it.
Okay? So we don't have that in place. Just from an infrastructure point of view, when we had a white paper that came out of the ministry itself in 1997, which said Delhi needs 15,000 buses to meet the demand in 2000. Okay, so that was the report that came out in 1997. Even today, the public transportation capacity is 7,000 buses. Okay? So we never met that 15,000 demand made in 2000. So right now the demand is close to like 30,000 buses. I'm just like a hypothetical situation. If that number was 30,000 today, will we see a big drop in the vehicle usage? Like forget the vehicle registration part, vehicle usage part. We will. I mean, you look at the metro expansion actually has shifted a good number of passengers on a daily basis to using metro. And I mean, that's just an example. If that same effort has been put in buses as well, we would have seen that change. And looking, same thing goes with the other sectors as well. The waste management sector, then we still have the same 3 landfills with the same management capacity. I mean, that's about 7,000 tons a day capacity, but the city's waste generation rate is close to 20,000 tons a day. So close to 10,000 tons of waste is not managed. I mean, if you could do that, that graph will start, dipping. We have a lot of room, yeah.
Maybe I can add something as a young person who hasn't become an influencer. I just, there's more of us, I promise. I just wanted to say that, to add to what has been said, personal choice is not everything. It's really not. We need political leadership and we need corporate leadership to step up. We cannot have a situation where certain countries are walking away from the negotiating table because of fossil fuel interests. We cannot have that. So, yeah, I really found it very striking in your presentation when you mentioned repeatedly that fossil fuels consumption and fossil fuel usage has been increasing. It's something that it's a non-brainer starting point. If it wasn't so controversial, it would be the lowest hanging fruit ever.
And I'll add another point, which is taking into account long-term change when thinking about policies that will be resilient, sustainable over the longer term. For most countries in the world, it's rapid demographic change. That the UN Population Division has really significantly overestimated how many people are going to be in the world because they haven't taken into account the dramatic decline in fertility. And that then has consequences for a whole range of policies. And that's just one of many examples, how India continues to urbanize, where you put in your sanitation systems. There's lots of choices that will be made. And it comes back to a health in all policies and trying to bring health into all of these discussions and help ground the decisions that are made for future health and well-being. Mari? It's not on.
Okay, I try again. I'm Mara Lammus from the Karolinska Institute in Sweden, and I have a question to Kristi, which I'm not sure I should ask, but today, talking to Americans, there is always this orange elephant in the room, and I just wonder, how is the academic society thinking today in US? Are you just laying low for next 3-4 years, or have you given up? Are you never going to do any climate change research again? So what is actually happening?
It's complex, needless to say. It's impossible to portray how difficult it is. And yet, everyone who's working on environmental health issues sees the importance of the issues we just talked about. And the level of commitment in the academic community has done nothing but increase. And that does not get reported in any of your news. There was a report from the Department of Energy to justify EPA voiding the Supreme Court decision that said carbon dioxide is a health hazard. There were 85 scientists who wrote a 450-page rebuttal. And so scientists are stepping up, and they are engaging in activities talking about the importance of addressing the challenges we have today and in the future. It's going to be more difficult to find funding. There's going to need to be greater flexibility in how people look at the work that they do, but people are working on that. There's also the recognition that we do have elections every 4 years. A factoid for those of you who didn't go into the details of the Paris Agreement. Within the Paris Agreement, there is language that a country can withdraw from the Paris Agreement, but it takes 4 years for that to come into effect. Negotiators are smart people, right? And so there's recognition that this is an extremely difficult time. We're deeply concerned about what's happening to the next generation. The points that were raised before, because most universities I know in the US are barely accepting any students. We don't have any money to do that. We're not hiring new faculty, and so there's going to be some years that are lost. And it's finding ways to acknowledge that and then to work around it and to make the situation turn out the best possible. So wish us all luck. And with that, I've left a couple of minutes. I understand I had to leave a couple of minutes at the end. I don't have to leave a couple of minutes? Okay, we can take one more question. Right in the middle in the front.
Thank you. Maya Negev from University of Haifa. My question is to all panelists. Should our community emphasize detection and attribution studies in regions like Africa and India? And would this be effective in getting both research money and adaptation money in frameworks such as the loss and damage funding scheme and at the COP? Thanks.
Yeah, I mean, there's a couple of aspects to detection, distribution, also and attribution. I think the first part is getting that funding, to particularly around research funding and accelerating that so that you can, we can account for what's happening, but also in the believability, I think, for lack of a better word, in kind of like convincing the ministries that this is definitely attributable to climate change, but also, holding, other countries to account that climate change is impacting on adaptation and on the health of people in the region, and therefore we need to get that funding into the into the African region, for example, to address that. So I think yes, from a research perspective, absolutely to fund research, but also from a policy perspective, attribution science will play a major role, I think. I don't know, Chris. Yeah.
Did you want to say anything?
Yeah, I mean, the short answer is definitely yes. But from a science perspective, from a numbers perspective, a lot of epidemiological work that has been used for GBD assessments has always come from the developed, like Europe and US countries, where numbers have been on the cleaner side or the lower side. I mean, if we want a better attribution on the higher side, that's what we're looking at in South Asia, in Africa, and even Latin American countries. We need more evidence on that side. I mean, from that perspective as well, we definitely need, if more studies can be done now to strengthen that part, will definitely help.
I also will say it's important, of course. A couple of comments on that, though, that there are real opportunities to expand the methods to more qualitative approaches. Many countries in Africa only have monthly data. It makes it almost impossible to look at the impacts of heat waves, diarrheal disease outbreaks, because you can't do the association because you don't know when the exposure occurred, and then you can't correlate that with weather patterns. So there's lots of opportunities to do that. There's lots of discussion about interested in doing it, but that hasn't yet happened. And I think that will be critically important for low resource settings to move those kinds of analyses forward. And yes, they're critically important. If you look at the International Court of Justice and its recent ruling from Vanuatu, that was based on detection and attribution. And that has already changed the international dialogue on how to think about climate change, the impacts, and what needs to be done about it. So it isn't possible to you just can't I never get that right, but however you want to say that, if you say they're really powerful, they're even more powerful than you think, because it's capturing the attention of decision makers, it's capturing the attention of the public. It's in the newspapers. Every time there's a detection attribution study from World Weather Attribution, I get journalists who call me up about it and they write about it. So it is recognition of the fact that extreme events are characterizing all of our lives, and using that fact to help people understand it's because of climate change, and that there is actions that can be taken, because it's now asking people not just to protect their children, it's asking people to protect their future selves, that they themselves are going to be affected, and that there's actions that need to be taken for their own self-interest. And so, yes, I really think this is a very important area to move forward, and recognizing it's a transitional topic. At some point, we won't need to do this anymore. We're very close to the point where all heat waves are becoming more intense because of climate change. Detection attribution for all of them is going to say climate change made it more intense. But we do need to do the health part so that we can start putting those numbers down. There's a paper that just came out for 2023, there was 178,000 heat-related deaths, and more than half of them were due to climate change. So we're starting to get the numbers that will capture the attention to make policymakers be more proactive. Alex?
Yeah, I just wanted to add, I mean, don't have that much more to add to what has been said, but from the side of policy, what's certainly clear is that the evidence is there, the evidence is coming out on a regular basis. It's about what leadership wants to see, and it's about having more willing people to take that forward. And then on the other thing that I wanted to jump on was what you mentioned about qualitative studies. And I think this is super important, because numbers are great and they reveal a lot, but they don't reveal everything, and lived experiences they cannot fully describe. And you really need to understand what people are experiencing on the ground firsthand in order to enact policy. So I often go to events and I get asked, if you had a magic wand, what would you do with it, and to solve climate health issues? And I always say it would be to strike the perfect balance between qualitative and quantitative research in all initiatives that we fund, because it's super important.
I just want to add as well that raising awareness at community level is extremely important, because politicians are voted into office. So if the community know that this is, their lives are being impacted by climate change, they can use the vote to make sure that they bring the right politicians into place to make sure that there's political will. So as attribution science evolves, I think it's very important that we pitch it at a level where the community understands that this is because of climate change and someone needs to do something about it.
Absolutely. With that, should we thank the panelists for doing an outstanding job, because we're only a couple minutes into the coffee break. We'll start a new trend today that we'll get our full coffee breaks. And thank you very much for coming, and look forward to the rest of the sessions today.
do we put? Okay. Good morning, everyone. Thanks for joining us. We've got an excellent panel this morning, so I'm just going to get underway. But starting by thanking Hans and the team. It's been a great conference. And good. So we're covering the GAP project, but I think also attribution more broadly, and tracking the impacts of climate change on maternal and child health. Our group at WITS Planetary Health Research really has a strong focus on heat and maternal and child health. And this is one of our projects. So just a brief slides. I have 2 or 3 slides, and then I'm passing to the rest of the panel. So as most of you will have heard this morning, attribution is really where you take the total burden of a particular disease, you isolate which part of that is attributable to climate, that top horizontal bar. That then is separated into burden of disease from natural variation as opposed to climate change attribution causes. And then you can also, in the bottom bar, go on to project what a future burden might look like. So overview of the GAP project. There's 4 stages. In the first stage, we are making a long-term federated data analysis ecosystem. We have multiple ways of collecting and working with data providers across the world. And this is providers who have data on birth outcomes. And we're hoping for around 20 different countries who have these large databases, in some cases the whole of the country or particular district or region. They would have a database on birth outcomes. You then harmonize it with climate and socioeconomic and a whole range of other data. And you conduct these classic impact analyses, the same as what Lebo and others presented in the sessions yesterday. You then conduct in stage 2, we're doing attribution analyses. And stage 3 and 4, which is really, I think, the exciting part of this project, is you try and then use these attribution analyses to really make a practical difference to the field. And here we're focusing on 2 things really: to develop and pilot indicators. Our hypothesis is that an attribution indicator based on the number of preterm births due to climate change will be really a game-changing indicator on climate change. And we would hope then to integrate that indicator into WHO processes and the Lancet countdown, etc. And then the other part of this is to use attribution in really a very strong push on climate and health litigation. So, yeah, like I said, advocacy is really one of the main purposes of this project. So once you have understood what are the number of cases of preterm birth in a country or district from climate change, you then begin to separate that into, okay, what portion of that comes from company X or from the new fossil fuel project, or how much comes from the US, how many preterm births in district X is due to China's continued fossil fuel use, etc. You then are able to model different scenarios. If there was additional mitigation, how many would you get a reduction from, etc. And just one nice example recently of a litigation case where an actual project in Australia, a new fossil fuel project, using attribution methods that worked out how many people in Europe how many additional deaths would you get in Europe from this project in Australia. And I think this is a really powerful illustration. And we focus on preterm birth because mortality is obviously a very severe and important outcome, but preterm birth is one of the most costly health outcomes, both from economic and non-economic costs for some affected children, and of course a lot of the health system in developed countries or low and middle income countries does focus on maternal and child health. It's giving us an excellent indicator and programmatic entry point. So I think this is a nice example of, in a few years from now, we'll do the same thing, but instead of mortality, we'll have number of affected children. And my final slide is, I think, the GAP and other projects aims to move towards a public health response to climate change. As a group, over the last 20 or 30 years, the health sector's tried to be part of a multi-sectoral response. It's a kind of notion that I think needs to be severely critiqued. It isn't. It's a financial and economic sector response, and other sectors play bit parts or occasionally bob the head up. But it's not a multi-sectoral response where you have equal sectors contributing their expertise. So we really favor a public health response based on evidence. And that is what has worked to control previous substances, be it infectious, be it alcohol, asbestos, mercury, etc. And applying those lessons in an evidence-based way, including litigation, regulations, marketing, and behavior change, etc., rather than this current health sector response. And that would include calling it care and support rather than adaptation, prevention, really, rather than mitigation, etc. Okay, so over to Anna. Thank you.
So, good morning, everyone. Well, first of all, thanks to the organizers for giving me the opportunity to speak today in this session. And basically, my role in this session is try to explain to you or try to convince you, if there's any doubt among you, why climate change or attribution science or impact attribution science is so important now in this time in climate change research. So yeah, my name is, I'm Ana Maria Vicedo. I'm a professor at the University of Bern, and basically I've been working already a bit on this and it's one of the key research areas in my group. So let's start. Basically, in the aftermath of any extreme weather event, there are, in a way, let's say, many people ask the same questions because it's part of our, let's say, instinct as humans to know why this thing happened. Who caused or what caused these things? And in this case, it was it might be familiar to you, it was the flash floods that affected the metropolitan area of Valencia, just a few kilometers away from my hometown. And it was an extremely impactful event, completely unprecedented, with more than 200 people dying in this due to the flash flood. So basically, as I said, the key questions is how much actually we can blame climate change for this, and how much actually of the observed and unobserved health burden can be attributed to climate change. So in a way, what we want globally and overall is to estimate or to quantify or to identify what is the fingerprint of anthropogenic activities and these observed events. And in a way, we are interested in some sort of causal chain to identify how basically the emissions of greenhouse gases eventually lead to the warming of the atmosphere, lead eventually to the extreme weather event or to a change in the climate, and eventually leading, as in this case, the health impacts that we can estimate. So the field of detection and attribution science is a relatively mature research area in climate science. It has been developed already for more than 20 years, and one of the lead contributions, the first contributions, it was this paper by Peter Stott in the UK, which basically what they wanted to focus is on the kind of well-known 2003 heat wave that affected Europe, and in a way they were able to say, okay, we estimate that it's very likely that human influence has at least doubled the risk of a heat wave, exceeding this threshold magnitude. So in a way, in this kind of research, we are interested not to say whether an event is fully caused by climate change, is to say how climate change increases the probability or the intensity of this event. The idea is that we want to go a little bit farther. It's not only to say, okay, this event that we observe is to really see, okay, the impacts that this event caused, what is the contribution that can be actually attributed to climate change or to anthropogenic activities. And if we go back to the event in Valencia, these are pictures that my best friend, she's a surgeon, she volunteered to go to the area. And in a way, what I want to say here is that sometimes the impacts that we observe from extreme weather events go clearly beyond the ones that we see in media, in the sense, in this case, we know that apart from the 200 casualties that happened at that time, nowadays we are still facing a lot of health impacts that are consequences of this event, including, for example, that we know that vulnerable people were isolated for weeks in their houses because they were trapped, so their health condition got worse, and eventually they might needed to go to the hospital, or even, unfortunately, they could die. Also, mental health issues, there were outbreaks of infectious diseases, and these, as I said, these are other kind of consequences that sometimes are neglected. And in our case, as epidemiologists, we are interested to quantify, and not only to quantify how much, but also to say, okay, climate change, what was the role of climate change in all this story? So in a nutshell, what we are interested, or the way how we work, in this is basically the only methodological kind of slide that I'm gonna show you today, is what we want is to combine on one side climate simulations, or some sort of scenarios. Let's say one scenario is the factual scenario that replicates current climate in presence of anthropogenic emissions, and some sort of counterfactual scenario that mimics or replicates what would have been our climate without anthropogenic emissions. And this is all, let's say, products that climate modelers and experts in the field have been developing for many years. And there are different types. And of course, depending on the research question, you would be interested to use one or another. But this is, as I said, these are products that are available. And the idea is that we, as epidemiologists, our role is then to combine these scenarios with some sort of epidemiological measures. In this case, what we typically say is these so-called exposure response functions that allow us to translate this series, for example, of temperature into some sort of health impacts. And the idea is that you estimate this for the factual and the counterfactual, and the difference is what we say that is the contribution of anthropogenic climate change. In a way, this kind of research emerged, I would say, a few years ago. There was some initial work led, for example, by colleagues in Sweden, that they wanted to do some sort of assessment across time of the contribution of climate change in this case, it was mortality in Stockholm. And on the other side, there was this study by Dan Mitchell and colleagues to using a slightly different approach in a way for estimating what was the fingerprint in the observed mortality impacts of the 2003 heat wave in London and Paris. Since that, there have been a few more studies, and this is one of the, let's say, the work that in our case, within the multi-country, multi-city collaborative research network we led. It was a study including more than 700 locations in 43 countries, and in here we estimated that 37% of the observed heat-related deaths could be attributed to anthropogenic climate change. So basically to say that 1 out of 3 deaths could have been prevented in absence of climate change. So since then, there have been new studies, and more importantly, as Matthew said, try to go beyond the usual mortality estimates. And it's interesting to see that especially people are starting to go more into these vulnerability groups that are particularly relevant for policy. And in this case, for example, this study by Asia Dimitrova that they estimated, in this case, it was neonatal mortality attributed to climate change in different locations, mostly in the global south. And on the other side, of course, the contribution in vector-borne diseases, in this case, West Nile virus. So again, this is a field that is emerging and is extremely important. It has a lot of potential for many reasons. But here, as I said, my role is to say why causation is so important, why this kind of research is so important nowadays. It's basically, we can say that it's basically, of course, for decision making. They can inform a lot of policy development, etc. Of course, in terms of communication, and finally, as well, for ethical considerations. When I say communication, we know that this is a hot topic in media. Once an attribution paper is published, the attention that media takes on this kind of research is super powerful. And we know, just as a example of the many headlines that have been published based on this research, mostly from the colleagues in the World Weather Attribution. And in a way, it's just because it's so easy to communicate the impacts. It's so easy to say, okay, these many people died due to anthropogenic emissions, or climate change increased the probability of this event by this. This is so easy to communicate and easy to understand for the public that in a way has been used very much to try to of course, communicate risks, but at the same time to maximize the impact of this kind of research and make more awareness about the risks of climate change. But when it comes to the ethical considerations, one key element, and in the panel this will be discussed in a second, is the idea how this type of science can inform processes in climate litigation, in the sense that whatever in terms this kind of evidence can be then used in specific cases in courts that are in a way trying to push, let's say, emitters or different countries, etc., for their, for example, less ambitious, let's say, measures in terms of mitigation strategies. This is extremely useful to try to make the case and support the claimants on this. And one example, this was more like a personal experience. We participated at the University of Bern in what is called a third-party intervention. It's basically, it's a tool that is very common in litigation, in which basically we put together a report as an expert and we submit it to the court to inform the judges about the status of the research. And in this case, we were able to put together evidence specifically for the case in Klimaseniorinnensschweiz, so this Climate Seniors Switzerland, basically a group of old women that sue the Swiss government for their inaction. So in here, we put together research from different groups, and also we were able to develop specific studies. In this case, we did an assessment on the heat-related mortality in the 2022 summer in Switzerland, and we found that actually old women were the most affected, with nearly 400 deaths. That was basically 63% of the cases, showing again the importance of this kind of research, especially when it's addressed for specific court cases. As I said, the idea of health impact attribution is now becoming more relevant, and is thanks to different funders, etc., that are putting a lot of efforts in trying to develop research in this direction. And we know that especially within Wellcome, there have been different activities. And for example, in this study, in this review, different researchers, they tried to do some sort of assessment of the landscape of the research that was at that time in terms of health impact attribution. And it was interesting to see that in a way the research is growing, but it still is extremely sparse, focus on specific, let's say, health outcomes, that is mostly non-communicable diseases, heat, and also is mostly located in the global north. So showing again the need to develop more research in this direction. And the idea is mostly because they try to push this, that we need to provide with this kind of research another dimension about the impacts of climate change. It's providing more information. It can also help creating synergies with climate attribution science, with experts in other fields, and also the relevance of these kind of findings for different fields, and also increasing the availability. It's thanks to, as I said, the increasing availability of new epidemiological methods and data. So the idea is that we know now it's some good momentum for this kind of research, and it's basically, as I said, because of all this development of new approaches, new access, to data, but still, as I said, research is partial and biased, and in somehow we need to focus more, in particular, those areas that are more vulnerable and most affected by climate change. And there are different ways, and I think one important thing is try to improve capacity building. It's not only for us to lead our research, it's really to provide resources for different researchers, especially in the Global South, for developing their own research in their countries. Also to establish active dialogue with stakeholders is not what we think that it's interesting from the research part, is really to understand what are the priorities at local and regional level and try to focus our research on that. And also we need to kind of abide or follow some sort of best practice methodologies that eventually would allow to get more comparable estimates, more reliable estimates that would help advance science. And for that, I just want to mention this contribution that also was part of the Welcome Trust activities. And I don't want to go through the different steps, but what I really want to show is the need of combination of different experts coming from climate, coming from the health, and also the contribution or the joint work in different steps. This is extremely important to try to advance research in this field, really the interdisciplinary of this kind of research. And I just want to finalize with a little bit of advertising. So as part as well of the AdReverse, let's say, cohort, we are also leading a project that's called TACTIC with other colleagues of different institutions. And the idea is that we want to develop a toolkit, a website, that would put together resources for different researchers to develop their own attribution studies on their place, like tutorials, teaching material, databases, etc., that could, again, help different researchers to lead their own activities. With this, thank you very much.
Excellent, thanks. So we're handing over to Danielle Terwell. She's working on the GAP project and trying to coordinate the protocol for us involving about 10 disciplines and 20 countries and similar. So over to you. Good luck.
Hi, good morning, everybody. Thank you so much for that presentation, Anna. We set up the GAP consortium and we got in a room, and Sasha and Carolee and I had a conversation. Sasha's a lawyer, Carolee's a climate scientist, and we had an entire dialogue on attribution, and halfway through, we suddenly realized none of us were talking about the same thing when we said attribution. From a public health and epi perspective, I had this lens on what attribution was. Carolee had a very clear lens, climate lens on attribution, and Sasha had a very clear legal lens on attribution. And we realized that speaking the same language is incredibly important, particularly when you're trying to move forward and advocate for change. And so we're going to take a step back from Anna's presentation now, which was excellent, and kind of do a breakdown in different respective fields on what attribution is and how it has contributed historically to kind of health impacts. That's me. So attribution methodologies have historically informed a range of public health interventions, from regulatory policies to health promotion to optimizing healthcare delivery. Attribution evidence demonstrates how much of a disease can be prevented by targeting modifiable risk factors. It can contribute towards effective health planning, evaluation, and really importantly, resourcing. So yesterday, Prof. Gasparini said that epidemiology is the most important field. And based on the reaction to that, I assume there are a lot of epidemiologists in the room. This is targeted at non-epidemiologists, so bear with me as we go through this. We're going to go through a few basic terms in epidemiology. So epidemiology is primarily focused on estimating or finding a causal effect of an exposure to a disease outcome. We do this through various methodologies, from randomized control trials to observational cohort studies. And the first important term that we use is around risk, which is simply the probability that an individual develops a disease over a period of time in a given population. So if you have 100 people in a population and 10% have a preterm birth in 2025, we would say that there's a 10% risk of preterm birth in that population. The next term we speak about is relative risk. And relative risk is really important because it describes the strength and direction of the relationship between the exposure and the outcome. It's key to causal inference, as Anna alluded to. Relative risk is the ratio of the probability of an event occurring in an exposed group as compared to the probability of the exact same event happening in an unexposed group. It quantifies how much more or less likely someone is in the exposed group as compared to the unexposed group of having a clinical outcome. So if we split that same population of 100 into two groups of 50, whether through randomization for an intervention or through an observational cohort, and we see 8 get the outcome in the exposed group and 2 get the outcome in the unexposed group, and so we have a 16% incidence in exposed and 4% in the unexposed, we would say that the relative risk would indicate that they were at 4 times greater risk. And that's really important for individual personal risk. Attributable risk estimates the proportion of a disease incidence due to a specific exposure. And we only really calculate this once we've inferred some sort of causal inference. Attributable risk answers questions like how much of this disease can we prevent by eliminating this exposure in an exposed population. It's not a ratio, but rather a measure of difference. And again, in that population that I described with 16% and 4%, we would say that those who were exposed, 12% of their risk was attributed to the exposure. So the way that this is most commonly used historically in epidemiology is around the population attributable risk. In the example I gave you before, we were speaking about the risk in the exposed population, but what the population attributable risk measures is the proportion of a disease in an entire population that is due to a specific exposure. And that way we indicate how many cases could have been prevented in a given population if that exposure had been completely eliminated. It represents the absolute difference between the disease risk in the entire population as compared to the unexposed population. This is a really important measure. It helps public health officials understand burden of disease from a specific risk factor and develop potential interventions. It's also particularly useful in exposures where randomization may be impossible or unethical. And so we see that with smoking. Hypothetically, if we could remove smoking from an entire population, how much could we reduce coronary heart disease, or how much could we reduce lung cancer by? The other instances where this methodology is commonly used is in environmental exposures or occupational exposures where you have cancer outcome risks, or infectious exposures like HPV and cervical cancer. So we know that 70% of cervical cancer is attributed to HPV 16 and 18. And that's critical for public health officials who, when deciding on vaccine programs, particularly in resource-limited settings, may pick the bivalent vaccine over the non-valent vaccine, or as opposed to no vaccine, they were going to have no intervention because it was too expensive. Acquiring the bivalent vaccine is going to have a significant impact on cervical cancer incidence in their population. So today, I think we'd say we feel confident saying smoking causes lung cancer. And in their seminal study in 1950, Dole and Bradford Hill found that lung cancer patients were far more likely to be smokers. Only 0.3% of cases were never smokers versus 4.2% of controls, which showed about a 14-fold increase in risk. And relative risks, like I said earlier, are critical because they quantify the risk reduction for an individual and show the strength of association that's important in causality. Anna spoke extensively about causation, and I'm not going to touch causation today because I think that that's an entire day's conversation. But I think causal inference is really important. And causality, kind of, you look at the classic criteria, you're looking at strength of association, consistency, specificity, temporality, did your exposure come before your outcome, like biological gradient, the more you smoke, the more at risk you are of lung cancer. Not always the case. The more HPV you have, the more cervical cancer. Not true. So not all criteria are always fulfilled. Plausibility, like what is the biological mechanism we're expecting? What's happening at the cervix with HPV exposure? What's happening in the lungs with smoking exposure? Coherence, experimental evidence, which is randomized trials, and analogy. Although not all the criteria are fulfilled, many are fulfilled for the smoking and lung cancer link, and that's despite us only having observational data. So as I said before, attribution quantifies how much of the adverse health outcome is caused by specific exposure by measuring risk difference. Once causation in smoking was established, more recent smoking attribution studies came out 50, 60, 70 years later, and they demonstrated how much smoking is accounted for the disease incidence of lung cancer. For example, a Norwegian study 70 years after Bradford Hill's study showed that among 142,000 women, smokers had a hazard ratio of 13.8, very similar to the 14 found by Bradford Hill, as well as 1.3 for passive smokers. The population attributable fraction was also calculated in that study, and they calculated it to be 85%, meaning that 8 out of 10 cases in Norwegian women could have been avoided had smoking been eliminated in that population. More recently, in the US, they show that lung cancer death rates are declining, and this is largely due to the decrease in prevalence, although smoking still remains the highest attributable cause of lung cancer. And this emphasizes the crucial public health impact of attribution-driven interventions. So as Matthew said, public health interventions are critical, and framing this within a public health response is really important. Public health services focus on assessment, policy development, and monitoring and evaluation, and they center around equity. We can utilize attribution data to better allocate resources effectively and tailor our interventions and monitor them for most affected populations. So smoking causes lung cancer, heat-attributable climate change, and adverse birth outcomes. So the body of evidence is growing, and I think we're starting to feel more and more confident in speaking about causal inference and attribution. And I think the Section 4 posters downstairs have done an excellent job of demonstrating this. So I would recommend going to have a look. I'm not going to present Anna's study on her behalf, but I think it's really important because what it has done is it's given us data that quantifies disease burden. And this allows us then to quantify economic costs to climate change, including healthcare and infrastructure damage, which are key to directing resources and then enhancing climate health litigation. This also allows us to calculate years of life lost or disability-adjusted life years lost and their associated costs, which allows us then better to evaluate adaptation and mitigation interventions in terms of health outcomes, but also in terms of their costs. These assessments determine whether the health and economic benefits of mitigation outweigh the cost of inaction. So how much more money and deaths are we going to see if we don't intervene versus if we do? And there are very few impact attribution studies out at the moment. I think particularly a dearth of data in the Global South. And so I think the GAP project is going to fulfill a very important gap in the knowledge at the moment, particularly in areas where resources are constrained. So thank you very much.
So the next speaker is Coralie from Leeds University, who's a climate scientist on the project. We look forward to your talk. Thank you.
Hi everyone, it's great to be here today. So I'm Coralie Adams, as Matthew said, from the University of Leeds, and I'm working on the GAP project on the kind of climate side. And obviously today we're talking about attribution, so I'm going to cover what is attribution in climate science, kind of cover some core terms and methodologies that we use. So I've just put here the definition from the IPCC, a definition, and I think in general you can see throughout kind of what we're talking about, we are all using the same definition, but I think the difference is how we're applying it. So for me, climate attribution is about understanding how changes in the observed climate system are due to human influence. So we're kind of separating the signal, which is human-induced climate change, from the noise, which is the natural variability of the weather. And I also thought, kind of in our discussions that we've been having in the GAP project, we're talking a lot about climate attribution, but even when we talk about that, we're talking about different things. So when I think about climate attribution, I think that it's a whole field consisting of different subfields. So you've got trend attribution from the 1990s, looking at trends in variables over time, how they're due to anthropogenic influence. Then in 2004, as Anna mentioned, we had this seminal study on event attribution where we were able to kind of define these extreme events and how they're affected by climate change, anthropogenic climate change. And then more recently, as Matthew touched upon, we've gone into more source attribution, being able to detect the actual sources of this anthropogenic climate change. And then finally, also quite recently, we've moved into impact attribution, which is what the GAP project is aimed at working on. So I've put the definition here. So it aims to quantify the social, economic, and/or ecological impacts of climate change on extreme weather events, and it's influenced by both trend attribution and event attribution because you can combine both of these into impact attribution. So now I want to take a step back. So kind of imagine, like we've had a heat wave, which is very easy to imagine after this summer, especially in Europe. And what kind of questions do we want to answer about this event? So I think first we think about maybe the hazards. We want to know how much more severe is it due to climate change and how much more likely is it due to occur due to climate change. Then we want to talk maybe more about the impacts. So what are the consequences of this heat wave? And then the key question is, how do we answer these questions? So in climate science, what we do is we define the factual and the counterfactual scenario. So I'm going to kind of break this down, and I've made a conceptual diagram. So as you can see, we've got temperature with time, and I've put kind of like observations. So we've kind of got this long-term trend and increase, but a real key that makes this challenging is the messiness and the noisiness of the signal. So you'll have a lot of different things, and in real life as well, the data's super messy, which is why I've just put it quite simply. you've got multiple things affecting the temperature with time relationship. You've got seasonal oscillations. You've got these more large-scale climate features like ENSO, which can have impact over years at a time, and they can affect globally, leading to heat, drought, heat waves, floods in different regions. And then you can also get other ocean and atmosphere oscillations that feed into this trend. So what do we do to kind of ascertain what is due to anthropogenic climate change? So we define the factual, which is the currently observed world as it exists in the context of climate change. And you can see here, it doesn't quite match up to observations. So this is because a lot of the time when we do this work, we'll use climate models, and they're not a perfect representation of the observed conditions. And then we define the counterfactual. So this is the hypothetical control world that's only been impacted by natural forcings and internal variability. Another great thing that we can do is we can use these projections to look into the future and look at the projected future world under specified SSP scenarios, and we can then bring this into impact attribution. So then I wanted to talk a bit, so it's like, well, okay, we define the factual and counterfactual, but how does that actually work? What data do we use? What are the methods? So I thought I'd spend some time talking about that now. So as I said, a lot of the time we're using climate models. So I've put a little example here. And a great thing about these climate models is we can run an ensemble of models. So we can run multiple different models, we can run the same model lots of different times, and this means that we're more likely to get a better estimate of the climate, and also we can get these uncertainty estimates. Another benefit as well with climate models is this is how we can ascertain how much of this trend is due to anthropogenic forcings, how much of it is due to natural forcings. And another benefit is we can even split out these anthropogenic forcings. So in this figure, they've split it out into greenhouse gases and aerosols because there's lots of different things that are affecting the signal that we're affecting. But negatives of this method, so these are very computationally expensive, these models, especially when you're running lots of them, when you want to run globally, when you want to run at higher resolutions. So they're not that simple. And also, as I said previously, they're run over like hundreds of years sometimes. So they're not close to the observations necessarily. They're kind of this simulated world. But when we're doing impact attribution, it's really important that we actually have this daily variability in temperatures and that it's as accurate and reliable as possible. So to achieve this, we have to apply bias correction methods. But this then can lead to other uncertainties, and there's lots of different bias correction methods that can be used. So the next, what we also will use is observations. So here I've put some reanalysis products that were used in a heat health impact attribution study. You can see here they've used 3 different reanalysis products. And you can also use weather stations, and I've put here a geographic map of the location. So this is both active and historical. So a great reason to use observations is they're a much better representation of the daily variability, which we need for this impact attribution. But some negatives. So I think as you can quite clearly see from that weather station figure, we've got really big geographic disparities in our weather stations. And these feed into all the other products, which means that we've got these biases, especially over, let's say, I think Africa and Latin America. We've got these biases in all of our products, which makes it much more difficult to project climate change or simulate. Another issue is you've got this limited sample size when you're using observed data sets. So this study that used reanalysis data, they're able to use 3 products, but still, that's nowhere near the kind that we can get if we use climate models. And another big issue is they only have a limited, they can only go back so far. So it means that our sample size is quite limited in terms of the time as well. And also, with these products, we can say, well, it's hotter now than it was in 1850, but we can't definitively say from this, well, is this due to anthropogenic climate change, or is this just natural things that are occurring in the weather systems? So I think that's why it's really important that we also use these climate models. So then, I think in like recent studies that I've been seeing, so this is a 2025 study that Anna worked on, they're using a heat mortality case study in Zurich, and they're using they're using climate models, reanalysis data, meteorological stations, and they can then combine these. So from this study, they got the benefit of having these observed daily conditions for their impact attribution method, but they were also able to use the climate models to feed into that counterfactual scenario and ascertain that it is anthropogenic forcing. And then more recently as well, there's this study, so this is 2024, where they've used machine learning methods to create the counterfactual and factual scenario. So they did this by they trained a convolutional neural network on climate models from kind of 1800s to 2100. And this means that then they had this really good representation of the factual and the counterfactual, and then they fed into it reanalysis data for the actual extreme event attribution. So the benefit of this was, sorry, I'm losing my train of thought. So the benefit of this is they could run this kind of quite normally computationally expensive method of running lots of different factual and counterfactual scenarios, but it was much less expensive because it was using machine learning methods. And also, again, because we've got this reanalysis data, it had better representation of observed conditions. But again, this method is hindered by the sample size that's available of reanalysis data. As I said, you can only go back so far, and this means if an extreme event happens today, and then we look back in like the 1850s at our data, we might be like, well, this hasn't occurred before, so therefore the probability of this occurring is much bigger now. But actually, is it just that our data sets only go back so far and they've only got a very limited record? So these are kind of issues that I think are really key in this field. So finally, I'll end on some things to think about when we're defining the counterfactual scenario. So as I kind of briefly said, these models are limited by the quality of the data used as inputs. And when we're looking at regions such as Africa, which we've been talked about quite a bit today, it means that our models are much maybe lower quality than if we're looking at Europe. So it's just a huge disparity. And also spatial and temporal resolution of data is huge. These different products have different spatial resolutions. So a lot of these like global climate models are quite a coarse resolution, which means, and when you've got these extreme weather events that we're looking at, they're happening on much smaller spatial scales, so they're not as well represented by these climate models. But as you go higher resolution, the more expensive it gets, the longer it takes to run. So these are some real key limitations. Finally, years available. So this is if anyone is using the DARMIP simulations or LESMIP simulations. They're only run with observed reanalysis data up to 2014. And then after that, you have to stitch on projections based on SSP scenarios. So this means that these models are maybe even more divorced from reality. So I think bias correction is a huge importance when we're conducting these studies because we need to try and have the daily observed conditions. And then finally, I haven't really touched on this here, but event, I think it was touched upon by Anna, is that event definition is really important, and how you define your weather event, what temporal scale you look at, what spatial scale you look at, that can really affect these results. And the kind of methods that we apply can lead to completely different results. So it's really important that we have like a robust method. Yeah, so thank you so much for being here today. I hope this is helpful for attribution of climate change. And thank you to all the other panelists. Thanks.
Thank you. That was superb. Thank you very much. And then we're going to hand over to Nick Brink. We're going to discuss some of the methodological aspects. Thank you, Nick.
Thanks, Matthew. So sorry, I'm standing in for Prof. Cathal Walsh today, so I'm not Prof. Cathal Walsh, and nor do I hold a chair in biostatistics. I'm much more comfortable delivering babies than calculating confidence intervals. So today I think I'm just going to discuss a little bit what attribution is in data science and perhaps what data science can contribute to the field of health impact attribution. So Matthew presented this slide earlier, which I think is quite a simple figure showing how we might start to untangle the burden of disease that's not due to climate from that due to climate, and then further trying to detangle what's due to natural variation, what's due to climate change, and how this might change in the future. But really, under the hood of that, things get quite complicated. As we've heard from Coralie, just looking at the left-hand side of this, the climate is very complex. It's chaotic, and there's a lot of uncertainty. There are a lot of things that are influencing it. I learned yesterday about aerosols and how that's actually having an impact that we don't really fully yet understand, perhaps. But with health impact attribution, if you look on the right side, we also need to start considering other things that are happening in the health system, things that are happening in real life. Things like changing vulnerabilities. We see in Africa, which is warming faster than the rest of the world, that fertility rates are going up, that people are having more children, and actually that they are, in some instances, becoming more impoverished and more vulnerable. In the global north, we're seeing people have a dramatic uptick in adaptation mechanisms. We've been sitting in a climate-controlled environment. I was told to bring warm clothes here. but actually I'm just too hot in here because it's all very neutral. And that all has an impact on how we calculate our attribution. So to try and tackle this complex question, GAP developed this framework, which everyone, when they look at it, they think, wow, that's insane. And it is, because it's so complicated. And this is where data science comes in, because data science is trying to take something very complicated and give us the tools and give us the means to try and simplify it, to try and provide a perhaps imperfect representation of the world, but something that is actually digestible to people from all disciplines. So as I said, I'm not a statistician, so I'm going to try and simplify this down into something that makes sense to me. And if we look on the left-hand side of the graph, I think this is where epidemiologists, a lot of people are more comfortable. It's taking observations, it's taking things that have happened, pregnant women who are exposed to hot temperatures, pregnant women who are exposed to cool temperatures, and creating a model. And that model is probably wrong, but we hope that it's useful. And that model over there, I think that's where a lot of people stop. They give us the odds ratio, they give us the relative risk, they can describe what they found from their study and what the assumptions were, what the biases are. But what I think we need to start to realize is that actually that model is a representation of the world, and we can do some very useful things with it. Sure, we can always improve it, and we strive to improve it, but even now, we can get a pretty good understanding of what that model is. And once we have that model in data science, we can start changing things. We can start saying, okay, in scenario 1, what would happen in this model if we had a pregnant woman today in Estonia who was exposed to the current climate? What would happen? And the model will predict, it will give you a prediction, whether that's through a traditional statistical framework or a machine learning framework, it will give you a prediction. You then give it another scenario. You say, okay, what if they were actually exposed to slightly cooler temperatures? And perhaps in this case, the pregnant woman doesn't have a preterm birth and carries to term. And we can do this a number of times. We just change little parameters. We can change the climate parameters, like Carly's presented. We can show the factuals, the counterfactuals. We can look at different ensembles. We can really start to explore machine learning climate models, and we can iterate this process continuously. And data science is really the field of big data. And what's nice here is that we don't just have to influence climate variables. We can say, okay, what if the world actually wakes up? What if the world starts to provide adaptation responses to those who need it? How is that going to influence scenario N? What's going to happen to that pregnant woman? We can say, okay, what if actually we don't get a handle on other causes of preterm birth, sexually transmitted infections? What if we really fall back on maternal, neonatal, and child health? What's going to happen? And so that's really what data science is trying to do. And of course, I've simplified it here. In GAP, we have quite a complex approach to trying to understand this, and it's still evolving. As we heard from Anna this morning, these methods are quite new, and they're being really pushed and developed by others in the field. And so in GAP, we have traditional methods. We're developing machine learning frameworks, both in the climate space, but also in the health impact space, using ensemble methods. We use probabilistic and non-probabilistic, one-step, multi-step. There really is a suite of them. But at the end of the day, we are really just trying to understand and create a digestible climate health impact attribution pipeline. And the end product of this in data science is something that we can visualize. We don't want to give the public risk ratios and odds ratios that often get misinterpreted. We want to develop dashboards where you can actually interactively change them. You can say, okay, I want to look at preterm birth. This is an example of preterm birth in South Africa for illustrative purposes. And we want to know how many cases were there in the period we're examining. How much did that cost the country? And importantly, how much did we save by actually not going to the worst case scenario? How much did we save by giving pregnant women cooling interventions? And this can be adapted as the evidence progresses. Because, as I said, this model is not perfect. It probably never will be, but we can still make use of it. Oops, I seem to be missing a slide here. Let me see if I can edit this quickly. No luck. Okay. I'm going to go back here. So I think what I wanted to end with was what can GAP bring to this? And really what GAP is trying to do is to develop an end-to-end analysis framework. We want to be able to take climate data, health data, vulnerability data, and integrate those into one uniform, harmonized data set. And Dr. Lalou will be speaking about the Harmonized project later, which is looking to assist with that. We then want to take that and develop a centralized analysis platform where we can learn from experts in the field like Dr. Vedo Cabrera and see how we can really democratize this analysis so that anyone can come in and do the analysis in their area of interest, their outcome of interest. We then want to take that and create knowledge products, things that are digestible and useful for various stakeholders, whether it's lawyers, whether it's the media, or whether it's scientists. And what we can do with this is, in data science, is we can start to actually move towards real-time analysis pipelines. And we really think that's going to be useful because I think one of the frustrating things for me in public health is the slowness of the response. I mean, there's still papers today coming out on COVID, and sometimes, you know, they will be useful in future pandemics, but you think, wow, that would have been really useful to know at the time. So on that, just to thank everyone and all of our teams, and just to disclose that I have fossil fuel investments through my managed pension fund, so I'm also responsible for this problem. Thank you.
Thanks, Nick Brink. I love the slide on the dashboard, and I think we're getting closer to making a dashboard. And that's set against the fact that there's around 100 studies now that show the impacts of heat on preterm birth. So we're not making a dashboard or developing this evidence in a vacuum. We're building really on at least 100 studies in this field. So I'm going to hand over to Sasha Stevenson. She's from Section 27, which for 30 years has been the leading NGO in the human rights and law space in South Africa, has done remarkable work really in advancing access to services and human rights in South Africa, and is now the climate and law champion in the country.
Thanks, Matthew. It's such a pleasure to be here to talk about what I think is a really exciting interdisciplinary project that could really push forward some of the things that we want to do. So I'm going to be speaking about attribution in law. There we go. And I guess the question for you might be, why on earth does it matter? Why should you care about attribution in law? Well, in its advisory opinion in July this year, the ICJ, the International Court of Justice, stated that failure by states to take the appropriate steps to mitigate and adapt to the effects of climate change, including, notably, through regulation of the private sector, is an internationally wrongful act that exposes states to legal remedies. And so now, more than ever, the prospect of litigation is present, and those of us who are interested in climate change and health need to know how to speak to each other and how to make connections between climate and health harms across disciplines. When you're involved in litigation, you're putting your trust in a very powerful system that just doesn't think the same way as you do. Courts confidently make authoritative statements not just about the law and climate change, but also about the underlying scientific evidence. These are not scientists, but they're making these authoritative statements about science. We don't always speak the same language, and the risk of a court getting something wrong is significant, particularly because courts in climate change cases are tending to rely on courts in other parts of the world more than they would in other matters. So every case litigated around the world has the potential to influence other cases. Litigants and courts are having to stretch legal concepts that were never designed for collective action problems like climate change. And so we're in difficult territory, and we need to make sure that we're all actually on the same page. So we've spoken about, in this panel, about attribution in public health, in data science, and in climate science, but how will a court be looking at causation or attribution in a case before it? There are two elements to consider that a court considers. The first is factual causation. To find factual causation, a court must find that but for the conduct, the outcome or the harm would not have happened. So the conduct could be an action without which harm wouldn't have occurred, or it could be a failure to act where there was an obligation to act. and if there had been action, the harm would have been avoided. And this is often seen as a black and white test, and it's often seen as a big hurdle in cases like this, and it can be a big hurdle. But in fact, while this so-called but-for test is something of a black and white test, there's also a bit of gray, and that's what I want to highlight. So in 2012 in South Africa, there was a case in which my organization was involved about the spread of tuberculosis in prisons. The prison authorities had failed to do any screening of incoming inmates, and TB in prisons was rampant. So while the person who brought the case, a man called Dudley Lee, couldn't show exactly who had given him TB, and he also couldn't show that if there had been proper screening, the risk of him having gotten TB would be zero, what the Constitutional Court found is that the risk of TB spreading was so significantly increased by the failure to screen that the test for factual causation was met. So even though he couldn't show A caused B, he could show that there had been such a significant increase in risk that the test for factual causation was met. This is a really important expansion, what the court described as flexibility in this but-for test. And I think it's going to be really significant in climate health litigation. So the next element of causation that we need to look at is legal causation. Now, there are various legal tests, and I've written some of them down there, and I'm not going to go through them. The gist really is that the court has to decide whether it's right to hold someone liable in a particular case. The court wants to make sure that it's preventing liability where liability isn't appropriate, so that there won't be sort of runaway liability, open, endless liability. But the court also needs to look at ensuring that liability exists where it is reasonable, fair, and just. So you can see there's a bit of wiggle room in this legal causation test. It's really for a court to say, okay, the first element of causation has been passed, but for this conduct, the harm wouldn't have been caused. But is it right in these circumstances to find liability? So when considering climate health litigation, this element will be very important. Now let's try and apply it then to climate change and health. How do we apply these elements? So for factual causation, we need to show that the health harm wasn't caused by something other than anthropogenic climate change, or that the risk of harm was significantly increased due to climate change. Now, this is really where your science and analysis comes in. You'll need to show this clearly, and importantly, you'll need to be able to communicate it clearly to the court and show how the risk has increased as a result of anthropogenic climate change. For legal causation, we'll need to show that it's reasonable, fair, and just for there to be liability, and that the court wouldn't be causing limitless liability by finding legal causation. This is really where human rights comes in. In South Africa and many other countries, the human rights of many people that have been violated by the action or inaction, and the foreseeability of the harm would be strong indicators of reasonableness, fairness, and justice. Some of this, as you can tell, requires a bit of a shift from a public health broad attribution perspective to a human rights perspective, to show that we're considering the human rights of the individual, not just the broad attribution in public health. So how can GAP be useful here? The panel's been speaking about the GAP study, and the next question is how the GAP study can contribute to showing attribution in a legal setting. Well, the GAP study highlights or isolates the health impacts specific to climate change, and this is going to be fundamental in showing factual causation. And it spotlights the consequences of those health impacts. And this in turn leads or assists in showing that it's reasonable, fair, and just for liability to be attached. And so GAP's findings could be central to doing some of the evidential heavy lifting that's going to be required in these cases. Importantly also, GAP focuses on communication of these elements, and that's vital to getting scientists to speak law and lawyers to speak science. Now, of course, climate litigation and climate health litigation isn't new. It's fairly new, but it's not new. There have been over 3,000 climate change-related cases around the world that have been filed, and some of them have had to deal with health harms attribution. Rana Al-Sayed, who's a master's student at Trinity College Dublin, looked at all of the climate health cases that have been litigated in the Global South and found some interesting trends. First, successful litigants have leaned on the duty of the state or industry to protect or not to cause harm. This, of course, contributes to answering the test for factual causation, where there was an obligation to act, but that obligation was not met. Secondly, successful litigants have relied on evidence to show attribution, which is a challenge in the Global South, where much of this evidence hasn't been collected and the analysis hasn't been done, and we're hoping that the GAP study can fill some of this gap. And then thirdly, successful litigants in the Global South have relied on the vulnerability or have leaned on the vulnerability of affected people and groups, highlighting the human rights impact and demonstrating the importance not just, as I said, of population-level attribution work, but also making the connections to real affected people. There have been various challenges in health and climate litigation in the Global South, but what is clear is that public health professionals, climate scientists, and lawyers need to work together to translate evidence for different purposes. And access to justice, particularly for vulnerable people, remains a problem and one that we need to solve to ensure that their interests are represented and courts hear from and make decisions for those who are on the front lines of climate change. So thank you to the Wellcome Trust for supporting this work, and please contact me and ask any questions if you'd like to know more. Thanks.
Thank you very much, Sasha. So we're going to hand over to our last speaker for this session, Victor from the Zimbabwe Ministry of Health and Childcare. Thank you.
Thank you very much. Colleagues, let me pick up from where my colleagues have left. I will address the issue of attribution in climate-related policy making with special reference to Zimbabwe. Why do we talk about attribution now? I think it's very important, especially to policymakers, because with reference to Africa, we have got fragile health systems, and these have limited budgets. We have got climate shocks, persistent data gaps, and rationing is unavoidable. In most cases, we don't have funding for climate change and health programs. And probably reflecting on what health attribution is, we are talking of estimating health burden linked to climate change versus natural variability. It's unfortunate that you can't budget for things that happen naturally, but the GAP project has given us an impetus to work on a project that will give pointers where policymakers can now make budgets basing on. The practical implications, issues of quantification of additional cases, deaths, and costs caused by natural variability, I think these are very, very important because it assists policymakers in determining and also in basing their arguments. Then there are also issues to do with governmentality perspective, which transforms acts of God into governable burden. And we are saying whatever happens, if it is well budgeted for and expected, then we know that the system can cater for that. What are the importance of attribution for policymakers? Then there is accountability. Attribution ensures that policymakers are held accountable for their decisions and the outcomes of their policies. It helps in assessing the effectiveness of policies and programs. And there are also issues that have affected a lot of policymakers, issues to do with transparency. And you will see that once we implement our GAP project, these issues are dealt with. There is a clear attribution that fosters trust among stakeholders, including the public. by showing how decisions were made and the evidence used. Then there is informed decision making, where understanding the impact of past policies allows the better future decision making. It aids in identifying successful strategies and avoiding past mistakes. Then resource allocation. Policymakers can then allocate resources more effectively when they understand what works and what doesn't work. I think this is where we fail, because in most cases, resources are not equitably and justifiably located. What are the challenges that are associated with attribution and policy making? The issue of data availability to justify resource allocation. And I think this is, you all agree with me that this is what is going to be bridged by the GAP project. There is limited access to reliable and comprehensive data. And this can hinder effective attribution. And then the complexity of outcomes. Many factors influence policy outcomes, making it difficult to isolate the impact of a specific policy. Then the time lag. The effects of policies may affect time to materialize, complicating immediate attribution. Then the political resistance. There may be pushback from stakeholders who prefer not to have their policies evaluated. But we know that once the GAP project has yielded some results, then this will work in favor of the policymakers. The Zimbabwe attribution pathway from 2025 to 2027. The GAP as a platform, institutionalizing attribution as a scientific and political instrument. And where we have started assessing through research most of our climate change and health programs, so that we have indicators that are understood by policymakers, including politicians, so that they can use them as they allocate resources. Then the health National Adaptation Plan integration, where there is provision of quantified evidence for governance. Then climate bill support. As a country, we are developing a climate change bill, and we want to ensure that there is fiscal accountability, and we include all climate change and health indicators or areas, so that come allocation of resources, we are also within. But remember that we have to justify that with the information that we are getting from the GAP project. Then treasury cycles, tracking health-related climate costs transparently without guessing. Last year we had a climate change conference in the country, and unfortunately it was about agriculture, because the health system hasn't yet made indicators that can convince Minister of Finance that we have got need for funding. Then the continental positioning, where my colleague, Dr. Fortunate Machingura, is hosting CDC Africa and AU frameworks. She started that, and today, this week, she's in Zambia, where part of the SADC, she's addressing, and she's also discussing with the CDC Africa, the southern region, so that there is adoption of health and climate change programs in the area. I think this is one of the biggest challenges, because even as you discuss, we don't have any facts, and countries are not even, there is a lot of awareness that is needed so that they can take up the project. And I'm sure the GAP project will lighten this and assist countries in adopting climate change and health indicators. The next steps, we want to identify key metrics by determining which indicators are most relevant for evaluating the policies in question, and data collection plan, develop a strategy for collecting the necessary data, including partnerships with the data providers and research institutions. We also establish evaluation framework by creating a framework for assessing the impact of policies, including methodologies for attribution analysis and engaging stakeholders. Probably I can give an insight and say, as a country, on the 1st of July, we had a meeting with all stakeholders with interest in climate change and health, where we formed a committee that is leading with the secretariat under SESHA, which is led by Dr. Fortunate Machingura. We pilot studies. We are also conducting pilot evaluations on select policies to refine methods and establish best practices. May I mention that the Wellcome Trust has supported us as we track the impacts of climate change on maternal and child health, the Global Health Attribution Project. Thank you very much, ladies and gentlemen.
So if the panelists can take a chair, please. And so we have a few questions for the panel, but I think it would be really interesting to hear from the audience. Sure. So there's the first question already. Do you want? Yeah.
Count to one future life. And so there's a clear metric that you can do the maths. And so I worked out that a 3.5% NATO uplift in spending would cost about 2,300,000 lives in the future. And so, human rights can't be attributed to people that don't exist yet. And that's a key problem that I wrote about in a book I wrote. And so, I'd just like the panel to think about these two groups that can't be included. And if we think about the modern human, it's more than ecosystem services. We need them. We rely on them, and they have a right to exist themselves. Thank you.
I think that's a great point. In South Africa, the Constitution is one of the, Sasha, you're going to have to correct me here, but one of the few in the world that I think does include mention of future generations and our responsibility to protect, to protect the environment for them.
Yeah. So I mean, I think you're right. Human rights is not enough. It's not in itself. It's not enough. It's a very good start, though. And I think what we need to do is ensure we're using what we've got. And in many countries around the world, human rights, and particularly the right to an environment that's not harmful to health, which is how it's framed in South Africa, the right to dignity, equality, freedom, all of those are extremely helpful tools, not just in litigation, and I think we need to highlight the fact that the law is useful not just for litigation. The law is useful as a persuasive tool. It's useful to support policymakers. It's useful to mobilize people, but also in litigation it's useful. And so I think you're right. If we were to sort of reinvent a perfect legal structure, we would have a whole lot more. But what we've got at the moment, I think, is sufficient to do a lot. And it's a helpful tool globally and importantly domestically to moving us in the right direction while we hopefully develop a more expansive understanding of what our legal frameworks should cover. But Matthew's right. Often human rights can be interpreted more expansively than they sometimes are, and I think that's a project for all of us.
Thanks, Sasha. So I think, Nick, your dashboard needs to now include an additional box. That's a very good suggestion. Maybe, Sasha, did you want to respond? Or,
just to maybe add on that note, I think, you're right, it's not enough, but I think that's what GAP's trying to do when we're engaging with multiple stakeholders, in that we need to make different arguments to different audiences. And I think we've seen, Matthew's mentioned this a few times, the moral argument doesn't always stand these days, as much as we would like it to. And I think that there's an economic argument that holds more sway with those who are making decisions at the moment. And we need to be making those arguments too. And I think we as a community also need to be quite conscious of the future, but knowing what the priorities of politicians are, and actually being pragmatic about it. To say, if you protect people now, if you mitigate now, you're going to help people now, you're going to fulfill your political ambitions and all of that, but the long-term effects are much greater. They can't see that. Perhaps we can, and that's okay, as long as they're doing the right things now, and we need to hold them to account to do those right things now, through whatever means necessary.
Yeah, please.
I argued this in my book, that if we don't need to trade off intragenerational justice against intergenerational justice. If we have clean air now, clean water, and we push justice through the community now, this will push it into the future. So yes, I agree completely. Thank you.
I think that to take this one step further, maybe, public health is much more of an art than a science, and it's it's a question then of what is the most strategic move. Maybe a better way of putting it is that it's really about what levers do we have and should we focus on using to change the trajectory of the crisis. So in terms of the legal levers, there's a range, there's probably more than a handful of options for a litigation procedure that one might pursue. So I don't know, back to you, Sasha, if you can you just give some sense of what are the options that one might pursue, assuming we have gathered this level of depth of evidence and there was funding to support the case, what would be the potential targets and some thoughts on which might be most strategic, which is the artful one.
Yeah, there are a lot of options. I think one of the clearest obligations, particularly now after the ICJ advisory opinion, but also domestically within many countries, are the obligations on states to regulate the private sector in the interests of people, for the protection of human rights and for other reasons. And so I think our governments are clear targets. That's not because we want to leave out some of the carbon majors, like Sasol, a South African company that contributes about 10% of our greenhouse gas emissions and is one of the carbon majors from tiny little South Africa. It's not to leave them out, and we certainly shouldn't leave them out, and that's maybe the second step. But I think the first may well be about regulation of the private sector and the obligation on the state to ensure that the private sector isn't causing harm. It's difficult for the state to do that because they have many pressures. And this kind of work, showing the extent of the harm and the attribution of the harm, is really, really important for policy making and would be important for litigation pushing that policy making. The second, I think, is litigation directly against those who are causing harm. And that litigation could be with a view to trying to prevent, to put measures in place to prevent it, or to compensate for the harm that they are causing. And that could come in the form of a particular company that has caused a lot of harm, or as you referred to, a particular project that's causing a lot of harm. In South Africa, we have government has included within its integrated resource plan the likelihood of building new coal-fired power plants, which is crazy in 2025. That decision is being challenged legally, but some of the evidence that I think will, and the analysis that will come out of the GAP project, will be such a useful additional source of evidence for challenging it. If we can show not just that there will be broad health harms, but there will be X number of additional preterm births and what that will cost the health system. And I think the maybe fourth option is for civil society and scientists to work with government themselves to challenge the private sector. So an example is what's happening in Brazil at the moment with litigation by the government of Brazil against tobacco companies for the health sector costs of smoking. I can anticipate something along similar lines in the future, but what that's going to take is good evidence, good communication, and brave governments. And we don't have any of those three at the moment, and so we need to work on all of them, I think.
So I think your last point there is that there's levers beyond levers, and or mountains beyond mountains. There's one step will then lead to the next one. And I think maybe one important thing to do is to take a step back. Sure, these court cases are fantastic, and I think they in themselves will do a lot individually, but as a collective with a number of climate and health litigation cases going on, I think those as a collective will then drive an organization like WHO and others to be saying, no, look, we also are responsible for creating these international frameworks, just like we did with tobacco. It took 50 years then. It may well take a similar duration with in this response. But these court cases then can act towards generating momentum for something similar to the Framework Convention on Tobacco Control, where the health sector says, look, actually, we do need to be setting the rules and standards and not leaving that up to the energy sector. So I think that's the end goal for us is that particular lever. I wonder if we could turn to Anna for a minute there. And I think as a general question around the comments on the methods in this field and on, I think many groups are somewhat intimidated by attribution science. We see this is a new field. It seems to be, uncertainties around which method is best and how one should do it. So I'm hoping you'll be able to reassure us and say, not, don't worry too much. but I think perhaps, said differently, what kind of advice would you give to a group of how they might proceed from these impact analyses, which again is one of the levers, but to move to the next step? There seems some questions in the back. Sorry, but yeah.
Yeah, I can quickly answer. I mean, in a way, I won't be terribly worried. It's true that based on the presentations today from the EPI side and the climate science part, I think it's true that there are many methodological issues that one needs to account for and be very careful and also align with the research question, which I think is extremely important. But at the same time, I think that there are already existing methodological frameworks. It's not like we want to reinvent the wheel. I think it's just to assess case by case the research question, what we want to achieve, and then apply the proper methods, basically. But I think, yes, it's a new field, relatively new field, but we can definitely leverage the work of years of development of methods in epidemiology and climate science.
Excellent. And I think Danielle highlighted that it's a new field in climate change, but it's certainly by no means a new field in public health and in statistics. So I think there were some gentlemen at the back who had a question. Apologies, yeah. And thanks, Anna. That's reassuring. Don't be shy, yeah. Not like you.
Yeah, we have two questions. So one was about the methodology that you discussed now, and I guess like causal inference based on observational data is kind of the main driver. So my question is also, is there also a role for more direct data from randomized trials where you could have something like interventions that cancel out the effects of climate and then using those estimates and merging them in, or is that like too challenging to do?
Well, I can try to answer that. Yes, it's true. We are talking about causality, and most of the EPI methods that we are using are based on observational data that by default we know that we cannot say that is a causal link. And we keep saying attribution, attribution, attribution. The problem is that we know that for those that we are working on environmental epidemiology, the typical causal framework coming from the clinical epidemiology, like randomized control trials, so on, is not applicable because basically we cannot take people inside chambers and put them, into 40 degrees. I mean, there are physiological studies for that. But in a way, I think that at some point we have to, let's say, and there's a bit of work on this now going on, to go towards the same methodologies that other researchers, for example, in air pollution studies are developing to try to remove biases and obtain more causal, let's say, relationships that then you can have basically more reliable estimates. But still, I think that something very important, and also we mentioned during the discussion, during the different presentations, is that we sometimes speak different languages, and the causal, let's say, the causality term that we use in epidemiology is not the same, the causal, let's say, framework in climate science or even in climate litigation. So I think eventually it's just about realigning and try to find a common language that in a way we are still sticking to our methodologies and our assumptions, but still, and we can work together on the same line.
Yeah, please.
Yeah, I think just to echo that, I think it is important for us to think about who the audience for that is and like who we're trying to convince of what. And I say that as someone who feels very nervous about speaking about causation. And I think we're trained that way as epidemiologists, as to err on the side of caution. But who is our audience, and how we need to be confident in our methods and the science that we're producing, but also for policymakers, for lawyers, for advocates, what level of evidence is required in that way. And we must be careful about holding ourselves back just because we want to apply this super strict criteria to it. I mean, I think that there were, for many years, many statisticians and epidemiologists who were not prepared to say smoking causes lung cancer. And now you feel quite confident in that. So we must be cautious of being overly cautious as well.
Thank you, panelists, and also everyone for this engaging session. My quick question, actually, in continuation to the previous question, referring to the notion of factual and counterfactual attribution, could you give maybe some examples when attribution itself was instrumentalized and maybe used for not the common good, but for the good of some certain group of people who try to kind of use it for their own interest and purpose, and then you understand other biased things start to happen? You have some examples maybe to share?
I mean, maybe this nonsense about increasing carbon dioxide being useful for agricultural purposes. I mean, that's the first example that came to mind. But
I mean, we see this argument as well with cold deaths, and they're saying climate change is actually going to reduce the impact of cold deaths, and in Europe we have that. And I think what's useful about having this robust framework and being scientists and constantly questioning is that we can dispel those. But I think, also going back to the previous point, in this like post-truth era, we do need to be cautious of who our audience is, and sometimes making those arguments is not about the statistics and the pure science. And I think just to respond to the previous points, well, the GAP project didn't come out, but we're focusing on heat and preterm birth. And one of the reasons is because we can build that body of evidence, and there's also, other health systems reasons, legal reasons that we can use that as an example. And I think that's quite a helpful mechanism to try and counter those things. You build a big body of evidence in one sphere so that you can use that to dispel those arguments. You're not running into issues, or people being able to dispel that with, counterclaims, like the fossil fuel industry could use this attribution to say, actually, it's only a small amount, and there's definitely potential for that.
Excellent. I think we are running short of time. I did want to finish on the indicator, just to note, our group and others have been pushing away at the preterm birth as being an important indicator for probably 5 or 6 years. And within the High Horizons project, which is an excellent project, they've been working on taking this forward with Victor and with others in Zimbabwe and South Africa, with workshops and repeated and formal methods led by Annie Portela and others at WHO. And really remarkable work with committees and going through this WHO and other processes to validate this as an indicator. And although, we used to always think if you discount and report the numbers of something happening, that might change the world. And sadly, the role of just counting and demonstrating, human disasters and genocides and similar isn't sufficient to change behavior. But it remains an important part of science, and getting the specificity and counting is useful. And we're grateful to the High Horizons project for set this platform that GAP can hopefully take forward, and once and for all show whether preterm birth is a sensible indicator for tracking climate change burden. So thank you for your your work there. I don't know if there's any final comments from the panel. And thank you, Annie Portela, obviously, yeah. Oh, and of course, most importantly, welcome Trust for funding the GAP project and so much of our work, yeah. Really appreciate the remarkable support for the field, yeah. Thank you very much.
Okay. Good afternoon, everybody. It's the after lunch slot, eh? So let's hope that people trickle in as we start. But unfortunately, we have to start because we have a packed program. Just to introduce myself, and let me put on my glasses. My name is Gloria Maimela, and I am the Deputy CEO at the Foundation for Professional Development in South Africa, and I will be moderating this session. So this is an exciting session for me, and I'm so looking forward to the presentations. The session is about climate change and health adaptation tools, current practices, essentially looking at climate and health adaptation strategies in low middle income countries. So I'm excited. We do have our speakers here. So what we will do is I'm going to introduce each of the speakers, and they'll come and do their presentation. And then as soon as we're done, then I'll ask them to come onto the stage, and then we'll have a Q&A session and wrap it up from there. So without wasting too much time, I'm happy to introduce the first speaker. The first speaker is Ellen Forson. Ellen is a senior researcher at Cicero, and he works in the climate and health group at Cicero. Ellen is going to talk to us about the health impacts of particulate matter 2.5 pollution in South Africa, a high-resolution exposure response assessment. Welcome, Ellen, and over to you. Thank you.
Yes, hi. As Gloria mentions, I'm going to just talk about the health impacts of PM2.5 pollution in South Africa. And this is work done together with colleagues at Cicero and at the South African Medical Research Council. And this study is part of a larger EU project called Planet for Health. Yes, so we all know that air pollution is bad for your health. And PM2.5, which is particulate matter under 2.5 micrometer, is particularly bad for your health because it's small enough to penetrate your lungs and the bloodstream and cause harm to the body in this way. The main sources are from traffic, industry, residual burning, and wildfires. And the health impacts are quite varied, but the main ones are linked to cardiovascular and respiratory diseases. For Africa, there's limited evidence for the relationship with air pollution due to often little data available. And this is particularly true for sub-Saharan areas in Africa. So this study is on air pollution in South Africa specifically. And in South Africa, we have this so-called priority areas for air quality that are located in the northeast of South Africa. And there are 3 priority areas. And these areas have elevated levels of PM2.5 due to coal-fired power plants, like the one on the picture here, industrial activity, and domestic fuel use. So the aim of this study was to do an assessment of the health impact from PM2.5 in these South African priority areas. And this map here shows South Africa, and priority areas are colored in the northeast part of the map. Okay, so I'm going to go through a bit of my methods, just starting with giving the overview. So we have time series data from 2002 to 2018. And this includes health data with daily mortality according to the cause of death, exposure data, which we have created a high-resolution PM2.5 data set, and covariates such as age, sex, and districts within the priority areas. And the model we use is a distributed lag nonlinear model to estimate this exposure response curve, as this figure is an example of the one shown here. Okay, starting with high-resolution PM2.5 data. So this figure shows the stations where PM2.5 is measured in South Africa. And as you can see, it's quite sparsely across South Africa. The stations, many of them are located in the priority areas, but even these stations have a lot of incomplete data. So there are many days where you don't get any measurements of PM2.5. So the aim here was to then create this high-resolution data set based on reanalyze this data and satellite data to obtain a higher resolution PM2.5 data. To do this, we used different data sources. So we had a more coarse resolution data source from MERA, which has this aerosol optical depth data and PM2.5 data. And this is a reanalysis data set. We also have a more high-resolution data from MODIS, which are satellite-driven data on a 1 kilometer resolution. And this only has this AOD variable. But by combining the AOD and the PM2.5 from the MERA datasets, we can obtain a ratio of PM2.5 to AOD, and you then use this ratio to calculate the PM2.5 based on the satellite AOD. So with this, we can get an estimate of PM2.5 at a 1 kilometer resolution. So after doing this, we get a plot like this, which shows the observed PM2.5 and the modeled one. And as you can see, it's very spread. So ideally, you want it to be a 1 by 1 line. And this is because of the data isn't perfectly balanced in this case. So we have to do bias correction to fix this issue. And this was done through a more mixed method where we used quantile delta mapping and random forest. And in the random forest, we used features such as temperature, elevation, and population density, among others, to bias correct the data. And after bias correction, we get this high-resolution dataset for PM2.5 for South Africa on a 1 kilometer resolution. And here in the top, in the northeast corner, you can see the priority areas. The mortality data, however, is on a bit different resolution. So we still have daily measures of mortality by cause of death, but the spatial resolution is much coarser. So we only have it by each district in the priority areas. In this case, 8 districts in these 3 priority areas. And these mortality data also aggregated by age and sex. So to get the data in a format that is possible to analyze, we needed to obtain a district level PM2.5 data. So to do that, we in the left here you can see the municipalities in the priority areas. So we used the PM2.5 and the census population sizes in these municipalities to calculate a population-weighted PM2.5 estimates for each district for each day in the time series. And then you end up with a plot like the one on the right here, which shows a population-weighted PM2.5 for each of these 8 districts on a given day. So after doing this, we then have our time series. On the left, the PM2.5 over the different years. And on the right, I show all-cause mortality over the same time period. And then we want to analyze this. As I mentioned, we use this distributed lag nonlinear models, where the outcomes were primarily all-cause mortality, but we also looked at cardiovascular disease and the daily respiratory disease mortality. Covariates were time, the districts, age, sex, and the day of the week. And for PM2.5, we tried different lag windows. So from 0 to 1 day, 0 to 7 days, and 0 to 30 days. And I will show results from just one of these. Specifically for the model, we used a so-called big additive model, which is a version of GAM that works better on large data sets. And in this model, we have penalized splines for the time to try to capture the long-term fluctuations across years, but also the seasonal fluctuations within a year. And with this, we can estimate these exposure response functions, like this curve here is an example of. Okay, so on to the results then. First, the lag response. So here we see the cumulative relative risk for overall for all-cause mortality. And you can see that it's significantly above 1 in relative risk, and that it increases for around the first 4 days and then starts to go a bit down. So yes, there is a delayed effect, and the pollution you experience from 0 to 4 days prior to the day you have an event, mortality is the most important for your risk. Okay, so then to the exposure response curve. So here again, in this case, we have PM2.5 on the x-axis, and you can see that it increases significantly until around 100 in PM2.5, which is quite high, or very high, and then it starts to flatten out the curve. And above 100, the curve becomes with a huge confidence interval, most likely because there's a lot less data for this region. And the effect size is in line with other studies, around 0.6% increase in mortality risk from a 10 increase in PM2.5. We also looked at similar curves for cardiovascular disease and respiratory disease and found similar results, but with higher uncertainty around the estimates. Okay, so the next steps then is to look closer at the results, because they're still a bit preliminary. So we want to do some stratification to see if there are differences between the sex and age group, possibly looking into some socioeconomic factors and other causes of death. We want to include modifiers such as temperature and relative humidity, and do different types of sensitivity with different lag windows or different ways of modeling the non-linearities for the lag and exposure. The time series for mortality also show that dip in the 2 last years in mortality, which may be a bit of an artifact. So we want to see if removing this data from the analysis changes the result in any way. And similarly with more extreme values of PM2.5, these were based on, well, that's very low sample size for this. So we want to see if removing these have an effect on the results. Yes, so then the summary is that we create this high resolution estimates of PM2.5 for South Africa. Using this, we were able to obtain or see a significant association between PM2.5 and all-cause mortality in the South Africa priority areas, where the effect size was that 0.6% increase that you have a 0.6% increase in the risk of mortality for a 10 unit increase in PM2.5. And we will do more analysis to try to confirm these findings. And with that, I want to say thank you.
Very, very interesting. From someone like me who comes from South Africa, it's great to see this data. Thank you, Yolande. Everyone, our next speaker is Joey Ross McDonald. Joey works for the Royal National Lifeboat Institution. This is a charity that is based in the UK and Ireland that focuses on drowning prevention and integrating injury and health into climate change. So Joey will speak to us about building local capacity for flood rescue, lessons from the Royal National Lifeboat Institution and Bangladesh Fire Services and Civil Defense Partnership in Bangladesh. Over to you, Joey.
Thank you very much for that introduction. Yes, so I'm Joey Ross McDonald. It's really nice to be here today. And I'm going to talk about building local capacity for flood rescue, which is a key climate and health strategy for LMICs. And I want to start today with 3 facts. So firstly, LMICs bear over 90% of the global drowning burden, as confirmed by the WHO. 75% of deaths during floods are caused by drowning. And finally, climate change, as we know, is intensifying flood risk and increasing exposure to floods all over the world. But while these things are true, another thing that we know is that drowning prevention remains largely underrepresented in disaster preparedness and in climate and health strategies. Now, the mandate is there. So in 2021, the UN General Assembly adopted a resolution on drowning prevention. And one of the recommendations is to encourage integration of drowning prevention within disaster risk reduction programs, especially in communities at risk of flooding and coastal inundations. So this is getting increasing attention, but what we want to be doing is seeing more of this in action, and that's why I'm here to share today with you a presentation about how one partnership in Bangladesh between the Royal National Lifeboat Institution and the Bangladesh Fire Service and Civil Defence, that partnership built lasting flood rescue capacity within a government institutions, and it offers lessons for embedding resilience and injury preventions into systems across other LMICs. So Bangladesh, for some background, is one of the most flood-prone countries in the world. Its low-lying delta geography, dense population, and increasingly unpredictable climate mean that flooding is not only common, but increasingly devastating. So almost every year, severe floods hit Bangladesh. In 2024, last year actually, 70 people were killed in just the summer season alone, and over 6 million people were affected. And in 2021, so other heavy years, over half of the households in Bangladesh were affected by flooding, some more than 3 times a year. So it's a severe issue in Bangladesh, and these events are growing more severe as climate change is driving heavier monsoon rains, melting Himalayan snow, and rising sea levels. Yet until 2013, Bangladesh's main emergency agency, which is the Fire Service and Civil Defence, which here I'll refer to as BFSCD, had no capacity for flood rescue. So their mandate covered all emergency response, but water rescue simply wasn't part of their capabilities. So when major floods struck, communities were extremely vulnerable. This gap was identified by UN OCHA, which is the Office of Coordination for Humanitarian Affairs, who put BFSCD in contact with the RNLI. Now, the RNLI, which is where I work, is a life-saving, water-based life-saving charity based in the UK and Ireland, which has over 2 centuries of life-saving experience. And this began what then became a successful partnership in embedding flood rescue capacity within the National Disaster Framework, and not as an external project, but as part of the operations of a government agency. So I'm going to talk through the intervention for a bit. The intervention involved 3 phases. First, the first phase from 2013 to 2016, teams mapped high-risk areas, flood-affected areas, piloted training with officers, and also developed training resources and manuals specific to the context, but also some more general ones. And this stage was also really focused at addressing a issue that Bangladesh was having, which was the lack of affordable equipment. So part of this stage, we co-designed low-cost personal flotation devices and throw bags, as you can see in that top picture, which could be made locally. So this was a really, really key strength of the intervention, as it created a sustainable model for equipment to be used in future flood rescue. So trained teams were then placed in the high-risk areas in the most flood-prone districts. And by the following year, so by 2014, teams were already evacuating vulnerable families, which was something that just wasn't happening a year earlier. The second phase of the intervention, flood rescue training, was integrated directly into the fire service's basic firefighter onboarding program. So it was no longer just pilot training, it was now institutional policy that every firefighter coming through the agency had to learn flood rescue and water safety. There was also additional training for 4 trainers at BFSCD who were brought to the UK for additional technical training. And the coverage continued to expand in this period. As for the total direct implementation costs at this point, less than £10,000. When the intervention was based on a knowledge-sharing partnership, we managed to keep the costs really low. So we were already seeing an extraordinary return on investment. So when the RNLI's involvement ended in 2019, that's when we stepped back from working directly with BFSCD. The fire service continued to expand, and this was the self-sufficiency stage. So by 2025, more than 500 trained personnel had been through the program, and the districts continued to district coverage continued to expand from 0 to 9 to 13 in the self-sufficiency. So the transformation within the Bangladesh Fire Service has been really remarkable. From having no flood rescue capacity at all, it's become the national lead agency for water-related emergencies in general, and has become a recognized regional authority on this climate and health strategy. So this year I went back to 2 of the leaders at BFSCD and spoke to them, conducted interviews with them to explore the results and impacts of the flood rescue training integration, particularly in the context of increasingly heavier flooding. So I'll share some of that. So Officer Rajib, who's the senior station officer, described this sort of operational shift. So the trainings enhance coordination during all emergency operations, allowing teams to manage complex situations with accuracy and confidence. And I really like this cultural shift of mindset shift from reactive recovery to active prevention. There had been this change where it was no longer seeing flood rescue as an emergency response, but embedded active prevention into this climate adaptation strategy. And this has saved lives every year since 2024. So during the 2024 floods, heavy rains from India created a severe flood situation in the eastern part of Bangladesh, flooding 11 districts of the country. But pre-plan responses and monitoring, which is that sort of active prevention I was referencing, meant that trained teams were deployed within 12 hours of the flood warnings, evacuating hundreds of vulnerable residents across the severely affected areas. I also just wanted to share this example, which was a text that we received from one of the BFSCD coordinators, and I think it's just a really strong example of that new mindset of active prevention. So this is during a local festival involving water crossings. BFSCD teams patrolled with throw bags and saved a life on the spot, which is, as I said, a really powerful example of active prevention as opposed to reactive recovery when we are facing severe events. We also found through the interviews that the program has changed public perception. So communities that once saw the fire service simply as a firefighting agency now see it as a trusted life-saving service. So as the flood training vice president Babul Chakraborty said, people appreciate the improved preparedness, quicker response times, and better coordination. It has built real trust. And finally, the impact has extended beyond Bangladesh's borders. So the fire service now trains responders in refugee camps, collaborates with NGOs like Save the Children, and has shared its expertise through regional workshops in Nepal. So what started as sort of an initial international partnership has then gone on and catalyzed more international partnerships of knowledge sharing based on really crucial climate adaptation strategies. So for other low and middle income countries, I wanted to sort of illustrate some lessons that I think this case study demonstrates. First, integration works, and I think drowning prevention in particular shouldn't sit outside national strategies or this conversation. It is climate adaptation, and Bangladesh's experience shows that embedding flood rescue training within a government agency, so through these civil society partnerships and knowledge sharing, produces this lasting change. Secondly, institutional ownership is really key. It's essential. You know, as Rajib put it, this program changed our mindset from reactive recovery to active prevention. When responders and agencies see themselves as climate adaptation actors, not just reactive crisis responders, particularly in the wake of increased crises, resilience becomes systemic and sustainable as well. Third, low-cost innovation scales. The locally made flotation devices and throw bags that we developed in the very first stage of this intervention really set up a sustainable model for continued scaling and self-sufficiency after the partnership and the funding had ended. And these are simple, replicable tools that can deliver really crucial results when paired with skill training or education in this case. And finally, partnerships can really catalyze progress, and I sort of touched on this earlier, but international expertise can ignite change, and I know that that's what we all are trying to do in this room with the work that we all do. But enduring success depends on reaching national and local leadership. And here, the RNLI sort of provided a spark and the knowledge that then was carried on by the fire service. And a real benefit was with this long-term partnership that was built over 6 years, and the tailoring of the intervention to local needs. So if international expertise is being used or shared, spending time in that context and really building a relationship means that you can create a very sustainable intervention. So for researchers and policymakers, the takeaway is clear that drowning prevention is a legitimate pillar of climate adaptation and health planning. Investing in skills, systems, and partnerships can turn what is becoming an increasing climate hazard into much more manageable health risk. So to close, and up on the presentation is a nice quote from Rajiv, which I think really sums up where this slots in. This case study demonstrates how a modest, well-designed initiative can drive systemic change and save lives every year in the face of a changing climate. And by embedding it within a government system, Bangladesh turned a capacity gap into a real institutional strength. So as climate-driven floods intensify worldwide, integrating water safety and rescue capacity into national systems is becoming much more essential. Thank you. I just wanted to put up some flood rescue resources. The top ones of those were developed throughout this intervention, and so there are some localized and also more general ones. And the bottom is it's a free online course developed with a platform called Disaster Ready to be able to extend access to this life-saving knowledge. Thank you very much.
Thank you, Joey. This is very exciting, and I mean, I've got questions indeed, because these are some of the great lessons to be learned about how you scale this. I have 4 speakers out of 6, so we are going to have plenty of time to discuss some of the issues from the presenters. So, moving on, my third presenter is none other than Sonia Mare. Sonia is a senior advisor at the Norwegian Institute of Public Health in Oslo, Norway. And Sonia is going to talk to us about building climate-resilient health systems in low-resource settings, insight from a scoping review. Over to you, Sonia.
Thank you so much, Gloria. It's such a pleasure to be here. I have to say, though, that this abstract was actually submitted by my co-author, Lila Papalodo, and unfortunately, she wasn't able to attend, so you have me. But anyways, it's really a pleasure to be here and have this opportunity to share this report with you. Let's see, I have to get these. Yeah, just to preface this also by saying that I have shared some reflections from this report in a panel with the Red Cross yesterday afternoon, but I've made huge efforts to not repeat anything that was said there except the essentials, but I think that wasn't that difficult to do because it is quite an extensive report that has quite a lot to share. So this is, again, really appreciate this opportunity. So just to say that what I want to do is discuss with you the background for this report, the methods, and the key findings. And I'll start with the background. That just to say that this was funded by NORAD, which is a development aid in Norway, and they wanted us to make some contribution to the research area of climate and health. And so we gave a lot of thought to that what could we research that could really build on what we already know, But I think that we also realized that there's a lot of, we know that the WHO has put a lot out there already on resilient health systems. Health systems strengthening is a huge area. And then combining that with the need of where we're seeing climate change affecting the most in health is often in low resource settings. And I can say from a personal standpoint that one of the first projects I worked on was a Belmont Forum project. It was with a partner in the University of West Indies. It was based in Trinidad and Tobago. And this is part of the small island developing states, which is often considered the canary in the coal mine. And I think that really reinforced that in these settings, such as the SIDS, climate change is there. It's very much a part of what they're having to deal with, and it's massively affecting their livelihoods, etc. So that was sort of the background and motivation for why we chose to go in this direction. So, so this was a scoping review, and I think it's very important to keep that in mind. This was exploratory. It is not a systematic review. We're looking to map the landscape of what exists out there in terms of studies that are looking at climate and health interventions in low resource settings. We had a search study developed by our information specialist who is excellent, and she had it confirmed by another specialist. We used a data screening process where we had inclusion and exclusion criteria, and we also, of course, had a very systematic way of going about our data analysis, which I'll go into later. The data screening process, as you can see, I like to describe this as going out into the ocean of research and throwing out a net and pulling in over 7,000 fish, and then having the task of literally going through each fish and throwing them back into the ocean. That doesn't qualify. No, that's not it. That's not what we want. And through that process, to our surprise, in a way, we identified 66 studies that were from many different parts of the world and that were discussing some aspect of climate and health. So, of these 66 studies, we found that they went back as far as 2006 and up to 2023, which was when that was when we had stopped our search. It represents 30 countries, and these are from all over the world. They are from different countries in Africa, in Asia, in Pacific Islands. So it became quite interesting to see what was being done in so many different areas. And then finally, the climate focus was, there was many different types of focus that we found. So there was studies looking at floods, at hurricanes, drought, heat, and oftentimes it was just a general focus, and oftentimes, as I didn't mention before, that there were several studies, 7 to be exact, that were looking at a multi-country, they were looking broadly at a more overview of what's going on in several different countries. So, the framework that we used, as I mentioned earlier, was the WHO building blocks. And I think we're all familiar with this, and I think this is important because it gave tremendous structure to our analysis. And it also, as we went through it, it became quite easy to look at the findings and make them somehow meaningful. And for those of you, once the WHO has talked about these building blocks as contributing to a climate resilient health system. So this was extremely helpful to how we structured our analysis. But to the right of that, we also sort of kept in the back of the mind of WHO has taken these 6 building blocks and expanded them to 10 climate resilient. Now, you might ask why we didn't do 10. Why didn't we look at those specific ones? And we did think about it, but I think when you have this type of analysis, you do want things to be, you want to keep things simple. I think that's a motto that I try to live by in research, is it gets complicated enough, so better to keep things simple when we go back to in the analysis or whatever. And to that point, I'll share the idea that things get complicated. This is not from our study, but I thought I really love this image, which this is climate resilient health systems, a framework. So that the idea, I just thought this so encapsulates the complexity of what we are trying to look at and understand. This is actually from this is from Pakistan, and what they've done is looked at as I know you can't see at the back, but I'll just mention that they were describing things like governance at the top, but this was sort of like our study times 66. It felt at times a little bit overwhelming, but in the end, having the structure to say, okay, what can we learn from these studies that in terms of this pillar and this pillar, et cetera. So now I'm gonna dive into some of our findings. So service delivery, I think, is so much at the core, and I think that the studies, it became clear from them that that infrastructure and health facilities, that you have to ensure the robustness of these, and that basic infrastructure is so essential. So that's so the idea of reinforcing infrastructure and facilities, this was one of the things that came out through many different studies. Utilizing community health systems and extending health services to remote areas, including primary health care. I think that, again, became, when you have disasters and you lose the ability to provide health services, the idea was, how can you extend and make things as workable as possible. Multi-sector collaboration is always something that was mentioned. The last one are the flexible protocols to ensure scalability. I think that came in the form of many different things like flood preparedness and just having, one thing that was interesting was the idea, one of the studies mentioned that incorporating disaster readiness into hospital protocols was the idea of like creating a culture of resilience. And I thought that was a really interesting way of talking about that. So in a lot of times mainstreaming, these things into the systems is also something to think about. And then just something as basic as developing preparedness plans and operationalizing them. There, I think one of the interesting comments that was made in a paper was, but don't fall into the paper syndrome of having something on paper but not actually using it. So that's I thought that was a really important observation. So then down to the level of granularity, and I with this report, I think that I mentioned this earlier, but one thing I really felt that we should do in our report is to tie all of our findings as much as possible to the studies themselves and let them sort of speak to, this is how we got from A to B, and sort of like have a red thread that is extremely tight. And so in the report, we have not just text, we've tried to make it as easy and comprehensible as possible, so it's organized into bullet points and key takeaways, but each of the sections, each of these pillars have tables that have the key takeaways as well as illustrations that have the author and the year, and you can go directly to the bibliography. So this is an example of primary healthcare preparedness and an article that hope for the best, prepare for the worst. And I also, I sort of purposely chose some of the titles that many of these titles are really just exude the personalness of what they're dealing with. And so I think it's when you're in the process of writing a report like this, I think any chance you can to humanize it and to lift narratives up is important so that your message is well understood. I'm going to skip that one, but then go directly into health workforce. I would say that in reviewing how WHO has has looked at workforce, this is one of the most important pillars. And at the top of it, many of the studies, and I took some notes on when we were looking at these study or records from our 66. There were so many that were discussing training of health workers, training of health professionals. They were not limited to an area or a continent. They were from Haiti and Myanmar, Ethiopia. I can't read because I don't have my glasses on. Pacific Islands, Thailand, Bangladesh. So that's just a few examples. So that was something that investing and building the capacity of your workforce is so essential. Leveraging community health workers, and this was also a theme that was quite strong, and it was. I think what was interesting was recognizing how respected and trusted they are in the community, and that they often have very unique local and indigenous knowledge that can be used in climate, in terms of climate challenges. Having an agile and adaptable workforce, so that was often mentioned in terms of surge capacity or in task shifting, just recognizing oftentimes there's many challenges, and so how do you make the best of not a good situation? And then again, recognizing that like the One Health model can often be a good way to link the different sectors and to try to bring the appreciation of, or just linking the healthcare environment and emergency professionals. And so then this is another, just to give you an example of what a study would look like if we were mentioning that training is something that was very important. And this was a study from Haiti, and it's entitled Eternally Restarting, or a Branch Line of Continuity. And so they're discussing the consequences of shocks on community health systems. And when I was reviewing this, I really appreciated the EU in the plenary, where he was wanting to have a magic wand to both recognize quantitative and qualitative studies. And I think this is the type of study that is so valuable to the type of work that can be done, and that of course quantitative is extremely important, but then bringing the human voice to it and the human experience is also important. And then, so that said, when we then move on to the more quantitative, the health information systems is a pillar that we looked into. This was something that Leela looked into in quite a lot of detail. This is an area of her work. But I can speak to many of the issues here as well, in that integration is one of the biggest challenges that were often mentioned. And what people don't realize is that health data and meteorological data are often done very differently. They use different time frames, and it's not as easy as you might want it to be. And then oftentimes there's data agreements that have to be arranged. So it is quite a challenge. I think a lot of progress is being made, but this was something that came through in several of the studies. I'll just a few other comments to this. Engaging users with user-centered designs. I think that this idea of having, I like to say, how important it is for those people who collect the data to use the data. If you collect data and you're not using the data, it's not that important, and so data quality often goes down. And so having like a feedback loop and having the data in use from the beginning is something that is something I learned in a project that was not on a climate, but this was a project that we were doing, and it's so important to have data be part of your decision making, and recognizing that it's such a building block to making good decisions. So this, I think, there were many different studies from different places. So for example, there was often there was a study from Burkina Faso, from Fiji on an EWARS in a box system, studies from Dominica, Barbados, India, all discussing different, different data or information systems for climate and health. And then, let's see. So an example here is from Ethiopia, and I always forget the acronym of what that stands for, but this is a malaria and climate change, where they've been able to link the data and they've been able to actually almost in real time have some forecasting ability. I know that it's something that's in progress, and I'm not an expert on this, so I won't go into more detail on that, but it's just an example of what we were seeing. And then finally, another of the pillars is the essential medical products and technology. And here there was not as many studies on this as one might expect. It's not a field that I think you think of as describing all of these different topics, but they were very interesting, and they were, you know, in the real situations of the challenges of disasters. They talked about this idea of sharing medical equipment, and I think that's just, it's something so basic but really important. Also this idea of finding and using innovative and sustainable technologies like solar-powered microscopes, and so I think there's a lot of things that we can learn about how to find feasible, sustainable, and low-cost solutions to the challenges that you have in a supply chain or procurement system, and how you can address that. And then finally, I thought that another really interesting finding was this idea of often in humanitarian crises you have a lot of donations, and several studies discussed how much how it's important to follow the protocols that you have of accepting them, because often that can be more of a burden than a help. So again, very practical, informative findings that I thought were really interesting. And I think so that's my final slide, but I wanted to, if I can, just take 30 more seconds. Yeah, one more minute. I just want to end by saying that I haven't covered all the pillars, and that is because some of them were a bit weak, and those would be the financing and the leadership and governance, and I think that speaks to some of what Gloria had mentioned in the plenary, and I think that's an area that we do need to focus more on. There were some things, but it's not as much as you would hope. So thank you so much for your attention. I appreciate it.
Fantastic. Thank you very much, Sonia. That's also very exciting, and I've got questions as well. Shailene is here, so I'm excited. So Shailene is a senior undergraduate student from Howick College in New York. She's presenting her thesis research on climate change adaptation strategies in the Chuuk state of Micronesia. This research presents local perspective of community members bearing climate change impacts on the Pacific island country of Chuuk. Over to you, Shailene.
Okay, hello everyone. I just wanted to start off by saying I'm very excited to follow your presentation. I feel like this work really speaks to the importance of including both data and local perspectives when we're building climate change resilience in Pacific Island countries and other lower middle income countries. So, and thank you to the conference for accepting my submission. I'm very excited today to present my research on islanders' adaptation strategies in the Chuuk state of Federated States of Micronesia. So just a little background on climate change impacts on Pacific Island countries. So as we know, climate change directly threatens public health. Many have posed climate change as being the biggest threat to global public health in the 21st century. Climate change is a big determinant of health, impacting physical and mental health, the food and water security, and the financial stability of populations. So lower and middle income countries do experience enhanced challenges, such as greater public health challenges that really restrict their ability to adapt to climate change. Their capacity to adapt is restricted by their lack of resources and by their poor infrastructure. This is shown in this picture to the left of a Chuk house following a typhoon. So Pacific Island countries also face very unique challenges that are characterized by Pacific sea level rise being 3 to 4 times greater than the rest of the world and from their very isolated location. So Pacific Island countries face intersecting challenges that really, that really limit their ability to adapt and are going to make climate change impacts harder for them. And this is characterized also by their isolated location and geographic features. So a little more background on Chuk state of Micronesia. So Chuk is one of 4 island states in the Federated States of Micronesia, and it is characterized by its rich history and culture, by its geographic features, and by its isolated location. So Chuk and other Pacific Island countries have learned to coexist with their environment through building relationships with their islands and with their environmental challenges. One example of this is Chuk's dominant culture being very based in their challenges and in their unique geographic features. So recently there's been a big global shift from indigenous solutions to urbanized solutions. And this shift creates big disparities between lower middle income countries and high income countries because they're not appropriate for places like Chuk, who have a very unique culture and environment. So my literature review revealed that that previous research has failed to look at the local perceptions of Pacific Island communities challenged by climate change impacts. And therefore, today I am hoping to present my findings on the local perceptions of climate change impacts and to evaluate the effectiveness of current strategies. So I utilized a rapid ethnographic analysis to account for the limited time I had to complete data collection. And I also used a triangulation approach that included semi-structured interviews, observation of notable climate change impacts, and the subsequent reactions of or responses of local Chuk communities, and then documentation, which included reports and pictures from the local Chuk government and from study participants. So convenience sampling was employed using 2 local contacts to recruit participants. The study population included 16 participants that were 18 years old or older from the main island of Oahu, the inner lagoon islands, and the outer lagoon islands. My data analysis was completed using ScribeWave and Microsoft Word, and I completed an inductive thematic analysis. So main findings. So my inductive thematic analysis of the interviews did produce 18 codes that were organized into 4 themes. The first theme was impacts to humans and the environment. Under this theme, participants identified climate change impacts on the health and integrity of the environment and humans. So findings showed that challenges faced by Chuk communities do fall into 2 main categories, with the first being intensification of pre-existing challenges. This is going to include climate events and challenges faced by Chuk as a Pacific Island country that are now worsened and more intense due to climate change. The second main challenge faced by Chuk communities is creation of new challenges, and this includes new threats to human and environmental health that participants identified as being due to climate change. Lastly, impacts to the environment subsequently hurt human health, and this was identified by participant responses as well. So this next quote exemplifies how these three findings can converge. Rough seas is a new challenge in Chuuk. Previously, rough seas were not only seasonal, but they were predictable. Now, they occur year-round. So pre-existing challenges are intensified by the creation of new challenges. A pre-existing challenge on Chuuk is that some schools are only accessible by boat. Now that rough seas are no longer predictable or seasonal, this challenge has become much harder for Chuuk communities to adapt to. So, and then lastly, the breaking of this parent's leg shows how the changes to the environment and climate change can negatively impact the health and integrity of Chuuk communities. So the Chuukese did prefer that adaptation strategies were derived from the One Health approach to better target the unique connection that they have with their environment. So my second theme revealed was behavioral and personal responses, and this included any behavioral and mental responses to climate events. This findings showed that responses to climate events and seasonal shifts were more coordinated in previous generations. Participants identified that they respond to climate change first by sacrificing elements of their lifestyle through lifestyle changes, followed by intentional adaptations. So lifestyle changes are going to include lifestyle activities that were either stopped or modified due to climate change. This following quote does show how Chuuk communities respond to typhoons using using lifestyle changes. In this quote, a participant reflects on their extended family having to combine into one household and relying on that household for food and for shelter for months following the damage of a typhoon to extended family members' houses. So then we have intentional adaptations. So as challenges worsen, intentional adaptations, or participants will shift to intentional adaptations, especially when those challenges start to impact health more directly. And intentional adaptations are going to include behavioral changes made to mitigate the impacts of climate change. One example of this is farmers on Chuuk have been moving their taro patches further inland to prevent saltwater intrusion from wiping out their crop for the year. So lifestyle changes do serve as a short-term coping mechanism, but they do not mitigate the broader impacts of climate change. And then this lack of intentional adaptations does show to put strain on families, especially individuals bearing those provisional roles in families bearing the greatest stress. So participants identified that investment into the advancement of intentional adaptation strategies would help to preserve their local resources and their public's health. So my third theme is social perceptions, and this is going to include participants' perceptions of societal patterns in climate change knowledge and in cultural practices. So results showed that climate change knowledge is gained mainly from school and community trainings. Findings also showed that cultural practices determine how Chuuk communities interact with their environment. This was shown in the first part of the following quote as one participant reflects on their appreciation for their ancestors who created cultural practices of storing food underground and of only harvesting resources when they need them. Next, so there's been a recent shift or a recent replacement of cultural practices with Western practices. This has caused a decrease of traditional knowledge on how to adapt to climate change. This is shown in the last part of the quote as the participant continues on to explain the differences between culturally based and Western based relationships with the environment, explaining But nowadays, they really overuse because they ship, they send it outside, and they don't realize we're depleting our resources. So adaptation, resources, and information will reach more people when spread through school and community trainings. That being said, these trainings need to be localized to the community where they're taking place in order to meet the specific needs of that given community. Okay, and then finally, my last theme is external support considerations, and this includes participants' responses to the effectiveness and community receptivity of external and government support. Under this theme, climate change adaptation progress was identified as not occurring due to a community-wide lack of climate change awareness. Findings also showed that government interactions with communities are most effective when implemented on a community level. The positive outcomes of completing community-level approaches as a government was shown in the following quote, as participant 3 says, so you're seeing more communities that used to be self-reliant and like clan and culture-based, opening up to solutions from the government or working with solutions from the government. True communities are very tight-knit with their local chiefs making many of the decisions for that given area. The community's willingness to try adaptation strategies that they're not familiar with needs to be earned by the government by like respecting the hierarchy of Chuk communities. And then Chuk communities must target disparities in climate change awareness to adapt to climate change. So this research was limited in a few ways. So language barriers was a potential limitation, especially when an interpreter was used. There was no way to confirm that the question was reaching the participant correctly and that their response was reaching me correctly. There was also a low representation of communities that were on the inner and outer islands, and with more than 13 participants being from the island of Huero. The population sample was limited to people who just the two contexts knew, so that was another limitation. And then public health implications. So the public health community, especially in the governments that are responsible for these increased emissions, need to acknowledge climate change as being a threat to public health and need to acknowledge its disproportionate impacts on vulnerable communities. This is important as climate change does impact every facet of public health, compromising the quality of Earth's air, water, food, and human and animal health. So in conclusion, it's going to be very important to build climate change education in Chuk, as it will give people the information they need to make sustainable decisions and the tools people need to improve their quality of life as climate change worsens. Strategies need to align with local priorities in order to be sustainable. We can't begin to understand what those might be without sitting down and having conversations with these communities. Chuk is just one example of a Pacific island country struggling to adapt to the intersected challenges of climate change. The impacts of climate change are experienced most by countries that are not responsible for its rapid acceleration. Therefore, these countries do deserve a global conversation addressing the unprovoked struggles that they face, and they deserve resources invested into adaptation strategies that meet their individual needs and priorities. Okay, thank you.
Excellent, excellent. Thank you so much, Shailene. Right, last but certainly not least. Hey? No, you are next. So it's a dear colleague of mine, Celeste Madondo. She's the Senior Program Manager from Vets Health, Vets RHI in South Africa. And Celeste is going to talk to us about quantifying heat exposure among vulnerable women, pregnant and postpartum women in Tshwane, South Africa. Over to you, Celeste.
Thanks. So good afternoon, everyone. Gloria says I have 5 minutes. I'm going to try and stick to that. Uh, so I'll be speaking on behalf of my co-authors on quantifying heat exposure among vulnerable, pregnant and postpartum women in Tshwane, South Africa. So heat exposure leads to adverse maternal and neonatal health outcomes. Sub-Saharan Africa has greater heat exposure, but lacks contextual research. A recent systematic review that was conducted by our colleagues assessing the heat exposure impact on maternal and neonatal health showed a plethora of harmful effects on maternal and neonatal outcomes, as displayed on the screen. These include preterm birth, low birth weight, hypertension, stillbirths, and small for gestational age. The map on the top right corner shows us the the distribution of 198 studies that were included in the review. However, when we overlay that map with annual mean temperatures per country, we see that only 3% of the studies were from low and middle income countries. And there's certainly not enough from countries with high mean temperatures, temperature exposures. Very few from Africa and other LMICs. So the hottest countries in the world have the least studies that are published on this. Our study is conducted in Tshwane, South Africa. It's called the Heat Adaptations for Pregnant Women and Infants, HAPPY. And with this study, we aim to co-produce multi-level, multi-component interventions to reduce heat impacts on maternal and newborn health in diverse contexts. We are implementing the study in South Africa, in an urban setting, as well as in Zimbabwe in a rural setting. I will only be presenting some of our results from the South African setting. It is an urban informal settlement. It's very overcrowded. There's high poverty and unemployment rates. There is a substantial amount of migrancy and with other socioeconomic elements that are prevalent in this particular area. And most importantly, the homes are low thermal mass homes. So we call it shacks that are very, very closely next to each other. They're very close, so it's very, very dense, this population, this area where we work in. So in order for us to capture our heat exposure, we conducted this in 3 settings: in the household, at facility, as well as at outdoors. We use thermal monitors in the household and at facilities. In the facilities, we have the thermal monitors in different wards, and outdoor we have installed weather stations to collect microclimate data. In South Africa, we don't have thresholds to classify heat exposure, and so we used NOAA to assist us with this, and we classify it it's classified according to caution, extreme caution, as well as danger. And so for the formative research that we've already completed, I'm showing the daily mean max at the top graph that you can see. And the mean max exposure was highest in participants' homes. We can see that the means on average were almost 6 degrees warmer indoors versus outdoors. We also had an official heat wave during the 9th and the 11th of March last year. This was, it was during our study period, and during that time, we had 7 women that were enrolled at that point. That's at the bottom graph. 4 homes were in caution range for more than 75% of the day. You can see that 2 at 100% were they in that range. 2 of our homes were in danger in the danger range for 6 hours of the day. And what's scary is that even at night, some of the homes were at extreme caution in these, where we saw in these houses. And you can see one of the households, it was actually 13 degrees hotter than what we see in the compared to the outdoor temperature. We also did some KIIs and IDIs with some of the women, and I'm just highlighting how hot they would, or how they would express how the heat is impacting them. And they express this through their physical well-being, the stress on their body, the increased fatigue and discomfort that they felt. They were obviously irritable, their sleep was disrupted, and some of the women actually highlighted that they don't know why they're shouting at their partner. Maybe I was crazy, but it was more the heat and the irritability that they were emphasizing. When we also asked about the infants, women during the postpartum period, they also tended to avoid breastfeeding. They also said that the infants were irritable, but in our setting, what is very important, and what happens with most of the women and what we were taught, is that we need to wrap our babies in all these blankets, even if it's summer. And one of the women actually said that I would open the blanket and find him sweating, so the baby sweating. Of course, the baby will be irritable and crying, but we also found that they also found it difficult during breastfeeding. So what we found during our formative research was that the household heat exposure was highest in participants' home versus outdoors. We also found that women were exposed to higher temperatures, beyond safe thresholds, especially during heat waves. Outdoor exposures were significantly underestimates the true impact or the heat that the women were exposed to. And there's need for context-specific interventions or adaptation interventions that we need to embark on. And what we then did, it led us to a co-design and co-creation process where we engaged with pregnant and postpartum women in order to identify interventions that we can implement in this particular setting. We had different level of interventions, and from a household and individual level, women said water bottles, handheld fans, a small aircon, an umbrella hat, and also reflective roof paint are some of the interventions that we can implement in this particular context. We recently started, it's now, I think a month ago, and we are seeing the women, as we are working in the community, we are actually seeing the women now wearing the umbrella hats. Initially, we thought, are they really going to wear the umbrella hats? They are wearing the umbrella hats. They said it's easier for them to do their chores, even during the day, and they walk around the community, going to the shop. They don't have to carry anything in their hand. So we are seeing participants actually using the umbrella hats. And during our engagements, what we found as well was, and I mentioned it in another session, in order for us to be able to paint the roofs, I need to highlight that the houses that we deal with, it doesn't have windows. We couldn't install windows even though we thought it was important. And so it was also difficult for us to plant trees in this type of setting. There isn't space. And if you see how the houses are, this is leading me to my point where we are now starting with roof painting. It is a very complex process to undertake in that particular environment in our space. The roofs are very fragile. The structures are very complicated and they're very close to each other. The process includes cleaning the roof, and you have to rinse it off with water. So when we do the inspection, the roof will look great for painting. We can't see any holes. Once you rinse it with water, the water starts getting into the homes of the participants. Then they are sharing a house, or the homes are shared, and we can only paint the section where the participant lives. So it gets complex in the sense where the neighbors or where they're sharing, they feel that they're being excluded. Some of the roofs, not some of it, actually most of the roofs are used as storage. So the people put, everything on the roof, tires, we saw blankets on the roof, we saw a whole host of things that they use as storage. And given that the homes are so close together, the ladders can't fit. So we really try, and sometimes it's unsafe because the electrical wiring is like across, as you can see in the picture. You have to consider the weather before you paint. So it takes about 2 to 3 days to complete painting. And I already mentioned how neighbors feel excluded. Is it possible in our setting, and what are we seeing so far? So we started, as I said, just a few weeks ago, and what we are seeing from our preliminary findings, not conclusive yet, but we have seen in the previous or the formative research, the houses were approximately 6 degrees. There was a 6 degrees difference between indoors and outdoor maximum temperatures when we compared, when we looked at the formative research in similar homes that we are currently working in. And after applying the reflective roof paint, we are seeing that this difference has dropped to about 3 degrees. It's still very, very early days, and this data is just from the first few homes that we've already painted. But it appears that the gap is closing, but we are looking at this very closely, and over a longer period, we should see more results. And so, as the previous speaker also mentioned, that it's very important to have context-specific adaptation interventions for protecting vulnerable populations. We need to include the community in decision-making regarding the interventions that needs to be implemented. Implementing co-produced multi-level interventions is possible, even in low and middle income countries. When we are implementing, we need to be very flexible. This is important as we have to adapt and make changes. And lastly, reflective roof paint, we saw that the gap is narrowing in the T-max, but we are monitoring this closely. So we are funded by the Wellcome Trust, and we are thankful for that funding. And we just like to also thank all our other partners and our community for participating. Thank you.
Thank you very much, Celeste. It's so great to see these interventions and the preliminary findings. So it's exciting. Thank you so much. The good news is I have all 6 of my presenters. The not so good news is that we're running out of time. So without wasting too much time, I'm going to now hand over to Beatrice Bukusenge. Beatrice is a postdoc fellow in climate and health interaction, and she's going to talk to us about mortality attributable to flash floods in Rwanda. Yeah, over to you, Beatrice.
As he said, I'm Beatrice Bukusenge. So we were working on a different project. In here, you can see that we have some of the objectives of the project where we want to construct statistical framework and the online platform. So to make this happen, we started with 11 11 topics where we were able to develop only 6 among them. So the only issue was like there is this issue of data where we started thinking on how to incorporate them in the future work. So in Rwanda, we used to have this kind of problem where most of the time people are not aware on when the event is going to come. For instance, in the place where there is this high mountain with volcanic action. So it used to happen like, even if it is hot, you can see flash flooding coming and killing people. Of course, they are trying to make some kind of solution by trying to breed those kind of intervention, but still we are at a lower level of protecting our population. So after seeing all those stuff, we started collecting some data, which was not easier because people were not aware of what it has to be done. So after seeing all those problems, it might happen like flooding is happening now, but after flooding, we also face a problem of landslide, which also comes and kill people without knowing. So to somehow try to use different types of models to study the issue of flooding in Rwanda, it wasn't easier because at least we wanted to know the depth of the river. We used to call them river, but you can't see water when there is no flash. We also wanted to know the velocity because during that period of flash flood, there are some stones that comes from the mountain. I mean the volcanic mountain, and there are some other elements that used to happen and come. So we tried to make everything, try to look at different co-founders. So for this method, for the method we used, we were started by saying, what if we start from country level and try to go down for a district level or provincial level. There, it's where we included this random effect to see how the region effect can just try to show the badness of the event. So after that, we can see that in the western part of the country, there is a high number of deaths during the flood events, just the flash one, because we wanted also to study some other elements, like for instance, the issue of cholera and some other diseases, but it's not easier to just capture all those elements after the event because everyone is busy to look on how they can protect themselves. So from this one, we have seen that for the first day, it's where there is a big number of population who died because it comes when you don't know. Kids are playing around. Moms are cooking and dads were somewhere else. So which increased the number of deaths during that period. So which means that for kids, they just play, they don't know. If you are not around them, then it's easier to find them, all of them dying. So we didn't go very far with this project. With this topic, we said that it would be better for future to start collecting all those information that can help the population to know what is happening before it's not too late. So to make these things happen, we were in a partnership with Office for National Statistics, the Cochrane from UK, and this UK Health Security Agency, and get like some kind of advice on those types of elements. So thank you.
Thank you so much, Beatrice. A round of applause to all the speakers, please. Thank you so much. And can I just ask all the speakers to go onto the panel for a few questions? We have a few minutes. Yeah. Yep. Oh, I'll just stay. Right. Don't worry about me, I'll stand. Are there any questions from the delegates, please, for the panel? Any questions? Oh, okay, right.
Just a second.
You know, while we're sorting this out, you know, what I thought was very interesting is that you presented on, you know, flood prevention and what we're seeing in Rwanda around mortality, Joy. So, you know, lessons, you know, that can be shared between what the work that you're doing around that, you know, flood prevention of drowning as a result of floods and what's happening in Rwanda. So very interesting. And also just the work that is happening in South Africa, excellent. And I also wanted to say, Joey, sorry, not Joey, Sonia, one of the questions that I had earlier on was, you know, service delivery and any thoughts around telehealth and digital technologies to support service delivery. So just ponder on that, but I'll take the first question from Vincent.
Okay, thank you. I have 3 questions. Okay, but not difficult. The first one for Sonia, the systematic review.
Sorry?
Is the one for systematic review, right?
Yes.
Yes. My question is, I like the fact that you touched in quite a lot of developing countries, and Africa is part of your study, and there's quite a significant number of papers that, you know, that met the requirement or the criteria for selection. 66 is a lot. But what I wanted to highlight is kind of the barriers and the enablers that stood out to be, and I mean, that came out from your study in terms of building resilient health systems. Did you identify such? Because that's very, very important to set priorities for the policymakers. And the second question goes to, sorry, I forgot the names. The islands, right? Yes. My question is, I'm interested to know the difference in the understanding of climate change between the young and the old. Because, you know, they experience climate change differently. You know, the youth always say we live it. The old says we experienced it. So what was the reflection in terms of understanding between the two age groups and also the adaptation interventions that both should be looking at? The last question goes to Celeste. You know, we have, understand the intervention of painting the roofs white. And of course, there is significant evidence that it reduces the indoor temperatures. But, you know, that's my own thinking. Climate change is not only affecting the heat, it's also affecting the weather. Nowadays, we experience even more colder weather because of climate change. You know, you understand that in Joburg nowadays, it can snow. And it used not to in some areas. So, and painting the roofs white, what will happen during snow? Don't people going to be exposed to even more colder weather when it becomes snowing? We're trying to fix another problem, then creating another one. Is that not going to be the issue going forward? Because the white color, when it comes to cold weather, it becomes a problem.
Thank you very much, Vincent. Before they respond, I saw another question. There was another hand? Yes.
I have a question regarding the Pacific Island presentation. Sorry, I don't remember the name. I am very bad with it. So you were doing the ethnographic research among Pacific Islanders, which is like a very new perspective. And recently, there is a lot more happening in the Pacific Islands, especially we have read about Tuvalu. And what is the take of the population there in terms of climate anxiety? And do you think they think that their community-based solutions can help tackle this climate change-based effects in terms of migrating to a different country or a part of the world? Thank you.
Thank you. Thank you for a great question. Let's start here with Shailene.
Yeah, and I can really target both of your questions with this answer. So a lot of the responses revealed a dissonance between, and like a conflict between the older generations and the newer generations. These older generations have experienced the loss of so many lifestyle, like elements of their lifestyle. Participants were reflecting on how they used to be able to go out fishing with their families. They used to be able to walk out on the reefs. Like these core parts of their childhood, they just do not have anymore because oceans are too rough. Whatever other reasons there might be, this is just one example, but these younger generations haven't experienced as much loss as these older generations. So there's this conflict where there is a big care from the older generations, but now it's shifted into more of a reactionary approach from the younger generations. And it does create, there is some conflict. People express a lot of frustration about that and stuff, and I could see that in the younger responses because this is their life now. They're used to not knowing whether they're gonna be able to go to school without a parent getting hurt, for example. They're used to not being able to go out on the water without being very careful and knowing that I might not make it back. These were fears that they had. So they're a lot more casual about it. And I'm not sure if I answered both of your questions with that, but in terms of climate change anxiety, it is much more experienced by the older populations than it is the younger population. So it is kind of hard to target these interventions when you have half of the, or like structure these interventions when you have half of the population caring a lot about it and the younger generation really not sure yet how this is going to impact them. So, yes.
Thank you. Sonia, maybe also just tackle the question around digital technologies. Yes.
Yes. Yes, first I'll address Vincent. Thank you. It was a great question. It's actually a methodological question, I think, because at the time that we embarked on this scoping review, we weren't aware that anybody had done this. So we approached it more as like a scan of the research, like what is the landscape? And so we were very generous in way of what we wanted to include everything. But what we weren't able to do, because it's in this exploratory phase, is assess the quality. And so because of that, then we are not able to make any recommendations because it becomes very difficult to sort of quantify things. So that we had a discussion about that, in fact, of like, what can we quantify? And it's at this point, it's just, it can only be descriptive. So I hope that answers your question. So in terms of having recommendations to policymakers, I think that would be a good next step. And I hope that this can be a foundation to work from. That would, hopefully I answered that. And then in terms of digital health, I do think that was something that came up, and I think that oftentimes it was how to be efficient, how to use not just telehealth but other digital technologies, and even to the extent of digitizing as much as possible, because in types of disasters, often you don't have, you've lost your paper records, so that can be one very smart strategy. So thank you.
Thank you, thank you. And then Celeste, let's talk about painting roofs white when it's cold.
We don't know how cold the homes will be yet. So we are likely to only see that next year during winter. What we are seeing, especially in our context, is that our summers are longer. We are experiencing more frequent and longer heat waves, or it's hotter. And very interesting, we thought that the women would complain about, we had a dip, you'll see that we had a dip in September. It was like we had a few days where it was just very cold. And we thought that our pregnant women would complain. When they came to the facility, they actually said, we're so happy. Yes, it was cooler, but we didn't feel that cold. We actually liked it more. So we don't know yet. Even the other team, the Habvia team, they haven't reported on whether it's too cold. They haven't had those, if I have to call it, complaints yet. So we will just have to see.
Time will tell. Joey, have you got any lessons to share with Beatrice?
Yeah, I think that was really interesting to have us both in the same session, and particularly it seems that maybe sort of the intervention that I spoke about could be sort of a follow-up to some of the issues that Rwanda is experiencing with flash floods. I think what was successful about the work with the Bangladesh Fire Service is because it was through a national agency and because we risk mapped the areas, it meant that there was rural coverage, which I think is often really, really difficult when it comes to severe weather events, which is non-discriminatory. It's not just going to happen in the city, obviously. And I think that particularly for where you were looking in Rwanda and in your study, if there's so I would say for learnings, think about any engagement with emergency services or national agencies. Sometimes you don't need to diagnose all of the issues before action is taken, I would also say. And with flood rescue, it's water safety and it's education, really. That would be my lessons. But it was really interesting to hear about the work that you're doing.
Thank you, Joey. I have one more question that I will take, and then we have to wrap up. Unfortunately, we're out of time.
Thank you very much. It's actually related to Bangladesh case. Very interesting information, and glad to know that it worked well in the end with all these good fruits already ripened. But would it be possible to expand a bit more on what was presented? Because I feel maybe not. You tell me, was there any challenges on the way as you try to implement? Was everything going per plan? Maybe there was some blockage that was not resolved, some things that didn't work at all with the local authorities, with the project implementation as it went. I think this point is kind of a bit missed in the presentation. If you can expand a bit more on that. Thanks.
Absolutely, yeah. Thank you, and thank you for that feedback. I understand that the findings that I shared were positive. I would say that what was difficult about the process was the length of time it took to build trust with the Bangladesh Fire Service, particularly as a bigger institution, and you always need to we're coming in. Working in an international partnership, you also need to be very careful about any implicit power relations with knowledge sharing. And so it took us a long time to build that partnership. This has been running since, it was a 6-year partnership from 2013 to 2019. While there was great success, I would say definitely that was a part of it that we had to really, really work at more than we maybe might have first thought. On the surface, it could look like a train your trainer sort of thing, but actually it took a lot more investment into building something that could then be sustainable and self-sufficient.
Thank you. Just at the risk of tea, Ellen, just one quick question. When you were collecting that data, did you look at the impact of household air pollution and black carbon and the impact of that on health?
So not directly on health, but I think when making these high-resolution PM2.5 maps, we did include those as variables to get more precise estimates. Yes.
Everybody, thank you so much. Thank you again to the panel. Yeah, round of applause. Excellent. Thank you very much. It's now afternoon tea. Okay. Right. Thank you, guys.
Check, check. Check, 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 check.
Okay, let's start now with the final discussion. The discussion, it's called Resilience Redefined, Climate Conflicts and Global Priorities. So we have to be on time because we have some online followers that don't know that still people are enjoying the coffee breaks and had a fantastic poster discussions. And so there is so many good things, and you can see it from there. Before we start this discussion, there is a QR code on the door. So it's just for your possibility to give some feedback, because we want to learn from the things happened here. And also if you have some suggestions, so how to make a conference even better. So each time we try to do it better, so all the feedback is very welcome. After this session, we also will make a group photo, so please don't escape, so stay here. But let's now continue this final discussions. Like during the conference, we have quite a lot talked about climate change and health, and there has been also a lot of overlapping things, but there have also been discussions regarding conflicts. So you know the conflict that is happening in Europe, in Ukraine, so that was touched in one sessions. So luckily there has been some agreement on peace, at least in Gaza. So that's one example, like globally pressuring, things might happen, but there are more conflicts happening, like in Africa, Middle East, they are not just so well known. Another thing what was discussed in the morning keynote session was we have this unfortunate political shift. So we do see increasing interest of industries. So it's not that much green. It's also a bit black or what we can call like the oilish colors. And another thing is that we can see some cynic in global commitments, because some countries have been part of those, but now is it really worth, or can we have something else? And it's not easy, of course, to rejoin those, but still there is it's a sign how fragile all those things actually are. So, but today's discussion will be how we can do things better. So, and how also we can define the future resilience, and what kind of choices we have to do, and in which kind of focus, crisis focus should be aimed. So should we, like we have had also in Estonia discussions, should we prepare for the war, or should we kind of continue climate mitigation adaptation? So often they are seen like separate things, even though we see that they are very connected. But people's world is much more simple, and then they kind of make choices on some other values maybe. And also we have forgotten the pandemic more or less. So our behavior 4 years ago was totally different, but now we are back there on again. And otherwise, maybe we should prepare for the crisis. But let's now go to the panel, and we have 5 persons on a panel. First, I would like to invite here Jaana Alonen. She's chief researcher at Finnish Institute of Health and Welfare, and she has also been member of Finnish climate change panel, focusing in her research on climate change and health, and gives us a Nordic perspective for the things. Then I would like ladies first, Tia Holten. She's a civil society representative working at Norwegian Red Cross, and was also having a fantastic session on how kind of different civil societies can work together. Then we have Shilpa Rao-Shilbek, like she's a senior researcher at Norwegian Institute of Public Health, but she has been actively also involved and will be involved in IPCC, has been work with the Lancet activities, and she also part of EMAP activities and focusing also on Arctic. And then we have two great guys. First, we have Jason Glacier from US. He's CEO and co-founder of Isla Network. And she has been one of the key persons working on occupational health things related to climate change. Sometimes we forgot that people also work, though they are not at home, but they spend on average 8 hours, some people even more at work, and if something is wrong there, of course, that also has a major effect on health. And then finally, Professor Sagnikte, so from the Center of Atmospheric Sciences from Indian Institute of Technology from Delhi, who has been working in one of the most polluted countries in the world. But as we heard today, there are also solutions available, and he's been one of the key persons behind those solutions. But the main focus of today is you have like microphones to share, so you can pass to the others if we start. So, but the panel was about resilience. So let's start now from males to have a bit gender balance. What is resilience for you, Segnik? Can you say in 1 minute?
I mean, in the perspective of climate change, I think what is very important when you try to define resilience is strengthen the adaptation aspects of it, that how do you really adapt to the changes happening in the environment, in the ecosystem, affecting all aspects of our life, health, food security, water security.
Great. Jason?
I come from a space where I have to work in this intersection of kind of business, corporate social responsibility, supply chains, government policy, trade policy, and then research. And I'm kind of like stuck in the middle as Isla Network. And I hear a lot of buzz terms and a lot of excitement, be it from the UN at Climate Week or from the companies at Climate Week in New York or in the literature. And I'm always struck when you talk about resilience right now. There's a lot of talk about regenerative agriculture and resilience in agriculture and infrastructure, but you need people to pull those plants out of the field to feed us, and you need people to build your infrastructure and build your construction projects, and it continually feels like the occupational health side is left out. So for me, resilience is all the things you mentioned, but we really need to think about the workforce, and I think it's frankly in our interest in terms of bottom line, efficiency, productivity, and savings to health and labor and social security systems. So the question to me at this point, we know all that, why aren't we pursuing it in a more integrated, holistic way, and why do we keep getting stuck in these kind of either or binary thinking traps?
Yeah, Shilpa?
Yeah, thank you. Before I say anything on resilience, I'd like to make clear, and I've been told to do this, I do not speak on behalf of the IPCC. I do not speak on the behalf of AMAP, and I definitely do not speak also on the basis of the Lancet Commission. So whatever I say is my personal views, and it's important to keep that in mind. Resilience, I don't know, quite simply is the ability to withstand change. And how you do that can be multiple. We've heard over this conference of various, adaptation, various options open. But to me, it's quite simple. It's the ability to withstand any kind of change. It could be a conflict. It could be a health emergency like the pandemic. But if you're able to respond and you're able to find solutions, whether they are local, regional, national, or global, I think that's, in a sum, what I think of as resilience.
Thank you. I think I would like to build on that because from my perspective as well, and being part of the Norwegian Red Cross, which is also part of a wide global movement of the Red Cross and Red Crescent, I think it also really, it's all about the people. And so it's about the resilience of each and one of us, but also feeling connected and feeling that we're part of something and there's something at stake.
Yeah, I can agree. What's left to say for me here anymore? But I think also the resilience, it needs to be considered at the individual, at the community, at the national, at the European, at the global level. So I think there is so much to do to improve the resilience so that we can withstand with all the changes that are happening in our societies.
But it's kind of reflection that for different people, this resilience means different things. And so it's really complex, but people are often kind of looking for simple things. And how to go to the simple things, that's a key issue. And maybe those kind of things also has to be a bit more regional. But if you think about resilience in Nordic countries, and just now we are like we have a threat, for instance, like we thought about securities and etc. So, what is Finland doing to increase resilience at the moment?
Well, I think the security issues are on the top of the pack at the moment. We of course have military service, and there are lots of efforts put into improving the security. That is because we have over 1,000 kilometers of border with Russia, and of course the previous years events have increased the efforts to strengthen our resilience about the security. Regarding climate change, I think we are considered as quite resilient at the moment because we don't have that huge events occurring due to the climate change. But I think there are lots of things going on the security side. They are not telling that what they are doing exactly to the population because it's quite secret things. But yeah, that's been in the news a lot.
How about in Norway? What you are doing?
Again, I would have to speak on behalf of the Norwegian Red Cross, but we are the biggest voluntary preparedness organization in Norway. And so we have our volunteers are present in the local communities. And I think that's really one of the strengths, that you have people that are close to people. And if you have extreme weather events where infrastructure is broken, we really have our volunteers who are close to the people and who also have that trust in the community. And I think we also see that across the world. We heard from our colleague in Burkina Faso yesterday, who was also speaking of this, that the volunteers, they are in the communities ahead of a crisis as well. So when you have a crisis, they are already there. They have that trust in the local communities. So I think that's really our perspective, and we would like to see, of course, that the governments use the resources that are within the communities and the voluntary organizations, so that we can really find each other and work together even better. Because resources are also getting more scarce, so we all need to really work together.
Shilpa, but those organizations, you are not talking about them, but what you see, what good they are doing?
Yeah, I think resilience from these organizational perspective, I think the resilience actually is us, the scientists. I think we are incredibly resilient because I think the threats increase every day. Every day you open up your email, there's a new kind of threat, to these organizations, and you're left dealing with, okay, how do we respond? But I've never heard scientists who give up. There's always a way forward. And what I can say from taking all three hats on, for example, the AMAP, where I've been involved with them for quite a few years, they have a problem that the Arctic Council has banned any in-person meetings. So it's no longer possible to meet your colleagues ever, as long as this conflict with Russia and Ukraine continues. Because Russia is a part of the AMAP, and considering the Arctic without Russia seems a bit senseless, and Russia does not allow any in-person meetings anymore. But this has not stopped the science. I mean, there was a setback for a while, but now we meet as friends. These are not official meetings, but we meet, and we are already talking about putting out a small report next year. I also think for the IPCC, there has, of course, been concern, and there's a new report out by the Carbon Brief, and I advise you to read it. It's about all the participants in the IPCC. It's in the open literature and available. And it talks a little bit about this issue, but you see there that in spite of the problems in the US, there are 200 researchers from Europe, a significant amount of researchers from the Global South, 55 researchers from the US, of which I know 5 are from the university, but I don't know where the remaining 50 are from. So the scientists are there. They still want to work on climate change. There hasn't been any talk of any stop on this work. Of course, there will be problems. There will be problems in the acceptance of the report and so on in the years to come. But I don't think anybody is currently concerned with that. They're more concerned with the science of it. So I think the scientists are doing a great job. So I think we should just clap ourselves, clap ourselves on the back and say we're doing it anyways.
But a bit still more about these Arctic things. How climate change is affecting those interests in Arctic, and is that kind of also affecting global resilience?
Yes, the Arctic is a continuous problem. The problem right now is the lack of data from Russia. There is no open data available anymore like before. We have no Russian researchers ever involved, so which means a huge problem that you're not going to get a new generation of researchers either, until you involve them. So this is going to be an issue because the lack of data means we have no idea what is going on in that part of the world. And I think formulating any policy without having the involvement of these researchers is going to be problematic. And also a large part of the AMAP group was actually researchers from the government in the US. And unfortunately, with the current crisis, they have all withdrawn. Also, currently the government is closed in the US, which means that they cannot officially participate in any meetings. So this considerably slows down all the, so it's going to slow down the science. But I still think we have a lot of satellites, a lot of information that we can use to try to cover the gaps. And I hope there will be a way forward also for the Arctic.
Yeah, Jason, I was thinking what word to use, and I thought political restructuring is happening maybe in US. So how this is affecting the kind of, I think US used to be kind of one of the leaders, like putting science and also policies and etc. Is that changing at the moment because of this political restructuring?
I mean, yeah, the simple answer is yeah, it's changing. Is the mic not on? No. On? Yeah, there we go. Is it changing? Yeah, it's clearly changing. I think Shilpa just laid out some very concrete ways it's changing, and it's creating deficiency much more than for individual resources and researchers in the US. I mean, it's a global impact. I think, when the US is at its best, it's really, creating applied and practical science from pretty phenomenal research. I mean, we have a great history. I mean, pound for pound, there's countries who per capita do better. I mean, Britain, but I think the conversion of research into practice, into policy and impact is unquestionably, we've been very good at being innovative, and not in a generic sense, and applying adaptation and mitigation strategies. I think what's happened, though, if there's not a political will to apply those and things become overly ideological, really deficient, self-defeating situations emerge. And let's just take defense. We've been talking about defense a bit with the war in Ukraine. Well, it gets hot on those steppes. People think Ukraine's cold, but it gets really hot in the summer. And Finland might be resilient now, but one heat wave and you have a bunch of unacclimatized soldiers who are really good on their skis in the winter, and infamously so, they're going to have a harder time in a heat wave if there's no resilience and thought process into that. And so the US led on that really practical understanding is like, if you're going to fight in hot places and if you were going to do that kind of work, they had an incredible outfit called Usarium. And because it wasn't ideological, it was making sure you took care of your soldiers, you took care of your fighting force, you took care of the resilience of them and your allies. That was all data-driven. And what I've seen happen in the US has been the dismantling of systems that were apolitical to protect both the service, the military, the armed services, but the gifts that they gave the wider society and the world in terms of guidance on heat stress, in terms of how to mitigate it, in terms of like really the foundation of all of our work came out of the US military, all of it. Mark Buehler's research on core temperature, the initial guidance on how to take care of people in the heat. And if we lose that due to like a short-term ideological short circuit, I think that's just kind of the beginning, and that's greatly concerning. You know, and I guess I can sum up the fact that I can't be any more punchy than that, because I'm still funded 50% by State Department. I think everything I just said is very practical and very baseline logical. But there is an environment where, like, I'm frankly worried because of the 25 people that work for me, 10 of which I had to cut after getting half of our funding doged. Doged is now a verb. And really, they kill the entire agency. Now, they love our work at State, and it is good work, and I applaud them for liking it. It's important work. It's with Nepali migrant workers in the Middle East and making sure that they're not exposed. But you are constantly worried about saying something that will put everything at risk that you had no idea would be offensive. Because Laura Loomer or some influencer sees it and goes, he's not loyal enough. And that's kind of a horrifying place to be. And what's that going to do to our universities? What's that going to do with the vigorous debate? And I'll sum it up this way. I think a successful democracy boils down to one thing. The country funds its own dissent. And what do I mean by that? Good work is dissent. When you say, this trade agreement's not working, it's causing harm in our supply chains, that's dissent. But it's informed dissent, and you're trying to fix it through research and interventions, right? To protect workers in sugar or crops or whatever, supply chain. When you fund the arts, artists are by nature rebellious and they dissent. When you fund public media, that's dissent. And I think we're stronger and better for it when we fund dissent. And I think it's not even in the interest of people who want a more centralized government when they don't fund any of it, and there's no debate, and there's no knowledge, and I don't see a future where that benefits anybody.
Sagnik, nowadays India is the biggest country in the world, according to the population. How India could take a bigger role in kind of making examples of the good adaptation, for instance?
Yeah, I mean, we have started making baby steps in first making our country climate resilience for different aspects, particularly for the health sector, which is the focus of this conference. Several positive steps have been made. For example, now we have been talking about strengthening climate services for the health sector. And this is not just for India. So there are two regional body in the South Asia, Global South. One is SAARC, which is comprised of all the South Asian countries. And then there is another one called BIMSTEC, which is basically all the countries surrounding Bay of Bengal. And within these two regional network, climate change and extreme weather are very important. And there has been several initiatives to, for example, set up, as I said, the climate service, not just for India, but for all these countries. By that, what I meant is that because people recognize that there are scale gaps, you know, the kind of climate or weather information that is required for the health sector to understand the impacts, to then develop adaptation plan, and then also track progress. So some work has started in that direction in a coordinated manner. Second important point, which is again, you know, very right step, I would say, is that there has been a lot of effort in the last few years, particularly after COVID, on strengthening the health sector itself, particularly, you know, strengthening the health informatics, collating a lot of data, because at the core, you need data really to support any actions. There is now a surveillance program started in India, and there has been discussions that how such program can be sort of regional, where you again, you know, sort of establish regional cooperation. For example, India and all the neighboring countries contributing to it. Of course, you know that that part of the world also has a lot of conflicts.
So it's not that easy really to sort of foster and further strengthen regional cooperation from that perspective. But one good thing is that everybody recognizes, despite the conflicts and the regional tensions, the importance of having such system at place. And that's what actually is kind of driving some actions. But of course, as I said, it's all baby steps. We need to go further. My personal view is that, I mean, we are not really ready, but there is potential for India to take lead, at least in the global south first, and demonstrate what can be done, and then probably, we can think of further expanding based on our learnings.
Yeah, I just wanted to add one thing. It's really nice to hear that in India you are starting with the adaptation plans. We in Finland probably were one of the first countries to have a climate change adaptation plan for the social and healthcare sector that was published in 2021. And that was a result of a really active collaboration with the Ministry of Social Affairs and Health and us researchers that are working for the ministry or in a governmental organization under the ministry. And we have been pushing the ministry to also then provide some funding to implement also this adaptation plan. And it has given a backbone for the actions, also for other funding applications, that there is this plan and we are implementing the plan by doing this and this. So it's really good to have these plans also from that perspective.
I've had really the joy of being able to work in India, from Delhi down to, cross-cutting the whole country. Chennai, I've worked up in Chandigarh at PGI, and I think it's not a particularly patriotic thing from my side, but I think while the world's squabbling, the great three powers right now, it should be the Indian century, because you're at probably the best technological school in the world. I mean, I think MIT thinks it is, but you are. And I think the possibilities in India could be, it's a complicated, big, giant country in a tough neighborhood. But I think that there's an opportunity for you guys to lead, because you're kind of staring down the barrel of a lot of threats. I don't need to tell you, every summer is worse, but the possibilities out of India, I think, are something we all need to keep our eyeballs on. And I just wanted to recognize it, because some of the brightest and best I work with are there and staying there.
Yeah, Shilpa.
Yeah, being Indian at heart, I would totally agree with you.
Also the food's better.
Well, but I think the issue for big countries like India, I think I was at the COP28, and India refused to sign the climate and health agreement at the COP28. I don't know if that has been resolved since. It was one of the few countries that did not sign the agreement. And the main reason for that was not that India doesn't care about climate change and health. It's a leader in a lot of local initiatives, and it's, as Sagnik said, it's doing a lot of good work. But I think the problem is the conflict that occurs with these priorities, because I think signing that agreement as it was written, it had a phrase which talked about delivery of vaccine, delivery to rural areas, and that they should not be air conditioned. If I'm right, I'm not quite sure. But I think there was some conflict because India produces a large amount of vaccines. It's the biggest vaccine producer in the world. Cutting down on any kind of air conditioning is not possible at the moment. Those vaccines will not survive. So India said, you can't ask us to cut down on air conditioning for our health sector because this is impossible. And so India refused to sign that agreement. So it's also a question of priorities and what the government prioritizes in these kind of agreements.
Just come back to technologies. In adaptation, do we need high-tech or low-tech technologies? If you think about health adaptation, do we need high technologies or low-tech?
No, I mean, of course, there is endless possibilities of technological innovations in developing resilience. My personal view is that, often we talk about, technological innovations and other things, but we underestimate the local knowledge. There has been tremendous amount of local knowledge. The way, people adapt, for example, in India, again, multiple climate, any climate stressors you think India is impacted. However, people have been adapting even without, scientific knowledge, data and all. And I think, for example, heat. in Delhi last summer, it went up to 49 degree. And there has been lesser mortality compared to many other parts. I think this is really a good opportunity to understand how in low resource settings, locally people are adapting and then bring them. But of course, when you talk about technological innovations, already, we don't need really, remarkable high level innovations. Even simple things can work. And I will also make this point that, particularly now we have a digital health mission where, again, the things is, and again, this has been strengthened further after COVID, where the healthcare system, particularly in the extreme remote areas and all, there has been multiple startups working in sort of providing telemedicines and other things, consultations digitally, providing right inputs. Vaccine, Silpa, you mentioned about it, but that's a different aspect. But what I'm saying is that leveraging on this kind of innovations, and because India, it's a really good place of having this startup bloom. There's so many startups working on multiple aspects. All it requires is really leverage, on these new initiatives and sort of utilize them in an integrated way so that we can actually, adapt and develop these things.
Yeah, like in Estonia, we have one new word is simple technology. So often things doesn't have to be very complicated. And just now in this low and middle income country session, there was example of the house with a metal roof. And there was a problem that it overheats. They paint it white. But then I thought about the kind of houses that were built 50 years ago, 20 years ago. They had a different plant-based roof, and this is actually much more resistant to the heat. So we should sometimes maybe use those knowledge that people have had, and not kind of taking in new things. And that's also one possibility. And this often doesn't cost much. So it's just a bit more work, but of course people are maybe not always having these skills anymore, because people used to learn from the grandfather to the father and so on, but just now people are watching YouTube and maybe they are not there. But like in NATO, US says that Europe should do more. How about in climate change adaptation? Like, should Europe do more? Tia, what do you think?
Wow, that's a big question. But again, I can say I think definitely Norway should do more. We are a high resource rich country. We've been a massive contributor to climate change with our oil production, and I think it's not being addressed enough in Norway. And as the Red Cross, as someone who really sees the humanitarian consequences of climate change, and we see how climate change is driving humanitarian crisis, not so much in Norway yet, but we will see increasing consequences in Norway too, and definitely globally. So as part of our responsibility and mandate, it is to sort of challenge the Norwegian authorities and the government to do more, to be more ambitious in their climate policies. So I think definitely we need to increase the rate of emission reductions and also do more in adaptation in Norway.
Mm-hmm. Yeah, Chase, you want to comment?
Really quick on the tech piece. I love hearing somebody from IIT say we don't need a whiz-bang shiny object to solve a problem, that we should look at local knowledge as well. There'll be utility for those things, but I also think we should not underestimate organizational operational technologies, meaning org psych, operational management. These are technologies too that need to be implemented and evaluated, and they are often more akin to a solution, in my experience, actually doing interventions than any object or piece of like cutting edge knowledge. So I wanted to mention that I think we overlook that a lot.
Mm-hmm. Yeah, like if you're living in urban areas in the cities, those kind of old technologies often are not possible, though. Then you need something more. Yeah, Shilpa.
Yeah, I think it's an easy word, simple technologies, but they're never that simple, in my opinion. They appear simple on paper, but the actual implementation is always problematic. And I think one example I have is, long ago when I was working on non-CO2 greenhouse gases and methane, I was working a lot on methane. It was part of my PhD. And the idea was, well, there's a huge amount of methane emissions from the rice paddy cultivation. So change the rice paddy practice. It's a really low-hanging fruit. You can get all this, capture all this methane. It doesn't happen. Rice paddy farmers are not going to change their cultivation to respond to these kind of, constraints, simply because we don't understand fully what changing that kind of technology means, how it can impact their lives, how it impacts the soil, and a number of other things, And also, I think the agricultural waste burning in India is another issue. It's been in the news forever. It's a major factor for emissions, especially in the northern belt. But it's not easy to ask the farmers to stop burning their land because it is by far the cheapest option available, and the government alternatives do not work or are not very attractive for the farmers. So I don't think any of these changes are very simple. They need to be really investigated and looked at from different perspectives.
Jana, what kind of investigations, you are a researcher, what kind of investigations we need?
What we need, I think attrition was mentioned this morning in a couple of sessions, so that we need to tell the decision makers what the climate change is actually causing, or how many numbers of deaths or hospital admissions are due to the climate change, not just the heat waves like we heard this morning. But I also think that we need to put more euros on these health effects, because politicians, they talk euros or dollars or pounds or whatever unit of money there are. I think at least in Finland, we haven't been able to measure this environmental health monetary value for many of the things, and that's why they have been underlooked then by the decision makers. And this is one major lack in the research that at least we have. I don't know if the others are in a better position.
But Tia, what kind of challenges you see in healthcare? Because Red Cross is also working with the healthcare.
Yes, and I also just wanted to actually pick up on what you said in terms of, being here over these 2 days, I've been learning so much, and there are so many inspiring projects and so much inspiring research, and I think we do have a lot of the knowledge, and it's about how can we implement it and how can we go from evidence to action, which is, it's a question of resources, it's a question of political will, but also I think one of my key takeaways from these 2 days is that perhaps we also just need to sort of think very differently about how we communicate this. I heard so many people starting their presentations saying, climate change is one of our biggest challenges. It's really affecting our health. But we all know this. We all agree, everyone in this room. So maybe we need to invite in some of the people that don't already agree with us. Maybe we should have had more decision makers in the room, or I'm thinking maybe I should start attending the sort of petro conferences. And it's like, and we've been saying the same messages, and do I need to just say it even louder? I'm not sure if I have any answers, but it also made me think what you said about dissent and about artists, for instance. And I heard there was one presentation yesterday that really inspired me with working with artists, and I think just to think about how we frame our messages and to sort of break the sound barrier somehow. I don't have the answers, but yeah.
Okay, Sagnik, maybe you have answer.
I just want to. Basically take this communications piece. I think this is extremely important, and as scientists, we are not really good. We communicate to the journals and all, but communicating to the politicians, common people is completely different. And I had some experience over the last 12 months or so. I met several member of parliaments and top politicians in the country. There has been effort in India to do something, and there is now parliamentary committee interested in air pollution. And what I learned based on those interactions is that, they don't understand, the complexity and all. And so much science is out there, but nobody is making any effort really to distill it down so that they understand and act on it. Because directly, they ask that, what is it that I can do? And we have to come down to that level. And the other important thing, I think, in this conference also, it has been mentioned several times, and this is very important, that we need to really build momentum at the community level, because a lot of the things are kind of top down and top driven, and like, suddenly you decide something at the very top. Health is still a state issue in India. And I agree that implementation is not that easy, because even if you know what needs to be done, when you try to implement, there are multiple hurdles because it has to be done locally and all. So mobilizing community and then basically create that, because what we learned, and the air pollution is classic example, despite so much evidence it's impacting health and all, people are not really able to connect at individual level. And only when air quality, reaches that catastrophic level, people wake up and think about it. So I think we need to really work towards strengthening the communication part and then build momentum on, and reverse actually the top-driven approach.
Yeah.
Yeah, actually, it made me think also, and I've heard others say this as well across these 2 days, that the importance of sharing the lived experiences, and I think that's really powerful, because I think it's quite human we care about the things that are close to us. So seeing charts and figures creates perhaps a bit of a distance. So I really think, there's a power of sharing those narratives. And again, that's something that being part of the Red Cross, we really have that privilege, because we have our colleagues across the world and also our volunteers who are really like living this experience every day. And I mean, I don't know if I see you here, but I mean, having our colleagues from the Ukrainian Red Cross sharing their experiences, it's extremely powerful, and it really reminds us that this is not something abstract, but it's something that they are really experiencing every day. So I want to say thank you to you for coming as well and sharing your experiences, and for us to having this platform and inviting even more like civil society organizations. I think that builds also something into the discussion.
Jason, actually, what do you think about this fact? Like, we have increasing energy prices, and then we have increasing food prices, and then we have a green kind of transformation. Are they connected? Like, people see that every day. Like, we are talking about climate change, mitigation, and then we see energy is getting more expensive, food is getting more expensive.
One of the reasons food's getting more expensive is because of lack of resilience. One of the hardest things to fund now is any agricultural enterprise. If it wasn't for like the Dutch Rabobank, I'm not sure how most medium, large, or even small growers would get a loan. I mean, there's like a few banks that'll even assume the risk anymore. So that means their loans are more expensive. That means you have more crop failures. So your food prices are going to go up. So that's an economic problem, right, at root, and then it's a climate problem ultimately. So I think to kind of tie it all together, and like I'm always very loath to like have a theory of everything. I'm not, a physicist, but I think if I had one, it would be about shifting the approach. There's a lot of great assessment I've seen, and a lot of identification of problems when I looked at the posters and attended sessions. I think a risk mitigation approach that kind of follows this framework that I'll lay out really quickly, and that I think we've done very effectively. So it's not just theoretical. And we were able to change something and get people protected throughout a couple key commodity supply chains and able to scale that into other sectors and geographies. I think you take a risk reduction and you focus on interventions. Why interventions? Because interventions will help you understand three basic things. What is the risk? Because you assess first, right? Which all of you are very good at. I've seen all of your amazing work. So you assess the risk, but then you go in, you come up with a sensible intervention, do it horizontally with civil society, with the workforce, with the employer, with the policymakers, the powers that be. It takes a little bit of time, but you do it. You test that intervention, and you kind of look at three buckets of metrics. Harm reduction on health, impact on productivity, So don't bias yourself saying increase productivity, impact on productivity. And return on investment. The return on investment should be for the firm, the worker, especially if they're paid by piece, or the workers or the community that has to participate. And then also for the society, right? Because you have a bunch of sick workers or people that are, paying too much and, too stressed out, and you're going to have lower productivity, you're going to have higher healthcare costs, and you should cost all of that out. So you should look at the ROI from the firm level, the private industry level, the community and the household level, and also for the country, especially like health, labor ministries, social security systems. And it all seems like very common sense, but we do not see enough of it. And we had a beautiful project funded that got cut, and I hope we can redo that, because that was the approach we were taking and it was working throughout Mesoamerica. But that's what I would encourage us to do, is more intervention work so that we can address why the things are happening. I think we know a lot of the whys, but we can intervene and understand what the risk is and the costs are. And then when you do that, you can explain to a policymaker, you can explain to a family through a good communications team why your food's going up, what can be done about it, why your energy prices are going up, what can be done about it, and then what some of the solutions may be. One intervention in India may not be the same intervention in Finland, but at least you start building a framework. And this is a key thing for academics, I think. I came in late to academia, is having comparable protocols so you can scale. And I can't tell you how many times I've seen people work in the space we work in and they never picked up the phone. And we could have saved a lot of money and time by having comparable protocols across sites and sectors. So risk reduction, intervention, that should help explain to people what's possible, what the problem is, and how to save money.
Can we also have some questions from the audience, maybe, if we have a microphone?
Hi. The person who said they wanted to go to a Petro conference, go to COP in Belém. It's full of Petro executives and lobbyists. I'm interested in the relationship between democracy and resilience. And I think there's a lot of evidence that more democratic, less societies that are more equal are more resilient. So if the panel could speak about this, I would appreciate it. Thank you.
Can I just first, through the Belém, it's a genuine concern as well, though, because the costs are rising so much of attending those conferences. So we are seeing how civil society is like, they can't even justify going. And for the Red Cross movement, the Federation of the Red Cross and Red Crescent, I believe they are sending, like the tiniest delegation. So yeah, we will end up having just more and more oil and gas companies lobbying and less civil society voices. So that's a real concern.
Yeah, if I can then answer maybe or give some of my thoughts about the comment. I think democracy is really important for the resilience. I think if we see the divide to 2 or 3 or more different parts within the country, there will be more problems, like internal security problems. There will be more violence there. We are seeing these gang events in different countries and different cities. The drug problems and these kind of things are going to increase if we have more division within the countries. And I think in Finland we are also becoming more aware of this, that we actually need to really keep tight and try to save our democracy and not let the inequalities divide our country and our safety and security in general. Because if we have some common goals for everyone more willing to work together, and I think that will improve also the resilience there. It's much easier to make decisions about where the money is used and who is paying taxes and so on. So I think it's really important.
Jason?
Yeah, it's a hard premise to argue with, your hypothesis. Because if you have a more level playing field for more people, I mean, it's most likely going to be something like a social democracy, right? And then if that's the case, it's probably something that doesn't have a privatized health system, a privatized everything system. Ergo, it should be easier to collect data, understand what's going on, and introduce interventions at scale. Ergo, you can make better ROI and productivity, et cetera, arguments, which I do think countries need to do a much better job of paying attention to that are in that situation. Scandinavia, even the UK to an extent, they would really benefit from taking that kind of framework more than they are about how they can make investments and actually come out ahead on these things. I think they do better than other places. But yeah, I think your hypothesis is correct, and I think we've seen it in the last several years.
Yeah, while I agree that your hypothesis is correct and strong supporter of democracy, on the other hand, there are countries that don't have democracy in place, but doesn't mean they're not resilient. So I think it's an interesting question. The example of China, which has done immense amounts for air pollution. You know, it's a country which has really, really reduced its air pollution, for example, in Beijing. They don't have a democracy, but they have a system that works. So I'm not quite sure the connection there is a connection, but it's not a necessary condition, in my opinion.
Other questions?
China works for who, though? I mean, just, you know, there's entire populations that have turned into slave labor and put into camps and sterilized. So.
I'm just talking about air pollution.
Okay. I'll let you off the hook on air pollution. I agree with you on too much to pick a fight over Xinjiang right now.
But how about the most vulnerable? Like how much we should think about how to make the voice of like women, poor people more kind of hearable to have ideas. Because usually like it was like oil companies, they have a voice, civil society a voice, but then we have poor people that are really affected by those climate change and health effects. How to make their voice more hearable? Yeah.
I'm not sure that I have the answer, but I think it's extremely important, and it's important to ask ourselves that question too, like which are the voices that are not here today, and the ones that we are not hearing. And again, as the Red Cross, that's really one of the things that we strive to do, to lift some of those voices, and we are present in some of the most fragile, vulnerable countries. And just one small example, we were working on this policy report last year, really trying to show the health consequences of climate change in an African context, and we wanted to use different countries as case study examples. And we wanted to really lift some of the most vulnerable countries that are experiencing climate change and conflict. And our experience was that trying to sort of have those voices, it's extremely difficult, and you don't really get to show the full picture, and there are lots of limitations. But at least trying and bringing some of those voices and showing them, it's a place to start, but it's not easy. And again, a very concrete example, we were inviting colleagues from the National Society of Burkina Faso and the Ministry of Health, who were unfortunately not able to come because of visa issues, because the embassy is closed down. So that's also a very concrete example of, we have to keep trying, but it's difficult.
Yeah.
No, you go. No, okay. Well, quick. This is really quick. I think NBEL did it. NBEL won. Like, that was an amazing grant, and it shouldn't have worked. Like, you know, we had like, what, 4 work packages for policymakers, for peers, for the public, and what am I forgetting right now? We had policy, public, peers, and there was a 4th. Oh, yeah, well, anyway, great. This is called jet lag.
Maybe someone of your room.
Come on, where's Miriam? So, but it worked. I mean, and we moved the needle, and part of it was a huge media campaign. I mean, they very nicely funded La Isla Network to do a lot of media, and we got stories in The Guardian, and we got stories out through several news sectors, and I know for a fact that moved the needle on the issues that we work on. And I think that's one issue, and I think the Commission would be wise, and the European Union would be wise to fund it again. I mean, that needs to continue. The collaboration was incredible, and, you know, sticking that many academics in a room, you know, in a group, and being that effective, and the fact that we're back here basically through force of will, thank you, Hans, and Cicero, I think it says everything. So that funding should be there to continue that. The second thing is I was at EPICO last week, and I did a 10-minute introduction, and my colleague who grew up as a child laborer, whose father died, his uncle died of the kidney disease that I work on from heat stress, he spoke for 45 minutes and gave one of the most powerful speeches I've ever seen to a room of 450 researchers. And I think we can do more of that. And not put people on like they're, like, oh, look at this curiosity, but give them their space and make them the keynote. They've got the story to tell, and this kid has experienced it from a child laborer, someone who suffered loss, and now as a researcher. I think we can hear more of that.
Mm-hmm. Yeah. Sometimes we need practitioners like who have really kind of gone through those things. But Shilpa.
Yeah, so as Hans said, I'm also involved in the Lancet Commission for Climate, Migration and Health, and I was invited as a climate and health researcher. I know nothing about migration, so it's been a bit of a challenge trying to get the chapter together. And then we started doing some kind of scoping review, you can say, on looking at literature that actually addresses vulnerable groups. And it's really, really difficult because you can't tease out climate change from all the other issues that these groups face. So talking about women and children, or whoever you talk about, there's so many other issues that they face, especially, you're talking about migrant groups, they come from countries that are conflicted, and then they come to Europe. And then even we decided, okay, let's forget about where they come from. Let's look at the life they have after they come to Europe, focus on their living conditions. They're happy. Most migrants who go to these clinics, where we have an intervention of some clinics in Paris, which are set up, mental health clinics, which are set up only for migrants. So you're a migrant, you can go there, it's free, you can go and discuss your problems and what problems you have. But when so some researchers went there to try and tease out climate change, but they said, oh, that's not a problem, so to say. But it is a problem, right? The reason they migrate could be climate change related. So for example, Bangladeshi migrants who are, one of the dominant groups in Paris, they migrate because crops fail. But it's not the only reason. There's an economic, so many other things that I think teasing out climate change is going to be a very, very big thing in the years to come.
But Sagnik, do you see also local migration, for instance, in India, people going from one state to another? Not always.
Absolutely. Yeah, I think, in the Indian context, the local migration, particularly the interstate migration, is a big issue. And there has been tremendous impact on all aspects. For example, people moving to these economic centers like Delhi, for example, the capital, or Mumbai in the western part of our country, and this is the reason why the population is booming in that national capital region, and we have reached almost 30 million perhaps by now in this part. And then yes, I think then what happens is that most of them are living in kind of semi permanent kind of structures or slums and all, adding much more complexity. And what happens also is that, and I'm giving examples from Delhi, typically this migrant, there is a large population of this migrant people is that they get this temporary employments, doing labor works for various the building construction and stuff like that. And then this pollution season, which is starting now, kind of October till January, what happens, we have these graded response action plans, and whenever some activities stop, like the construction activities stop if air quality breaches certain things, and these are the people who are first impacted. So there has been some efforts in providing or rather I would say the way things are being done, the way migration, giving them some sort of alternatives, but I don't think the current practice is actually working, and these people are tremendously impacted. And in the last couple of years, because of this repeated halt in their economic whatever they're earning, now there is a kind of reverse migration also is happening. A lot of people are going back to their own states and all. So I really do not have an answer to how to solve this problem, but I think this has been this is very, very important problem, and India has seen this in a big way.
Saw it during the pandemic. You saw these horrifying, and those of you who followed the news from India, it was horrifying because you saw the workers walking back to their villages. And the government had no idea that India had so many internally displaced migrants. They refused to stay in the cities and wanted to return home. There were no buses or trains running. India is a huge country. They walked all the way, leading to the whole country then deciding to stand and serve them water and food because this walk is long. And then the government launched some trains, I think, to allow them to get back home. But it was just an idea of how big this internally displaced population is in India.
The hour is running really fast, but often decision makers want very simple solutions. Can any of you say one simple solution? So let's start from Sagnik. For India, what's a simple solution, if the politicians will ask you?
Simple solution for
increase adaptation, resilience. So what's like an easy thing we can do? So not very complicated. It can be also a small thing.
I mean, it's a really tough question. No, I'm not sure there are simple solutions. Of course, you have to have political will, because we have seen there are countless examples that if there is political will, things move. Otherwise, it is not. Even if you have all the solutions are there, and this is one example why we have been struggling to deal with air pollution. But I would say, like, if there is a political will, I think the one thing that will move, and there is some discussion, there is some effort from the government also, is it's not a simple solution. I'm just saying that one thing that is lacking is behavioral intervention, and that's a very tough thing. But because, for example, even if you have solutions, how do you really make people adapting to that solutions? And then this is one thing that social scientists have been struggling to really understand. And often in our discussion, I mean, at least in India, I know that, we do not have really, and now we're trying to bring social scientists and economists also to this dialogue to understand really, why people are not behaving.
Okay. No answer. Jason?
Okay, I'm trying to thread some needles here. I agree with you. Something that's really bothered me about Norway, a country I really love. I'm wearing one of your sweaters right now. It's not lost on many of us that you made your money on dead dinosaurs, yeah? Lots of dead dinosaur money. And I have yet to see that reckoning from the Sovereign Wealth Fund utilize that money in a way that can help this critically important issue that they contributed to. And like, we could talk about Royal Dutch Shell and Texaco and the rest of them, but this is a sovereign wealth fund funded by a state oil company, and we already have Cicero, who's a great project manager. Like I said, NBEL 1 had no right to work. I mean, I saw that thing on paper. I was happy to give it a shot, but I honestly thought, like, I don't know. Let's see how this goes. And then I met Miriam and Gunnel and Kristen and the team and our colleagues, and I think we did a lot. And like, a really clear example, they paid for the coverage of the workers in Nepal dying in the Middle East. That's how we got our State Department project funded. And I know there must have been other stories for others of you that, like, the information that came out of that led to funding and action. So I think one solution is frankly money. I think the brains are here. Some of the interventions are here. I think maybe we should think about talking to Statoil and the Sovereign Wealth Fund and funding their homegrown, amazing operational team at Cicero and get us back to work. Because it's a phenomenal team, and we are really good at diagnosing. Some of us are really good at interventions, but we can't do it if there's no will, and we can't do it without money. So that's my solution. Let's go hit up the dead dino money in Norway.
Shilpa?
I'm going to just put my scientist's hat on. I think this conference is an excellent example of an intervention. We are holding a conference on a topic that's relatively contested. Climate is contested. Global health is contested these days. It's a huge topic. We haven't talked about all the issues in global health. So, But I think the fact that we're holding a conference, providing a neutral space for a lot of researchers from, I don't know how many countries was it?
39.
29, okay.
30.
30, okay. A lot of countries to come here and talk. So I think good science, and of course communication of the science is important to the policymakers, but you can do only so much in a lifetime, I think. So if you do good science and you do it well, and you talk to people, you know, learn about new things, I think that's already a big, big contribution. So I wouldn't say you need to go very far. Hold more conferences, and in the next 2 years, we hope you'll hold the next conference as well. But I think, of course, money and other things are important, and I think behavioral change, as you brought up, is also very, very important. And I just have an example from just a couple of days ago. You know, I have a PhD student in Ethiopia, and he's working on solid fuels, which is a classic issue that many people from developing countries are aware of, the use of solid fuels in households, you know, and how it contributes to pollution. His whole topic is about changing the design of the kitchen, you know, all of which, you know. But then I see a video, he was sick at home, and he had a video on of him at home. And then he passed through the living room, and he, you know, the main reason in Ethiopia for using solid fuel is making coffee, because they have a very, you know, traditional way of making coffee. In India, it's making the rotis, that's important. And it's almost impossible to change practices. People don't want to change. And this is a guy working in the field, and you see in his living room, he has a coffee machine set up and a lady sitting down and making coffee. His family was away, making it the traditional way in a flat, you know, with the 3-stone that you use for coffee. And it was like, how is it possible that the researcher is working in the field still continues with this practice? So it's really, really difficult. These kind of behavioral changes don't happen easily.
Yeah, I pretty much agree to everything that's been said, and I think definitely political will is like, it needs to be there. Like you've been said, it's been said as well, but with the pandemic, we saw how we could change things when there was that political will and the pressure was there. And I also think one of the things that I've been taking away from being here is like, I mean, I'm not a researcher, but I think if I were to go into research, it would be behavioral science, because that really sort of, how come we have all this knowledge, and why are we not? Yeah, it's right there in front of us. So
Yeah, it's not so much the heat; it's the asshole makes you work in it.
So I think that to get the political will, we need to raise awareness among like others, not researchers, but the public, the decision makers. We need to get the critical mass behind our research results, and then those people can select politicians who can make the right decision. So let's increase awareness.
Yeah, me and Jana, actually, we were in the same conference in Lahti. It was a bit more than a year ago, and the mayor said, mayor has to believe in the things, and then things start happen. So we must have politicians who kind of have right values, and then things might happen. But that's our kind of choice, what kind of politicians. But it's really complicated, like how the different lobby groups are affecting the elections and our choices, and so it's not easy. So it was quite a complex thing, and of course resilience is also a complex thing, but it's one of the keys to be more resistant to the change that is actually happening now. Climate change is happening, it's not a future thing. We know that, the others maybe not yet, everybody. Here we know, but we have to be more active outside. So, yeah, we are 8 minutes above, but let's have a
Thank you very much for this event and this panel, which I think is very acute for a person like me coming from Ukraine. But going beyond my country, just to bring the discussion back home, what is put up on the screen when we see that the climate things on average across the world are not improving according to the indicators and scientific data. For conflicts, I can say the same. There are more flare-ups across the world. You can call it war, international, national, whatever is the term to be coined. And then I think, should focus more on what the priorities are in this polyphony that is happening around. And my question actually is about those countries which are affected by the conflicts, and by default they're affected by the climate change. This is true for any country. So how does that country function in this condition that all the systems are at a greater strain and maybe not able to operate? And at the same time, you have these competing priorities to deal with. And most probably climate change would not be in the first 5 or more on that list. How can the global community act and impose things on those countries? Do we have any international organization with strong powers to do that? Or what's the solution if we speak about behavior change, taking a country as such in this case? Thank you.
Any volunteers?
There was a really great presentation in my session that I shared from Israel about you already have these apparatuses for security. Why don't you integrate that in line with being prepared for climate crisis and emergencies? And obviously that part of the world's quite loaded, but I mean, just take that out of your head for a second and just think about the truth of that. And that's what we were talking about as well with the US military. Like, it isn't an either or. Like, if you want force readiness, if we want to talk in military terms, if you want force resilience, if you want all that, then you need to take those things seriously and incorporate them. And things that traditionally in the US that have invested in the military have trickled their way down through the rest of the economy. I mean, the internet was part of DARPA, the Defense Advanced Project. So there's a lot of examples, I think, of like trying to show people that these things are not separated and they're integrated. Now, how to get in that room, that's going to depend on the country and the people. I don't have a quick answer. And as far as like the international community, well, I think the international community is in a real hot mess right now, and I don't have a quick answer on that either. I mean, I don't think that's up for grabs right now. But I think that the more we can show that these things are not separate and that it's not an either or, and that they are part and parcel of having a more affordable government, of delivering better care and services, of being more prepared in terms of defense from aggressors, to me, climate's a big part of all of that. And if you can integrate that with existing systems, then you're going to be a step ahead. So I don't know if the team from Israel is here, but I thought that was a really good talk and was smart.
Thank you, but now we have to finish. Yeah, and everybody can come here. And
can we get like a round of applause for you and your team and Trin? Like, you guys did this by force of will. It's amazing.
And it's not only me. Can everybody from our team stand up?
Yeah, it's an incredible team.
Yeah. And of course, team means everybody here. It's not only us, because you made the conference. We just organized, but you made the content. But let's have a group picture now. Here. Yeah. Just come here, I think. Or. Oh, okay. Sorry. Okay. Everybody comes here. Jana is a boss now.
Somebody holds the bridle.
We'll throw it.
Can we throw the bouquet?
No.
I was like the bridal bouquet. Can we throw it at the end of the conference?